Yes? Yes. Hello, hello, hello. Good morning. Hello, everybody. Can't really see me. I'm going to be over here. It's too high for me. All right. A very, very good morning, everybody. And salam alaikum. A warm welcome here to the Health 2.0 conferences here in Dubai 2024. My name is Maxine Fernandez, and I'm thrilled to be your host. And we're going to become best friends over the next 3 days. And we're going to explore the future of healthcare together. We've brought together an incredible group of visionaries, innovators, and leaders from across the globe. Over the coming days, we'll dive into important conversations about groundbreaking technologies, reimagining patient care, and finding solutions to some of the biggest challenges that face us in healthcare today. This conference is more than just discussions. It is an opportunity to connect, collaborate, and share ideas that can create a real impact. The conversations we have today could lead to innovations that change the way we think about the healthcare systems, not only locally, but worldwide. Now, as you connect and learn, please do use the hashtag Health2Conf, as in CONF, and to share your thoughts, favorite moments, or even just a quick selfie with your new connections that you've made and post it all over, because we know if we don't post it on social media, it never really happened. Now, also, before we begin, I would like to offer my sincere gratitude to our gold sponsor, Invisa Health, and our bronze sponsor, which is Team Up Corp. We are really grateful for your incredible support. Now, as we gear up to get ready on this transformative journey, let's make today truly unforgettable. We do know it's a holiday, so happy UAE National Day to everyone here in the UAE. And to kick things off, we are going to dive into a fascinating conversation on the role of remote patient monitoring in digital health, the real-time insights and interventions. In this panel discussion, our esteemed panelists will explore how remote monitoring tools are transforming healthcare delivery, bridging the gaps in care and empowering both patients and providers with actionable data. To guide us through this exciting conversation, please help me welcoming on stage our moderator, Dr. Clint Steele, principal at CJ Steele, and of course our esteemed panelists, which is Saranas Narbutas, Suraj Madhavan, Yussi Mata, Tim Nell, Professor Dr. Dmitry Mikhailov, and Amit Kumar Bajpai. Please give a round of applause for our moderator and our panelists.
Is yours working? Oh, there you go. Good morning, everybody. My name's Clint Steele. Thank you for joining us. The panel actually met prior to this event, and we've worked out some questions that we want to go over. So I'm really just the person who puts the questions. Everybody else is more qualified, so they'll be the ones who will actually be answering them. The first question that we came up with, and this was after we went over some review papers on the topic, and we noticed that while there was a lot of conversation about things such as wearables, understanding the technology, dealing with data, some other less developed topics that were alluded to that we'll go into later on, there wasn't a lot of conversation about the topic of the opportunities and the needs for research in this area. So, for example, what opportunities are there and requirements are there for clinical research moving to the future? And the two people who had probably most to say on this were Suraj and Dimitri. So we'll start off with Suraj. If you can sort of talk to us about the research opportunities that are presenting thanks to remote patient monitoring. Try again. There we go.
So Thanks, Clint. So it's a wonderful opportunity to speak about clinical research. Clinical research is all about collecting data from patients participating in clinical, which would be later taken to evaluate whether the medicine which is being tested is effective or not. And this frequently happens at the conventional trials typically happen at on-site data where patient meets the doctor at the site and this data is collected. A real sort of a remote patient monitoring would enable to have larger data collected rather than at that specific points, so which would give us a better insight whether the medicine being tested is having any undue side effects or having more than the expected benefits coming in. And this would also add a difference if the real remote patient monitoring is happening in real-time basis. So that would become real-time patient monitoring, which would be a combination of wearables as well as app-based systems, which this would really give us a larger insight happening worldwide, and that would enable the regulators to take a better decision on the medicine, as well as it could be related to the medicine, medical device, or could be a disease-specific aspects also. So that's going to be the future of clinical research with these, remote patient monitoring systems.
Gotcha. So just to follow on that before we move on, if you were to give one piece of advice to anybody here who might be a clinical researcher to really leverage remote patient monitoring, what would that be? And I realise I put you on the spot here.
Yeah. So having experienced one of the largest real-world evidence studies that we are currently doing. So I come from clinical research organization. So we are currently managing a 20,000 subject database in India on pregnant women, the data being collected. So what happens is you can go into tier 1, tier 2, even tier 3 level of cities because of this remote patient monitoring system. It would enable a deep penetration, and it would actually enable to accumulate a larger database which comes in. So I really would, support enabling real-time patient monitoring in all clinical studies across world, giving out a larger good purpose of making it paid back to the society again.
Thanks, Raj. Dimitri, did you have something specific to add on to that?
Yes, thank you. Actually, there are several technologies that are penetrating the markets of clinical trials. In Vital Play, we do so-called therapeutical games. The games where patients can be involved in playing because it's a gamification. And we particularly use it for ADHD patients, because with ADHD patients, you cannot bring them really to the hospital because they're out of their environment and they have to be tested in their environment where they live. And one more aspect is that this gamification, because they have problems obviously because of ADHD syndrome, they have problems of concentration. Gaming allow them to concentrate. And there was a great, actually therapeutical games movement started several years ago, and it's not that popular yet, but it will be popular. A Nature journal recently published a great article that's called Game Changer, where the games will be the future of therapeutics and remote telemedicine solutions. It's number one. And the second thing that we also faced with this very rare case of ADHD telemedicine trials is that you really have to adapt the game for each patient a little bit, because they are very different to each other. And AI helps here a lot, because you can kind of have the understanding of how they're playing and what they're doing. And combining these two aspects, I think, will be important, not only in the ADHD case, as where our research is, but in many other cases. And we have to utilize this advancement from the technologies that are coming into the telemedicine research quite a lot.
Thank you for that. I think this is something we'll talk about later on soon, is I guess the general wellness and mental wellness is actually quite fascinating. We'll be going to that much more later on. But before we move on to the next topic, did anybody else on the panel have anything to add after hearing what Suraj and Dimitri had mentioned?
If I may. So my name is Sharunas. I come from Lithuania. I've been living with a rare type of cancer all my adult life. So I've been involved in clinical trials, have advised on the device of clinical trials. So I can say that what you're saying, it's a bit of future in the mainstream. In the clinical trial setting in cancer, it has been happening for a decade. But it's not to elaborate on, not because we don't have that much time, but I wanted to pitch in and say, because the digital tools is not just for young people. When we're thinking of elderly and when you say how can we use digital and gadgets, actually the elder population prefer using tablets to answering all of the quality of life questionnaires rather than scribbling something. And it has been proven over time in research that it's not actually that you need to be more educated, digitally savvy to be able to use these gadgets. It's actually easier. It's easier than write, easier than scribble, because it's easier to read, you can zoom in and all of that. So where we've seen it's been a golden standard in cancer clinical trials, we also see it going more and more in European Union in the clinical practice because we have e-health systems, and I think we'll get more to that in the later questions.
Excellent, thanks for that. So when we looked through the prior research, we also noticed that there was reasonable reference to not just using the data that we assume is going to come from remote patient monitoring, such as the gadgets that were just mentioned. There is other data out there as well, other data sources, and I'm currently working with a company that is commercializing an eye scanner. And simply due to the laws of physics, you will not be able to get an eye scanner into some kind of a wearable. It's just the nature of light and the way it works. So there is always going to be other sources of information. It could be pre-existing records, it could be from other kinds of scans that you had conducted, and it could also be self-reported data as well. And so the question we're putting to the panel now, and I'll start off with Amit here, is how can we go about, what other data sources should we be considering and incorporating when we look at remote patient monitoring to make the most of it?
Thank you for the question. Let's look forward and see that how many times we go to the hospital and get a regular checkup. It's difficult with the time consuming and as well as the things moving around. It's very difficult to book up an appointment and go. The different data sources are definitely going to be a key. Your wearable devices are one, but they are consumer grade. What do you think beyond it? Our company has been specializing in making up the kiosk where you can go, sit for 2 minutes and get your scan done. We have around 30 plus parameters which get captured from your body weight to your BMI, to your BMR, to your fat index, to your stress level. After your data has been collected, this data goes back to your EMR system. You can go to any of the clinics and get your data being stored over there, passed through the providers, and once this has been passed through, they can analyze. You can do these follow-up checkups more and more regularly to understand what's going wrong with you. And the more data you have, the secondary data which is going to come into the picture is going to impact how the research is being done. We are focusing more toward the community wellness to make sure that, yes, in your setup, wherever you work, it could be a gym, it could be a building having a 400 plus residents, if they can do a regular checkup, we look forward at how the wellness can be incorporated more into it. And this data can be digested back, remote patient monitoring can be more effective.
I remember when I spoke to Amit first, when I met him, and he mentioned the kiosk idea. I thought it was fascinating to have one place where you can get so many things done at the one time. And I think, as I was saying, there are some things you just can't do with a wearable, but it's a very good, I think, middle ground to have something as a kiosk where you can get so many things done instantly and recorded. Another thing I found fascinating was when I spoke to Tim, who's very much focused on pain management. And I think Tim had some very fascinating insights on this same question, so you can share those.
Thank you very much. So Lumina Pain focuses on delivering smart integrative treatment plans for chronic pain patients around the world and helping them to adhere to treatment plans at a higher percentage. And this has been a fascinating data project for us in the sense that while the wearables are giving us biometric data from patients, pain is a fascinating space because it's also about pain perception and things that wearables and kiosks can't necessarily pick up. Pain is a biopsychosocial phenomenon. So a lot of what we are relying on is patient self-reporting. And the development of our technology has been really trying to help patients report accurately on how they are doing outside of the clinical setting. And this has been particularly interesting because this previously has been a bit of a data black hole. When patients leave the doctor's offices, how they are sticking to treatment plans, how they are perceiving their pain on a day-to-day basis. There hasn't been much data collection here. And our biggest focus is on the behavioral science elements which incentivize patients to be accurate about how they're reporting on that data so that we can collect it, match it to the biometric data that we're also collecting and see how that correlates.
Adding on to that, I think, Yusi, you had some thoughts on this as well. Would you share those with us, please?
Yes, this is a very important topic, and I'm CEO of Body Healthcare. We provide our care coordination platform to automate patient care processes based in Finland. And when we talk about data collection and devices, we work with majority of hospitals back home, and we've been working with them since 2016, and of course had different kind of projects. And in majority of the projects that we kick off, hospitals initially have much thoughts that we want to give this sensor to the patient, this sensor to the patient. Then would be great to collect this data and this data. And in every single successful project, we have actually come down with the number of data sources and data we want to collect from the patients, because the more data you collect, the more bored patients will be. They don't want to commit to connecting multiple sensors, but you actually have to find the data that you want to collect. And even in those cases, like we are all technologists here, we want to see sensors and devices will be the future, but in the most successful cases, we've had sensors that collect data, but then in the end of the day, the way to collect and report the data has been actually a gadget where patient actually enters the data instead of connecting, because in healthcare, of course, it's majority of patients or elderly people, and if you give them a device and you need to turn on the Bluetooth and do this and do that and do some magic, it doesn't work. You cannot have data. So in the end of the day, it has been just the easiest way that measure your blood pressure, enter the value here, and there you go.
Excellent. And I guess that reminds me again of the kiosk, where you've got something you can go to and it does it for you. We do need to be mindful of the patient and, as you say, them getting bored. Before we move on to the next question, did anybody want to add anything more to that one? So this actually leads into the next question that we had, which was on behavioural sciences, which Tim alluded to. And there are things where, and I think also there was a mention of the gamification as well from Dimitri, where we can actually use remote patient monitoring to, sometimes we need to encourage certain types of behaviour, but then there might be other times when we assume certain types of behaviour and we need to be mindful that that behaviour hasn't necessarily been engaged in. And this also gets back to basically how people feel about themselves, which was something that was alluded to in the literature reviews, but probably wasn't given the attention that it deserves. So I think what we're going to hear here is something a little bit more very future-oriented. This is the kind of thing that will need to be considered in the future. So the question is, what aspects of behavioural science, principles and elements will potentially be affected by or affect remote patient monitoring? And to start off with this one, I'll actually go to Dimitri first.
Yes, as I mentioned, we really went for gamification for a reason, because the area of research is ADHD. By the way, ADHD, for example, in this country, still there is no such diagnostics, because there is a big lack of data, and it's a big problem. And doctors know that you have ADHD, but they never do any recipes on this. Why? Because there is a lack of research on this. There is lack of data, and gamification has two things: to engage more patients in the research and make them stay as long as you can in their facilities at home. It's immensely important. And the second thing is that you can modify the game based on each patient, also very important. But also we use quite a lot of variables now to prove to the doctors, to collect enough data, that the game is actually influencing the way you can concentrate. Because ADHD it's a disorder for sure, but it's not something negative. You can live with this, you just have to control it, you have to understand it, and then you have to understand yourself quite well. So we use EEG brain scans while people are playing at home to understand how you evolve with your ability to control ADHD. And at the end of the day, this at-home clinical, at least data collection, I think is the future, as well as for sure it will be the future for not only for ADHD, but also for all this states of mentality, wellness, mental health. It is the future, and thanks to the wearables that can allow you to scan your brain activity at home, we can collect quite a lot of data to make, for example, ADHD a legal disorder that can be diagnosed here in the country and can become of the insurance policy someday, because now a lot of people suffer with that, and it's just one niche disease. We have disorder. We have other disorders that can be processed with a good telemedicine approach.
Thank you. Tim, what would you like to add to that?
Again, the pain space is fascinating from a behavioral science perspective because you've ostensibly got these highly motivated people. Pain, the avoidance of pain is something which really should drive behavioral change. But adherence to treatment plans, especially multidisciplinary treatment plans, is extremely low. You're looking at 45% adherence, sometimes even just to taking medication which will stop you from being in pain. So from the development of our application and our whole educational modalities approach here, we are looking at driving motivation and understanding what makes people want to stick to treatment plans with a higher degree of accuracy. Personalization is a huge thing. And then also the accuracy of motivating people to give proper feedback on how they're doing is very much aligned to the incentives. If we've seen if patients are given the application by their medical aid insurers and they might be uncertain that perhaps their premiums are going to be affected if they are shown not to be adhering to treatment plans. So we have to make sure that the motivation is intrinsic in the application so that people are reporting accurately and actually doing what they need to do. We know that if they are adhering to treatment plans, they go back to the hospital less frequently, they go for fewer unnecessary surgeries, their medication usage is more accurate and more effective. So there are significant economic and financial incentives to make sure that people are adhering to their treatment plans, but it's very much about making sure we're collecting the right data and motivating them to be as honest as possible in that collection process.
Thank you for that one, Tim. Is there anybody else on the panel who'd like to add to that? And just by the way, we are very efficient with our time at the moment, so if anybody would like
Yes,
Amit, go ahead.
On the behavioral, we had a very nice experiment with one of the corporate where we took around 500 people. We asked them to sit on the kiosk and they measured the various parameters. What we noticed with the corporate, the first thought could be that people had the obesity, but we found that the water content for most of their employees were much lesser, because of which the fatigue was much higher. We took up that parameters and we worked with the corporate for almost 3 months. After 3 months, what we saw the result, the water content for everybody has raised up. We ensure that the water container placements are perfectly fine. The sick leave have been, for those employees, have been down by 7%. That is what the behavioral shows, that, okay, with the kind of change in your lifestyle, with your reporting principle, with the remote patient monitoring and all those, you can really, really impact onto your regular activities, on your health and other parameters.
Excellent, thank you. Suraj.
Yeah, so to continuing what Tim was mentioning on the pain aspect, clinical studies on pain management has typically failed primarily because of not getting the right data at the right time. So with such an advancement in the data being collected with the app that Tim was mentioning, this would really give a larger insights to understand what's the degree of pain being recorded at real time. And it could also add in, with various comorbid conditions being added in, could be a pain related to the primary condition the patient is having, plus another condition might be contributing to it. So this differential factor might make a lot of difference, and that's why this, from especially in pain management, this is purely subjective. It's all the patient-reported outcome. There is no objective evidence of the pain being detected. So that's where it adds in more value from proper remote patient monitoring coming in.
Excellent, thank you for that. Now, Dimitri, I'm going to put you on the spot here, but it seems to me that if we really want to leverage remote patient monitoring, gamification is certainly something that can help. I think it was alluded to from other people here that when people feel motivated to engage, you'll get a lot more out of it. For anybody here who's had a light bulb moment, they're thinking, I want to get into gamification for remote patient monitoring, what advice would you have or suggestions would you have? And I'm thinking you're the best qualified person here, and apologies if I put you on the spot like that.
Actually, gamification is amazing, because when you have a device, you have a phone, you have a tab, there are so many sensors there that are so accurate. And when you have this data from how people play, whatever you want to diagnose, whatever you want to get people involved in, doctors, when we show to them, clinicians, when we show them the data, the amount of data, they're really amazed. And with the accuracy of data, they are amazed, and the frequency of data coming as well. And remember, you have you have so many sensors inside. How you touch the screen, how you operate the device, the frontal camera, and the accuracy of these devices is quite high now. At least now we show to clinicians the ADHD data that is coming, and we use artificial machine learning basically to find abnormalities. And so far, all clinicians are quite amazed with the quality, and it can be expanded to other disorders, other disease, and at least the primary data collection is definitely will be of help. And you can involve so many people, and you can involve on a daily basis without spending much time on pushing them to do something. And for them, it's fun now. And again, the fact that the Nature already accepted the article, and actually you can see the cover of the Nature journal game changer. It means a lot, and I think more and more clinicians will be involved in this, involving the ML that helps you with abnormalities studies, and including the definite trend on personalization of multiple treatments on the market now.
The other thing about remote patient monitoring is engagement.
Yeah.
So gamification is extremely powerful in driving engagement in the right spaces, inspiring people to come back to something, almost using the black hat gamification methods which drive addiction like Candy Crush and these sorts of things. We can use similar gaming metrics in applications to help people to say, well, I've got to finish this streak. I've got to go in today and do a pain journal today. Oh, I've got to go back in and see if I'm on the leaderboard in terms of my cohort in this particular pain condition. These things, especially again in pain, it is our reference point, but this is very community-based. Often people in something like fibromyalgia need that validation that this is a real condition, and having people to engage with in a community setting, seeing that I'm part of a bigger cohort, which is an authentic condition, is a huge motivating factor. So driving engagement in self-reporting, driving the accuracy, and making sure you're pushing the right sort of patient behaviors in the application. Gamification is a massive opportunity there.
And if I can expand just a little bit on this involvement thing, it's quite interesting. With ADHD, we focus on how people can concentrate, and now we see that there is a big demand in this gamification of people comparing themselves to others, not in particular to somebody, but how to see where you are in the group of others. But also one more thing that is quite interesting. Now we give our game to top athletes who can concentrate quite well, and you can see the difference of yourself and the top athlete, and then you can see, you have some benchmark that you want to follow and you want to be closer to, and this is also the way to create awareness and to invite these top athletes to show that they actually donating in a way they became digital donors for the big crowd of those who want to understand how to concentrate on how to live with ADHD.
Excellent, thank you for that. Before I do pass over, I just think, to use some buzzwords from the 1980s, it's quite a paradigm shift when we're thinking about making healthcare fun. People actually want to do this, and when Tim said, I've got to do this, I've got to do that, really what they're saying is, I want to do this, I want to do that, which I think is quite a remarkable perspective to take on healthcare, which it seems that remote patient monitoring could allow for. Sarunas, you were going to say something.
Yeah, we were discussing about engagement. I want also to think about motivation. So there are over 500,000 health apps currently in the app stores, etc. Are we using them? Very little % of that, because we're lazy as a human beings. We want things done for us, and we don't want to be reminded that we need to take pill, we need to walk, etc. When it works is when, okay, our gadgets does it for us. We don't need to turn it on to say that you are walking, or now you're sleeping. But the problem with that is that we have so much data, and data is wealth. Data is, we all agree, we're all fans here. However you get the data, through gamification, through systemic input, or without having to do anything yourself, it's very good. But the problem, so much of that data sits in silos. So where the patients get demotivated, so lose motivation for the digital tools, is when they have been using something like a telephone, which captures a lot of data, like a smartwatch, and when they go to their doctor and they cannot use any of that. They say, look, I have my heart rate recorded for every day. I have my sleep regime recorded, all of that. And when the doctor is saying, yes, but I cannot enter it in our e-health system because it's not validated, this data is not integrated. And this is a big elephant in many, many conversations. Because there's so many great startups, so many great companies doing great things for the patients, or potentially trying to really save trillions of whatever currency you put in healthcare systems, which is not being tapped into. And with that, healthcare systems, I don't know good examples, maybe someone from the panel could do. In European Union, most of the countries have e-health systems. That means you have electronic health record, you can get prescription online, you can see your doctor online, and etc. But you cannot make them use your data or make an advice on that. And that they will replicate that, they will ask you to put another gadget in, etc. And I've been developing health apps for our patient community as well. So for someone who is living with a very hard, difficult conditions, potentially causing death, the people would be, you think, monitoring themselves. What we see is this attrition rate, how many users you lose. You lose 90% of those motivated patients in a month through whatever type of gamification you would do. So there's so much to do, and there's a lot of that to do with motivation. And a lot of that is coming inherently being demotivated from your previous experiences. So something that we have a bit of a trauma, I think, that how we got upset by the healthcare systems not using what's available.
That's actually quite a fascinating perspective. I heard some murmuring over here, which made me think somebody wanted to respond.
Yeah, actually, I have to say that Sarunas took my words that people are lazy, and that's what I wanted to say. In our experience, what we've seen, that as long as patient is still somehow recovering, they've been quite happy and quite motivated using the tools. But whenever they get a feeling that I'm doing great now, they stop using, they got demotivated, and I think that the gamification should come in, and there should be also some motivation from the payer side, either insurance companies on the government side, to actually monitor patients. I will share later today our experiences in cardiology, where actually health system has made huge savings actually keeping patients motivated in reporting, and that's the key. You don't want to only monitor sick patients, you want to monitor and get data from healthy patients, and that's the million-dollar question, how to do it. And I actually want to continue for the next topic, talking about national health systems or e-health systems. In Finland, we have quite well developed EMR records. They are quite well integrated. We have a national data lake. It's supposed to work well. If you hear, I hope there are no Finnish government officials here. Like they are telling the story that it's all the data is integrated. You can plug your remote monitoring device and connect that to our national health records. And actually, the law in Finland says that all the data, all the sensors and devices that are used in healthcare settings, they should upload the data to the national records. And there was a deadline that by the end of 2024. All the devices that are used in the healthcare settings should have integration in place. Guess how many devices have the integration in place?
I'm guessing it's not 100%.
No, it's actually 0%. And the reason is that there's no API ready by the government.
Very good. Amit, were you?
Yes. Now, three things come into the picture over there: the engagement, the reimbursement, and the policies. One of the very good use case what we had was the patient monitor for the sleep apnea. Every time when patient for the sleep apnea used to come, we used to call them to the hospital, come and sleep on the bed, and like nobody used to get a proper sleep on the hospital bed. Let's be practical. And the sleep apnea was not being monitored properly. We reached out to the regulators that can we allow a patient to have a wearable device, go back to their home and sleep, where we can monitor it. The reimbursement came a problem. That no, the bed is not been occupied, how can we reimburse you? We have to request for a policy change for it. But the outcome, what we saw from the remote patient monitoring, it's not a telemedicine, just a wearable device, you take it, you go home, you wear and sleep for 3 days, we can monitor you and see what the real data has come. Other aspect for the real remote patient monitoring comes about the integration, what my friend brought up. How do I bring that data back to the physicians? That was something missing, and that integration is very much required. Otherwise, the data is lying into silos every place. It's not been structured well. Till the moment it's not been structured well, most of the analytics are going to fail because they are going to be on the synthetic data. We need more real-time data to have proper insights.
So we were alluding to the next topic there, which is about the governmental policy, economic benefits, and economic requirements and things like that. But I guess something that was picked up on here, and if anybody else wants to add to that, that would be very interesting. I do remember hearing that there are sort of two types of people in the world, the towards people and the away people. There are those people who are motivated as they're getting close to their optimal health goal. And there are those people who are motivated when they're getting close to the other end. For example, weight loss. There are people who are worried about having weight, and so they get motivated when they put on weight, but as soon as they start to get thin, as Yusi was saying, it's like, oh, I'm getting better now, and the motivation drops off. I think we are dealing with people here who are typically ill, and once they feel better, their motivation probably does drop off. So they might be more what we would call away people. And I think this does lead into some of the social benefits and the way different cultures and things like that. And we've already started alluding to it. The question is, how does the process of our remote patient monitoring and how do the benefits of remote patient monitoring affect and be affected by things such as government policy, the nature of the market, how your healthcare system operates, and I don't know if I mentioned, but the economics of the situation as well. And I think Yusi was sort of starting to talk about that already, and you're talking specifically about Finland, but I think you've got some insights into sort of Europe in general. So if you could tell us a bit more about how you've seen remote patient monitoring play out in different parts of the world as a result of different government policy things.
Yes, thank you. That is one of my favorite topics definitely. In order to get remote monitoring work and used, there need to be proper financial models for that, and depending on the country, even in EU, they are different. And one of the key questions here is that remote monitoring or therapy considered being a software cost or a therapy cost, and who's actually paying that? And I've seen both. For example, in Finland, we have a case. Or we are always selling to health systems or hospitals, and our software is considered as a software cost. And in one of the cases, we sell to heart hospital, and there's a fixed monthly fee that they pay to us that we monitor and track their patients. And what they do is that they actually have negotiated to the payer, which is local healthcare region, that they will follow up with heart failure patients on monthly basis, and they get paid, I don't know how much, but probably 20 euros per patient per month that they monitor. And in that case, hospital is saving money. They are paying some percentage of the monthly fee to us to use our software. They get paid by the government, and the government get benefits because patients are monitored, and they get faster actually in their interventions and recognize the patients who are not doing well. And that is something that in a small country like Finland, they've been able to negotiate. Then I've been in Germany meeting with doctors and CFOs, and in their cases, of course, they also see us as a software. But then when I have asked that, okay, how much would you ready to pay? I don't have any money for this. You should talk with insurance companies. So there's actually expectation that software provider should first get the reimbursement from the payer, and then hospitals are ready to take softwares into use. And even some of the people may have heard word DIGA, which is in Germany. This goes probably more towards the therapy side of mobile health or remote monitoring. But in such cases, doctors can prescribe a mobile app or therapy app to the patient, and the app developer gets money from the insurance companies that the app is used. But the challenge, what I see in such case, is that if there aren't too many softwares available under DIGA, which is good from health system point of view, but of course it's bad for scalability, and that's a major challenge in it. But another major challenge is that if there would be more apps, how would you actually commit hospitals to using those apps? Because we already see and hear the comments from hospitals, but yeah, we have already 200 applications or softwares in our system. We don't want to have any additional softwares in use. So it's kind of chicken. It's not even chicken and egg, but it's a problem that there are 500,000 apps in the market. They should be, patients should be able to use them, but at the same time, in order to get value from that, there should be someone on the provider side using those apps, and they don't actually want to have more apps, they want to have less apps.
Thank you for that. I think, Amit, you were talking about that earlier, but do you have more to add?
This again goes back to the same thing what my friend has added here, that who is going to reimburse for it? Is it the patient going to be? It's going to be a provider? It's going to be insurance? That's the situation is not clear, but that's where the government and the policies come into the picture. The more and more the policies are put through the patient remote monitoring. The example which I quoted, that yes, I want my patient for the sleep apnea to go back home and be monitored, but that's not being reimbursed. Why are the hospital going to incur the cost for it? Why am I going to lose 1 day of my insurance cost which could have come? Who is going to bear the cost for it? And at the same time, are the patient happy in doing it? In Dubai has been very, very mature when it comes to the digital policies transformation. The multiple policies have been put over there to ensure that your remote patient monitoring can be brought into the picture at the earliest.
Thanks. I was going to say, Tim, you had a little bit to say about this as well, didn't you?
Yeah, it's again fascinating about the coordination of incentives. There has to be a financial model for it. And in a country like Finland or in the UK with the NHS, a product which will reduce visits to the hospital will have better coordination in terms of interventions. You can reduce hundreds of millions of dollars of cost. But you move into different spaces where you get different financial models in the space, where perhaps take the USA. You will have some people saying, oh, I'll bite your arm off for that solution, but some doctors will say, you're telling me I'm going to get fewer patients? That's what's putting bread on the table here. Value-based care versus fee-for-service versus governmental funded. If there's a misalignment of incentives, you're going to have people pushing back on a solution which improves patient outcomes or times interventions better. And so you really need to make sure that at the policy level, ideally, there's some sort of handshake agreement on how these things will work. Or if you are developing a product in this space, you need to be very sure who you're targeting and how you position that. For example, again, remote patient monitoring, many people see pharmaceutical companies potentially pushing back against those sorts of solutions. But in some instances, pharmaceutical companies and remote patient monitoring solutions, adherence solutions, are best friends and are working together extremely well. It's a lot of complexity. And you spoke to using applications, and then there's no data integration. So when you go to your physician, they have no idea of what you've been doing, and there's a huge amount of frustration from the consumer on that front. We've seen in the NHS, for example, doctors having 11 minutes with a patient on average. They spend about 8 minutes of that time collecting data from you. And we call it the connection versus collection situation. 8 minutes of collection and 3 minutes of connection. The patient leaves the physician's office with no idea about their condition, terrified that they've got something they don't understand, and no idea how to follow their treatment plan with any degree of accuracy. So how do we leverage technology, remote diagnostics, remote patient monitoring to make sure that collection happens before they meet the doctor? The doctor gets an accurate diagnostic suggestion and then can spend more time with the patient on all of the stuff that is so important in terms of that bedside manner and actual patient face-to-face care. That's kind of what we're seeing in different spaces.
Can I build on that?
Go ahead.
It's exactly, I would just add, what you were saying is exactly what EU, European Union as a Commission, is funding a lot of different projects where exactly the focus would be from collecting the data when patient is in the consultation to collecting the data before the consultation with AI to analyze it so that actually healthcare professionals could have a time with the patient. And this is what you explained. I think it's reality in many healthcare systems, that now healthcare professionals are being hostages to this bureaucracy that we need to provide and not having this face time with the patient. Patients feel the same. And this is where the paradox, the ground is shaking. You see the momentum is building up. The paradox where we innovate so much in the healthcare system, but the regulation lags behind so much more. And what we are discussing here, no healthcare system is fit for purpose as of now. What we expect as users of that system, being a patient side or healthcare professional side. And in this regard, when we are thinking how to pay for new models, there's not many very progressive governments. Here in the region, I see, and I collaborate with various international consortiums and projects and organizations, OECD, WHO, etc., where the governments are very proactively trying to look for the models where in EU we actually know, we stagnate. But what I see a rise of interest is for the private insurance companies to actually be the leading advocates for using digital solutions. Not the public insurance companies, not the hospitals, but the private insurance companies, because they are smart people in there calculating how much my client is paying me and how much I will have to pay back when the health deteriorates. And then all of the logic with prevention, early diagnostic makes sense to them. And I see actually that this consortiums now of the huge billion-dollar insurance companies are coming together and pushing governments or WHO to say, you are not looking into it, we will look into it, but please provide the legal framework for that. So the field is indeed very dynamic, and the gamification, as you say, is actually one of the trends that the private insurance consortiums are mentioning, that we are happy to pay for these games for therapeutic usage because it's very crystal clear economic modeling of what you do and what you not do with that. Where the regulation fails, I can give you just a small example of a startup I was helping. They had a remote monitoring for the diabetic ulcer feet. It's a very common complication, and it's very painful. And they have like a mat that you stand on, and you can monitor the ulcers 8 weeks before they appear even. So you can prevent a lot of painful complications, surgeries, etc. And it's very, very low cost. And they launched it in the US. And in the US, they even have a code for monitoring. It's like $50 for the hospital per month. But then the problem is with their insurance, where they were saying, okay, currently we have another product which was developed by the government, which costs 3,000 euros per month to use, which is less effective, but because it was endorsed by the HT Health Technology Assessment, this is what we're gonna use. We don't want your low-cost solution because we want to keep rolling the table. I mean, to be in the good graces with the big guys. So that means that is a very sad story, where you have superior technology saving costs, but there are intrinsic barriers how the healthcare systems are structured, not able to make it reality.
You might not necessarily like them, but I guess private health insurance companies do have to deal with facts, and they have to make very pragmatic, effective decisions in that sense. Before we move on to the big data, did anybody have any other comments just on that? Because it was quite a rich area, and I want to make sure we've tapped that vein. Good. So obviously there's a lot of data flowing around, and you might have picked up from either end of the panel up here, there were slightly different perspectives on whether we're going to collect a lot of data or maybe less data. I believe later on UC will be talking about less is more data. But big data is a part of this. Certainly, from my perspective, I have a probabilistic statistical background, and I don't know if anybody's familiar here with Daniel Kahneman, who wrote a book called Thinking Fast and Slow, and he spoke about how humans are just not that good at making decisions and how data-driven decisions are far superior. And that was definitely something that came up in the literature reviews that we did, where they said that you can do a lot with data. You can find correlations that were just not obvious, and if we start collecting all of this data, we're probably going to discover things that we never even knew about. But one of the problems that it actually mentioned was that people feel a bit uncertain about the conclusion because they don't know how the neural network actually made that decision Like, what were the pieces of information it actually used to reach the conclusion that this person is likely going to die in 24 hours? It's very uncertain, regardless of how predictable or how accurate it might actually be. So definitely there are huge benefits, but one of the concerns was that we need to trust this black box, which might not be necessarily something we're comfortable with. But I think there might also be other challenges with big data, and we might not necessarily feel that big data is the solution. I was going to pass to Jussi first, because I think you've got some thoughts on this, and then I'll come to Cyrinos after that. But
Yes, big data, important topic, and people have been talking about a lot in healthcare. In my opinion, big data is very good on a population level, seeing trends, like how diseases spread around the population and such. But what I actually love to talk is small data. And small data is all about treating a specific patient, a specific indication. And when talking about small data, it's all about collecting the right data at the right time.
thank you. And I believe you've got some thoughts on who owns the data
Yeah,
and privacy
exactly.
things. Yes.
I think every time I speak up, I bring more complexity to the discussion and not simpling it down. It should be opposite. Yeah, I mean, the big narrative now here is who owns the data. Is it the government? Is it the hospital? Is it the private insurance company? Is it the technology developer? Is it the patient? In the European Union, this debate has been very hot in the past few years, and now all stakeholders are nodding it should be the patient, because we have a lot of scandals, 23andMe, if you remember, where the data is being sold for improper reasons. And what you mentioned also earlier is like, if I am patient, I'm providing the data, then I'm afraid that this would backfire, like my insurance company will make me pay higher premium. And we have the privacy laws, which are not strict enough. It's good to prevent it, but it's not good with dealing with aftermath. And with that, again, we are not in reality where the regulation is equipped to do this. So, and there are ways how to not destroy any of economy by doing it, but that the patient would be saying, I'm fine to share this data with you, I'm fine to withdraw that consent to share that data with you, but I want to have it with me. So now let's not think of the next year, let's think of like 2040. I think by the 2040, we will have all of us, our electronic health records with us every time, wherever we travel. And this in itself is a huge saving for any economy. Imagine when you go to a different country, you don't speak the language, and now we have to do all of the tests to know how to treat you. Imagine how you can avoid the complications that if someone would see you, you have a counter indication to some medicine, or you have a diagnosis that would not allow you to do one surgery or another. And this is costing a lot of lives currently. This is not something that we can fix off today, but this is why we need to be moving this, because if we address it at a national level, okay, healthcare system, let's say they will find ways to integrate that data, but data travels, we travel, we are cosmopolitan people. When you travel and the data stays in there, how good is that? That means you are in much more risky situation being in a different country, being a patient, not knowing the system, not maybe knowing the language, not knowing the pathway. And this is the health that we are talking about, life or death situation. So this cannot go just that we don't care who owns the data. And about what you started with, is big data important? It's super important. It's everyone who is in this field, every stakeholder cares about data and more of it and more complete data. We as the patients, as also you see saying, we need to care about small data, the quality of the data. Because if, even like in the cancer field, if we compare, we have cancer registries, and we call it very good quality cancer registries, meaning the data is reliable, we can do it. But what is the detail of the data? You can only know that there is X patient in an X country being diagnosed with this type of cancer at certain date. That's it. Not the complications, not the comorbidities, not if they are dead, not what stage they are. This is very, very, very shallow, and that's the best that we have. So there is so much more to go, and the digital tools are much more capable of bridging those gaps than the governments will with their own hospital gathering.
Thanks for that. I think, because we're almost out of time, certainly the notion of owning your data. At the age of 14, I was first diagnosed with melanoma, and I've had 20 since. And I went to get a genetic screening done. And it wasn't until I thought, they asked me, like, what do you want us to do with your data? That was the first time when I thought, oh, hang on, I'm not sure. Up until then, I've always thought, big data, great. But then as soon as it affected me personally, it was a bit of a different story. That was just a little anecdote I wanted to share. I'd like to thank my panelists. We're 30 seconds until we need to wrap this up. So I'd like to thank panelists. I'd like to thank you. I hope you enjoyed it. And I hope everybody enjoys the rest of the conference. Have a great day.
Great start. Thank you.
Indeed. Thank you so much, gentlemen. Very, very insightful. Yes, you can just leave the microphones on the table or on the chair, whichever. Thank you very much. And what a start to the day. Don't you just love it when technology and healthcare come together to create something this impactful? A big thank you to our panelists for sharing their expertise, and let's give them all another round of applause. Now let's shift gears a bit. Healthcare is about people, whether they're on the receiving end or providing it. But here's the thing. If we don't take care of our healthcare professionals, how can they take care of us? There's a very important saying that how can you pour from an empty cup? And I think this is very important, especially for the healthcare sector. Now, our next keynote speaker knows this better than anyone. Up next, we have Heather Marie Ogburn-Stokes, who is the CEO and founder of Serenity Life Recovery, LLC. Heather will be sharing valuable insights on integrating wellness programs and self-care policies into healthcare systems. Her keynote speech is titled Implementing Wellness Programs and Self-Care Policies into Healthcare to Increase Productivity, Employee Retention, and Improve Patient Outcome. This promises to inspire actionable strategies for creating healthier workplaces and better patient care. Please help me in welcoming Miss Heather to the stage.
Hello, everyone. Is there a microphone that I can just pick which one? Okay. All right, there we go. I like to move and flow with it, not be behind a podium. Hi, everyone. My name is Heather Ogburn-Stokes. I'm the founder and CEO of Serenity Light Recovery, and I just want to start by thanking you all and the 2.0 conference for having me be a keynote speaker and opening the conference with recovery and wellness. Implementing wellness programs and self-care policies into healthcare. So, they didn't give me the clicker. There it is. So how do we increase productivity, employee retention, and overall improve patient outcomes? The objectives: explore evidence-based strategies to design and implement wellness programs that boost productivity while promoting a supportive and healthier work environment in healthcare settings. We all know that it can be very stressful, and it's a constant state of crisis a lot of times in healthcare. Learn how integrating self-care policies can enhance employee retention and improve patient care quality, creating a sustainable and high-performing healthcare workforce. Let's try to remove the burnout, right? Let's look at the numbers. 30% of healthcare workers and first responders experience anxiety and depression due to constant crisis conditions and chronic stress. 40% of first responders develop PTSD. 25%, there was a 25% global increase after 2020. 1% of all suicides are healthcare and first responders. 46% increase in burnout and compassion fatigue. 55% ER nurses experience depressive symptoms, and 48% ER nurses experience burnout. So now let's create a safe, healthy, and compassionate environment. Integrate wellness programs as part of the staff benefits creates a supportive culture. Every time I go and meet a new hire, before that process, my team knows to ask the simple question, what do you do for self-care? We have to be well ourselves in order to be able to fully give. And we build it into our policies and our handbook so we can there's a level of accountability, right, and support. And it opens lines of trusted, compassionate communication. I don't know how many times I've encountered individuals or even nurses coming from ER saying, I just can't talk about that, right? I have to do what I need to do, and it's patient-centered. I say, but how did that work out for you, right? You ended up leaving that job, and you're bouncing from job to job, but what's feeding your soul, right? And she's like, I love being a nurse. That is who I am. It's like, but you're leaving each hospital or ER. What is it? It's like, I can't take the stress. So then I started thinking, well, if we're implementing wellness programs for our clients and our patients, why not implement it for our team, right? So the how, wellness, holistic healing. Here's a few of the modalities that we offer for our clients, as well as our staff. Meditation, sound therapy, acupuncture, acu-detox, massage therapy, compression therapy, exercise, yoga, and aromatherapy. So I encourage and empower our team members to experience all of these modalities. One, they can talk to the patients themselves saying, you're experiencing anxiety, this is how it worked for me, right? If they just got some bad news from home and they have to present and be focused at their work, they know that they can participate in any of these modalities to recenter and do a solid job for the clients. The why, benefits, right? Meditation, yoga, sound therapy, acupuncture, aromatherapy, and grounding all boost levels of dopamine, serotonin, and GABA. It provides healing and restoration of the sympathetic nervous system, reduces levels of cortisol, the stress hormone, right? Stimulates the parasympathetic nervous system, creating balance and regulation after stressful events.
Compression therapy, that is something new that we started incorporating because our wellness director found some great outcomes with the patients and said, you know, let's schedule you to experience this, the team members. So they'll take their 5 minutes, 10-minute break, and then receive some of these services. So we've noticed that even our team, our recovery support services that are on the ground constantly, right, they will go experience the compression therapy, and then it removes their pain in their legs and their feet, and they're able to be more active and more engaged with our clients. Exercise and movement, I think this is my favorite, stimulates dopamine and serotonin, decreases stress, and enhances memory, cognition, and improves mental health. I think my favorite fact is 1 year of regular exercise will increase the size of your hippocampus by 1%. That's learning, that's memory, right? And just think about the cognition improvements overall with the staff performance. Increased productivity and employee retention, cognition, concentration, and connection all improve. Creates a more positive outlook. Negativity is toxic. If they are constantly complaining or finding things to complain about, that is going to spread like wildfire, right? And then it just grabs to the next and the next, and then before you know it, the whole team is just negative, and it becomes just a job getting a paycheck, and then the patients are getting forgotten about. Increases resiliency to stress, promotes confidence, creates a healthy and happy culture, and decreases burnout. I know at our facility, the staff members that actually participate in our self-care modalities, they take less time off. They might take an hour to reset, but then they are more productive, right? The clients that they work with it's a night and day difference between the ones that are struggling. And we will ask, hey, go take a mental health day, right? And this is our recommendations to get well. So the wellness shift, that's what I like to call it. The positive attraction, positive attitudes, positive energy promotes healing and a positive outlook. Your brain is a very powerful, powerful muscle, right? The more we think positive, the more we become positive. And what we say to ourselves and to others, that matters, right? If we are just focusing on whether it's a team member, an employee, or a patient, like, why aren't you listening? Why aren't you taking your medicine the way you should? Or why aren't you performing in the manner that I expect? That's all they're going to hear is what they're not doing well, right? But if we empower them and focus on their skills and lift them up, right? I tell the team, I just said, if you find something to complain about, right, I want to hear 3 positive things about that person and how to lift them up, right? Because energy matters, and the clients can tell, the patients. The passion ignites, becomes more than just a job. More engagement, right? The patient care improves because they feel heard, they feel that positive energy. And I've noticed that within our care center, right, if a nurse is having a difficult time, and maybe they might be the only one on the floor, and we have several admissions scheduled, we will send other team members in to support, right? And then that client's experience drastically improves. They are more likely to continue care and not try to leave AMA, right? The purpose and meaning of life, breaking old cycles, trauma wounds. This goes with team members as well as our patients, right? If we're not able to recognize our own triggers, our own trauma wounds, and even the stress of being, if it's a ER, right, or first responder, there's trauma involved there. And if we're not able to recognize that, then we're not getting well ourselves, and it just radiates negativity. So everything is connected. The individual, the environment, the behaviors, his or her thoughts, his or her sickness, and his or her recovery. Mind, body, and spirit. It matters what we receive and who we are around in the environment. So wellness at Serenity Light Recovery. This is our beautiful campus. It's nice and serene and such a beautiful atmosphere for individuals to come and receive true healing, right? So we are a recovery wellness center that specializes in addiction and behavioral health treatment. It's a beautiful blend between Eastern and Western medical modalities. We are known for high medical treatment as well as implementing true wellness programs into our treatment plans. Very customized, very individualized. And so the clients can come in without judgment, without criticism, just be them and experience all these different modalities that even our team members have experienced, that can share their experience and empower them to try it out themselves. And they are really building they're really building upon their recovery maintenance program. That's what I like to say. And we are all recovering from something, right? Whether it be stress, whether it be trauma, whether it be maybe substances or food, whatever it may be, right? But we are recovering, and wellness is for everyone. Using the same modalities for client care as well as the team self-care, integrated self-care requirements into the team handbook. We notice that if it's not in writing, they're probably not going to want to do it until we can inspire and encourage to do it. But it also holds a level of accountability. So the way we do it is we have specialized, licensed, and certified team members providing this care to the clients. And so they will actually schedule self-care time for our team members. So when they can sign up, and when they take the 30 minutes or the 15-minute break or whatever they may be for lunch, they will sign up for these services, get to experience, get recharged, and then have a very productive afternoon. My shawl doesn't want to stay up. Okay. So here's some pictures. Here's some of the team, right? We do the Acu Detox, Ice Plunge. We have Brain Tap, Biosound, Eye Assist. It's microcurrent neurofeedback. We do massage therapy, stretch therapy. Your body holds trauma. Your body holds stress. So just imagine being able to get that knot out of your back or your neck that you haven't been able to get out in years, and the breakthroughs that we see. And this is actually a picture of first responders and veterans that came to our facility to experience wellness. So those nurses and the first responders that I started out talking about, they end up coming to see us to receive treatment because they end up finding a substance to self-medicate. And it doesn't have to be like that. We can provide wellness and self-care modalities for our individuals, for our team. And I believe that it's the team that really makes a difference. We're heart-centered, we are passionate individuals that know wellness through and through. And so we are able to be that light and be that hope for others. And we inspire, right? And I would say inspiration is the greatest buy-in. It's the ultimate buy-in, right? So this is me. Serenity Light Recovery is a dream come true. It became my mission in life because I, too, I'm a person in long-term recovery. And I never would imagine my life changing so much from the experience I endured, but what recovery and wellness brings. People do recover. People do deserve wellness, and we can implement it into our systems and to increase patient outcomes. The patients that we see that actually get involved in the wellness modalities, build it into their new lifestyles, into their discharge planning, and continue that journey. They are working at other treatment centers. They are now yoga therapists. They are thriving in life, right? And the ones that end up coming back and saying, what happened? Well, did you participate in your wellness plan? Did you participate in these suggestions? And no, I didn't, right? So what are you going to do differently? And it's just like talking to the diabetic that still wants to eat their cake, right? How do we change that mindset? And it's retraining the brain and giving them a life worth living, right? And that passionate purpose behind it. I keep looking back. I feel like there's more on there. But I know that we can make a big shift in healthcare. I know that we can implement more wellness into our treatment plans, into our care plans, implementing it into hospitals, right? You have the physical therapists coming in, and why not a yoga therapist? Why not have a meditation, practitioner come in and offer those services? Because the outcomes and their lifestyles will drastically improve, and there's so many studies showing that, and with nutrition, and I heard the panel, and there's so much, and I think that the key is collaboration and connection, right? Talking to each other and seeing how we connect. What can I offer to you and be a resource for you, but in turn be a resource together, because everyone's different, right? We need to be able to truly customize and individualize care for our patients and for overall outcomes and the world, really. We need to raise that bar of standard care. So I'll leave some of the remaining time for some questions. If you have any questions about specifically, implementing it into clinics, into hospitals, into treatment centers, and whatever else you may have questions for. Does anybody have any questions? Yeah? Okay. So So we are an addiction treatment center. We have full medical detox. We see a lot of fentanyl use and opiates and even just prescribed medication that has gotten carried away. So they come and receive medical detox, but we are known for the high medicals, so a lot of them are now in kidney failure, liver failure. They came from ICU. They have untreated diabetes or Hep C, right? And so that there's a more uptick of fentanyl use and mental health severity. A lot of even our marijuana patients, there's a higher level of mental health adverse effects that we've seen that needs further stabilization. And with alcohol use, the detox seems to be extended because of the higher rates of use. As far as our clinical work, our clinical director is actually here, and I'm sure she would love to be able to share some of the specifics on our clinical care. There's a lot more trauma. As I mentioned, we're seeing more veterans and actually NFL players, a lot of the athletes that have been scared to even say that they have issues or concerns because they're going to lose their career. They're going to lose their identity. It is who they are, right? And now we are working closely with those foundations, and they are being empowered to speak up, right? So there's an array of clientele that we see, but it's the I don't want to say the high profile, but the ones that have been suffering in silence because they have to perform and they don't want the stigma attached, right? So, yeah. Mm-hmm. Yes. So I would say recently probably be around 20%. There's a lot of nurses. We've had a few doctors. We've had several that are in the industry of addiction industry. The other facilities that are in Texas, so we're in Texas, they actually send their employees to us or their family members. And it's really sad to see them, relapse because they give so much to others, right? And they focus so much on caring for others and giving and giving and giving, and they forget about themselves. We don't need to forget about ourselves. We have to stand strong, right? And to be able to be our full, authentic, greatest self, to be able to give fully.
That's a bit loud. I'm very interested in the way such systems can be implemented into the workplace. I remember when I first heard about the Hawthorne experiment, where they found that a good portion of what actually made employees happier was just the fact that the employer cared. Yeah. And so the question I have is kind of the reverse of that. Do we need to be careful about the way we introduce such systems so that it seems genuine? You might introduce some sort of a support mechanism or something like that in meditation and things like that. But if the employer says, right, you've got your meditation, I want to see the 20% improvement in production tomorrow. I'm exaggerating, of course, but is that the kind of thing that we need to be careful of, that we implement this in a genuine manner?
Yes, yes. So I mentioned in the handbook, right, saying self-care is important. Don't forget about yourself, right? Then it really helps that we offer all the modalities for our clients and then empowering them, saying, how are you going to encourage these individuals that probably are saying, no, that's not for me, right? To experience it if you haven't experienced it yourself. So I won't ask anybody to try something unless I've tried it myself, and I can come from an authentic self, right? The authentic experience, and saying this is how it's helped me and worked with me. When staff come to me and saying this is what's going on, even if it's at home or maybe frustration with a client that keeps changing what they want for discharge or whatever it may be, I have an open door policy. I build in that trust, right, the trusted communication, and then I will just gently recommend before you come in on your shift, right? It's not about work, but go ahead and experience BioSound. Take 15 minutes for you, you're worth it, and just reset and recharge, right? Because that's the only way we can be our best self and to be the best for others. And so it is in that gentle way. I see the increase in productivity. I don't have to measure it from that aspect, right? But I see results over time. And then within other measurements, it's not just focused on, you meditated, I want this, you know? So, yeah. Yes.
Hi.
Hi.
My name is Dr. Omar Musa. I'm clinical researcher at Harvard, Boston. I had a specific question about how you personalize the treatment, as we all know is very important, of course, in the multidisciplinary care. From the moment that someone comes in and you do the intake, how does his personalized needs actually reflect in the treatment you make happen during your sessions?
Yes, so, you know, we all have certain regulations, right, depending on the state and the level of care. So we have to be mindful of staying within those regs, but there's a way to create schedules and team members that are specifically assigned to those individuals to meet those needs, right? We have recovery coaches, recovery coach professionals that are on the team. Upon admission, they will be introduced, they will be assigned to a good fit, right? And having that conversation, even on the admission calls, getting to know that patient and getting the team prepped and ready if time allows. Sometimes it's they call within an hour, they're in, right? And then we get to know the client, especially during detox. If there's only so much visceral and propranolol you can give them, right? Without going into the narcotics and things. And so when we implement the wellness aspect, we are teaching them right then. And so we're meeting them where they're at, seeing what works, and then we can carry that on throughout the rest of their care, whether it be essential oils, the bath soaks in detox. We do the meditation and the massage therapy, so we see what they're drawn to and what is actually improving for anxiety and depression, and then we will continue recommending it, and then the clinical team will make their assessments and build a very specific treatment plan accordingly. We don't want to just write the same treatment plan, right, across the board. And the classes, right, we have standard classes, but they're in phases. So once they get out of detox, the awakening phase, or the renewal phase, then they transition to the awakening phase. So the level of the education really meets them where they're at, and it's evolving with them. And then the individualized care comes with the wellness modalities that are scheduled in, the specific we have a trigger awareness program we call SCARS, and so we will customize different trips or experiential therapy based on their needs. And then for some of the other specific trauma awareness classes, they're very individualized per person to have their own experience. And so it takes a lot of team members, right, and authentic, passionate team members to have that time, to have that open conversation with them and be willing and open-minded to shift, right, just a little bit. Think outside the box. That's not working, right? And so what can we bring to the table to work? Even having a team intervention with the patient, the client, and sitting down with them saying, this is what we're noticing, right? And what can we do? How can we be of service to you? Because this is what we're working with, and this is some of the things that we're noticing, and let them have a voice in it, right? And holding them accountable, because sometimes it's irrational thought, and so we have to keep that in mind. And then we bring them down and saying, okay, now we're thinking a little bit clearer, right? And how can we be of service to you in this moment and build that in? Help them have a voice, and it's the power of weighted choices, too. So you give them some choices. Either way, you have the outcome that you're looking for, but you're empowering them to make that choice, that positive choice for them. And so they start removing those earmuffs and those blinders.
Exactly. Yeah, that sounds like a beautiful direction, like in consultancy, of course, as an ND or other caregiver. It sounds very dynamic, and that is, of course, how you should treat care. So great to hear. Have a great company. Thanks for your talk.
Yes, thank you. Thank you.
is very high. Hello, good morning, how are you?
Hello, good.
Thank you for your informative, this is very high. Oh, not use it, it's okay. Thank you very much for your presentations. It was really informative. And for me, you can say it's just more of a comment. I'm Dr. Sahar. I worked before in the ICU, in the emergency, and now I'm working in the post-acute rehabilitations. I can say mental well-being and the well-being of the staff is a must, and it should be implemented in each health sector. And now really, I'm thinking I'm working on a project to implement this in the Middle East because, you know, in the workplace, the staff cannot approach, cannot talk, cannot discuss because this has a cultural background and because of our society. Like, for example, the manager of a hospital will not come approach the staff and say, let's work on you and let's have your problem be solved. Because, you know, the manager, they will think like, for example, if I need a staff to work with me, he has to be flexible and he has to know how to overcome stress. Okay, now I'm giving lectures about stress management in the hospitals, but I do believe from my experience that it's a must. You cannot, even for the patient and for the staff and for every single person, mental health and mental well-being is a must.
Yes.
Okay, and I can tell you one story before. I was working in Saudi Arabia and I was in the ICU. So one nurse, she was about to make a mistake, like a fatal mistake, but I was able to discover that early. Then when I asked her what's going on, why this happened, then suddenly she collapsed. She started to shout and she was crying and she fell down on the ground. And I told myself, why don't we approach that stuff before this happens? Because this will affect the outcome of our patient. Thank you very much for your presentation.
Thank you, thank you.
So, yeah, this is a very relevant session, Heather. This is Dr. Priyanka. And as Dr. Saha told that there are medical fraternity itself is suffering from this and you have brought this. So my query is that how you are assessing the wellness for the medical fraternity who is already in the field where they are in regular diagnostics and everything. How we come to know that what kind of exactly mental, physical and which particular area we require the wellness?
I think all of it.
So what is the assessment criteria you follow in your Serenity?
Right, so what we look for in team members from the very first interview, right? How do they handle stress, right? And then we ask the simple questions, what do you do for self-care? If they answer kind of off, then they don't really know or implement self-care into their lifestyles. So then we will encourage and ask them, are you willing to experience some of these modalities? Because this is what we teach for the clients, right? Or the patients. And then we look at really, I mean, their history and their experience. For those that are in recovery, we typically require 2 years because they have a sustainable coping, right, a recovery program. But even I've seen, you know, individuals with 10 years in recovery and just kind of, you know, not really taking care of themselves, right? No. And so there's a night and day difference. And it takes motivational interviewing. It takes those open-ended questions during the interview or during the evaluations and check-ins to really see where they're at. And just, I ask them, I'll pull them in my office, how are you? You know, how is this affecting this, right? Because we can see the behavior starting to change, and then we see the community and the clients start to misbehave and try to test their limits, right? And then it just, that's why I said negativity is toxic, right? And you got to stop the bleeding. And so it's really, I don't have a set number, right, or way of that, but we're going to incorporate personality, right, tests and looking at different ways, right? And I recently read a book that talks about, you know, are you an early riser? Are you a night person, right? And talking about sleep habits. And that originated way back in the day for survival, because if we were all sleeping at the same time, or we went to sleep at the same time, then who's protecting the family, right? And so I thought that was a very interesting fact, because they said, why doesn't the workplace accommodate for that, right? If you are an early riser and you are more productive, right, 5 a.m. or whatever it may be, then your schedule should adjust to that. And if you are more productive in the evening, then accommodate that way. And so we look at that based on their shifts, right? And we have, 24 hours cares. So we pay attention to those behaviors, and we just start asking more questions.
Sure. So I will expect that if you are collating some data which is prior to they coming to the center, and in all the dimensions of wellness, which includes the physical, social, emotional, even the financial wellness. So I think we can further speak on this part.
Yes, so with the patients and the clients, that's a different measurement, right? Because we're able to do a full assessment, pre-assessment prior to entering, and then upon admission, we do another assessment, and then we're measuring throughout, right? And that's what the clinical team does. And I recently was approached yesterday by a scientist, and they're doing clinical trials and brain scans, and so we're going to start incorporating that into the treatment, so they can receive these measurements, the clients themselves, right, upon admission, through detox, let's go again, right? And you see the improvement, you see the healing happening, right? And when you participate in, let's say, meditation, yoga, even ISS, and after 30 days, let's scan again, and let's show you. And so they're going to see the results right there. And
That's awesome.
sometimes it's hard to feel it themselves. I know others can notice a difference in me before I can notice it, right? And so we just need that encouraging data. And I'll never forget, when I first heard 1 out of 10 make it. That's hard to hear, especially if you're going through it. I'm grateful that I was stubborn or persistent in that time and saying, I'm gonna make it. I can recover, right? And this is how. And this is how I'm going to improve life. And this is my mission, to be able to share that message with others. You don't have to take that negative data, right, and have it discourage you, but you can be empowered and learn more about the positive outcomes, right?
Yeah. Awesome.
Yeah.
Look forward. Thank you.
Thank you.
Hi, this is going to be the last question. I'm Mudita Arora. I'm a registered dietitian and nutritionist in US. I would like to know if you incorporate medical nutrition therapy in your services, and if you do, are you looking for, do you look for some special certifications like eating disorder?
Yes, so we actually have a registered dietitian, nutritionist there, and she's on contract, so she'll come provide education once a month for the clients. She'll design specific meal planning and medical assessments with the medical team and certain dietary requirements. We were just talking on the flight over, right, is how do we implement that more, because nutrition is such a big piece. Right? We have them clearing out the snack pantry because they probably haven't eaten in a while, and it's just cereals. It's like, no, we can do better, right? We have it. We always have fresh fruit, but we notice that they will tend to, if you have sugar available, they'll go for it, right? And so how do we change the mindset? And that's just having it available for them. Right. So our nutritionist actually specializes in eating disorders, and so we're able to monitor and manage, because we've seen that it goes hand in hand, right? Yes. So I think that's very important, but also the medical side, because we do get a lot of diabetics, or even recently liver failure, right, and cirrhosis, and being very mindful of her diet and having to teach, right? Because they just want to eat, and then it's like, my life has changed, it's forever changed. It's like, you don't have to look at it in the negative, right, view, right? Yeah. This is a new life, and this is how it's going to improve and thrive, and teach them the good in it. But education and awareness is key.
I agree.
Yeah.
Thank you so much.
Yes, thank you. Thank you, everyone. It's been a pleasure. We have a booth right outside these doors. Come experience AcuDetox. We have Brain Tap. Come talk to us more about our specific modalities, and we would love to spread the light and love and hope with you. All right, thank you.
Thank you. Thank you so much, Helen. Thank you. Thank you. That was very enlightening, and I'm sure we can all agree that that's definitely touched base for a lot of us. Now, our next speaker, we are going to be changing the subject. Now, let me ask you, when was the last time you thought about something as simple as glove dispensing? Yep, it's something so simple and something that we literally touch every single day, maybe 100 times a day. But in healthcare, even the smallest innovation is all about how these seemingly minor changes can have major impact on the efficiency, safety, and patient care. Today, I have Mr. Jonathan Shetboon, the CEO of IGN Tech. He is here to shed light on the subject through his keynote topic, which is revolutionizing the efficiency and sustainability in glove dispensing, which is a tech-driven approach. He's going to show us how a tech-driven approach to glove dispensing is making healthcare more efficient, sustainable, and even cost-effective. It's not just about gloves, it's about rethinking the way we handle resources to create smarter, greener systems. Please let's give Mr. Jonathan a round of applause.
Thank you. Let's wait for my presentation. Thank you very much. My name is Jonathan Shetboon. I'm the CEO of IGN Tech. I'm very happy to be with you. Let's start. It works. Up. It's stuck. Speak about innovation, but always the technical issues. It's fine. Okay, again, thank you. So what if a simple system could change the way we protect lives, people, reduce waste, save resources? What if this transformation could start here in Dubai, a global city of innovation? I would like to show you something. So this is not a futuristic technology. This is a real solution that we at IGN bringing to the world, and our clear mission is to save lives, to protect people. But before we start to speak about our solution, about our system, I would like to think with you about the challenges, about the problem. What are the solutions needed, and what are the solution needed? Let's speak about gloves, a simple product. We see gloves in hospitals, medical centers, but also in our kitchens. The gloves This basic product is the first line against infections. But do you know that this industry, the gloves industry, hasn't changed in over 200 years? You can see the first rubber gloves in 1893 till today, the same concept, gloves and boxes. 45% of gloves are wasted, torn, properly donned, or or torn. This is the situation. The meaning of what I'm saying, that 45% of waste, what does it mean? It's millions of dollars wasted. And most of our frustration, inefficient. At this moment, we understood that something must change. We have to think in another way. In order to improve our healthcare systems, we should start with the basics, with the gloves. So how does it work? This is our machine, this is our solution. It enables free hands donning just in 10 seconds, very fast. I'm a son of a doctor. We all know that doctors, nurses do not wear gloves every time. It's very complicated to wear gloves with wet hands from anti-infection fluids, disinfection fluids. It's very complicated. They risk, when they are not wearing gloves, they risk themselves, they risk the patients. So let's think out of the box. How does it work?
In our stressful routine, for our daily functions, we use gloves, lots of gloves. That's why we invented iGen. Insert your hand, fit it, and you're done. What? Insert your hand, fit it, and you're done. Meet iGen. The device is 130 centimeters in height, 60 centimeters wide, and 80 centimeters in depth. Remove the cartridge cover and load the machine. There are 6 cartridges that contain up to 500 gloves. iGen prepares the gloves for use and inflates the glove. Spray your hands with disinfectant and gesture your hand over the sensor. Insert your hand and press to release. iGen enhances and upgrades any department. These are 4 lines of communication and a power port. iGen alerts on empty bottles. Changing the bottles is a simple snap. iGen gives notifications of a full bin. Just open the bin door and empty the leftovers. Alerts are given on opened doors. Simply close the top cover and the bin door. There is a backup battery that fits for 500 usages and indicates the cartridge status. iGen transmits the amount of gloves used by each department directly to our CRM system to control the supply and procurement, and allows you global control. Meet iGen. Save time, save waste, stay safe.
Let's speak about saving money. You can see that our system enabled to control the inventory. It enables for the procurement management in hospitals, planning, the restocking. It saves money. It's not just a machine, it's a holistic solution. We are combining with IoT connection to our CRM of the hospitals, advanced sensors, cutting-edge technology. But I have to say that I didn't come just to speak about our solutions. I would like to share with you the background, how we created this solution, what our business point of view, because let's think out of the box. So you know that innovation doesn't happen in one place. It happens when people, countries, cultures come together to share ideas towards mutual goals. At iGene, we created a global ecosystem in order to achieve and to bring the best from each region in the world. Let's see how it works. Israel, our R&D systems based in Israel, our engineering team based in Israel. Israel is a small country, has always had to overcome huge challenges. You can see that part of Israel is a desert. Maybe you're familiar with Netafim. It's a cutting-edge technology, farming technology to bring water to the desert. If you're visiting Israel, you can see greens, farms all over the desert, the ways, the concept of problem solving. This is what drives us, problem solving. This is why our teams in Israel are very fast, creative, and focused. This is Israel, so we brought the Israeli mindset. Let's move to Sweden. Sweden is a country synonymous with precision and quality. In Sweden, we collaborate with Sanmina, a worldwide company with a wide range of devices, MRI, and other devices with a strong ecosystem of quality. We are manufacturing our systems, our machines in Sweden, bringing the mindset from Israel, R&D, thinking, and precision and quality in Sweden, Sanmina. Let's move to Thailand. Thailand, we are collaborating with Mercator. Thailand is the world leader producer of gloves. We would like to use their experience with gloves. But this industry, as you all know, face issues with waste, environmental impact. So we decided that Thailand should be not just part of the problem, but just to be a key player in our solution. This is why we decided to collaborate with Thailand, with Mercator company in Thailand. And our journey brings us to here, to Dubai. Dubai is not just a city, like I said before. It's a crossroad, where East met the West. It's a natural bridge for Europe, America, and Asia. I decided that our headquarters should be located here. I can tell you that my last meeting here in Dubai in our office was with a huge Japanese company. So combining the business culture, Israeli mindset, precision and quality from Sweden, Thailand's experience with gloves, and commercial place, global commercial place, committed to innovation in Dubai. This is our way, my way to create success. And we are looking for partners for this revolution, to expand our collaboration, to think together how we can protect lives, and of course, do business together. So thank you very much. This is iGene. I am Jonathan Chedmon. Thank you very much. if there is any questions regarding to our solution, our system, our concept, I will be more than happy. Maybe we can meet in the next break for discussion, but please.
Yeah. First off, great idea.
Thank you.
Fantastic idea. Secondly, are you looking primarily at the medical space or other space? Because there's a lot of other places where you need to wear gloves and stuff.
It's a great question. As you mentioned, our solution is relevant to the food and beverage industry, defense market, airports, everywhere. We decided to start with the medical market in order to pass all the regulation and certification, but I'll be more than happy maybe to meet you later and to think about other industries. Yes, thank you very much.
That's good, thanks.
Good idea.
Hi, thank you very much. Dr. Hamza Hassan, Public Health Officer in WHO. One of the most
WHO.
Great. One of the most challenges that we had during COVID-19 response was to ensure that we have specific PPEs for the health workers and to dispense it within the health facilities. So this could be a great opportunity for this to speed it up and to facilitate
the donning gloves.
Exactly. My question here is that since it's like a multi-user device, and you have mentioned that there is hands drying within the device, which could be also opportunity for bacteria growing. How could you ensure there is no, let's say, contamination between the multi-users on the same device? Have you done any certain pre-post test on that?
Mm-hmm. Okay, right now we are in the middle of a process for all the certification and regulations. My colleagues are here. We received the EU representative certification regarding to your questions of cross-contamination. But do you know that the box of gloves are I can say that the most popular place for bacteria by itself. So the concept is that with free hands, you can wear the two gloves and continue. I can say that in our experience around the world, we already signed contracts with the GCC countries, Saudi Arabia and other countries, Dubai. We receive feedback from the doctors. Right. We facilitate the way, we simplify the way of wearing gloves and protect the doctors by themselves. Thank you.
Thank you. Thank you.
Other questions? Yeah, thank you.
Great presentation.
Thank you.
I'm a surgical oncology from Saudi Arabia.
Mm-hmm.
So I like the idea, but what I know that when you are using the disinfected fluid, the sensitizer, you need to wait until it's dry. Otherwise, it will not be really beneficial. So they need to wait until it's be dry. And actually, what I was interested in is you have a lot of chambers there. So does that mean you will offer multiple types of gloves, and there will be a multiple size, or it will be only one fitting everybody?
Yeah. So thank you for your question. Yeah, we have gloves for medium, large, and now from Saudi Arabia we receive a demand for extra large gloves. You're familiar with that? With
and
this?
extra small.
Yeah, an extra small. Extra small. We receive a demand from Thailand actually.
Yeah.
But we have the ability for. Right now, it's a nitrile gloves, few size like you mentioned, but we are more than open for other kinds of gloves, and of course, liquid disinfection bottles.
Detex-free gloves, other types of gloves, because it's not only one type.
Yeah. Mm. So it's a modular concept. It's a modular concept. Thank you.
Thank you.
Okay, thank you very much, and thank you for the management here. Thank you.
Thank you very much, Jonathan. Let's give him another round of applause, ladies and gentlemen. Yeah, I think after the pandemic, everyone has their own ideas of keeping clean and gloves and all that stuff. So I think this is something that definitely resonates with not only the healthcare sector, but also in our homes, etc., etc. All right, ladies and gentlemen, it is finally time for the moment that everyone's been waiting for. It is time for our recognition session. And this is the moment where we pause to celebrate the individuals and organizations whose work is shaping the future of healthcare. These honorees are the dreamers, the doers, and the change makers who remind us that passion combined with purpose can create extraordinary outcomes. So I would like to invite Ms. Fatima Ibrahim, the executive coach at With Fatima Ibra, to the stage as she will be handing out these awards. All right, Fatima, you can stand to the front of the stage, my dear. And for those of you who are coming up to collect the award, please come over to my right, come up the stairs, collect your award, have a picture taken because we have to document everything, and exit to my left. So, up first, in no particular order, for the Health 2.0 Conference Excellence in Healthcare Award, I'd like to invite Abdullah Al-Gamda. And Abdullah is a global alternative medicine trainer from southern Saudi Arabia, specializing in sujak and reflexology. Driven by the personal experiences, he combines scientific knowledge with the intuition expertise to help others through the natural healing techniques. Abdullah is passionate about sharing his skills and inspiring others on their healing journeys. Congratulations, sir.
Thank you very much. Assalamu alaikum, and thank you for the organization and the doing it. It was really my honor to be here, and thank you for everybody helping me to achieve what my goal. Unfortunately, I'm a maintenance and reliability specialist. I have learned this methodology of treatment because of my mother. Every time I take her to the hospital, they said she has no problem. So I was working in a state, and I decided to study the self-care. So I did take around 500 hours, and I treat my mom, and that's it. Then we were traveling, and there is one guy in the airport. He was having, I think, a stroke, and he cannot move. My mom see him. She said, "Go and treat this guy." I said, "Mom, this is an airport. I cannot do it." She said, "I swear you will go." So I did. Really, the guy was, as he said, 1 year and a half, he cannot walk unless he has the forestick. So in 10 minutes, he was walking. So from that time, my mom, she swear, you go and practice your job for people. And thanks God, I have treated more than in 6 years now, 6,000 people. There is one guy did not recover. The rest of the 3,000 something, they were really appreciate and sending email and sending things that they recover. And the good thing is that this medicine, or the way I'm doing it, just only by Chinese, Japanese treatment, in 10 minutes, in 45 minutes maximum for the people. Some people in same session will be okay. Some people take 1, 2, 3 sessions. So thanks God, and thank you for you guys for the organize me in this, and thank you for everybody that's what helping me to achieve what I achieved. Thank you.
Congratulations, Abdullah, and of course our modern medicine, and they still are giving miracles. Up next for our Health 2.0 Conference Young Achiever Award, I'd like to invite Aisha Al-Kindi to the stage. Aisha? Now, Aisha Al-Kindi is driven biomedical engineering student at Khalifa University with a strong commitment to advancing medical technology through both academic and practical experience. She brings robust analytical skills and technical proficiency, particularly in MAT-LAB and her research and coursework, focusing on applications that enhance patient care and healthcare delivery. Would you like to say something? No? Say thank you.
Thank you everyone for this recognition. I am really honored to receive this award. I would like to thank our government, my family, my friends and beloved one, as well as the Health 2 conference for this recognition. And I'm really proud of this. And this reminds me that with all of us being here, we are here to do modern medicine for the future and achievements. Thank you so much.
Keep going, my dear, keep going. The future, ladies and gentlemen, for young achievers. Up next for our Health 2.0 Conference Excellence in Healthcare Awards, I'd like to welcome Dr. Amal Al-Hafdi to the stage. Dr. Al-Hafdi is an associate professor and consultant in breast and endocrine surgery at King Faisal Specialist Hospital. She is program director for the Breast and Endocrine Surgical Oncology Fellowship and deputy program director for surgery at Al Faisal University. One of Saudi Arabia's few female surgeons, she balances clinical research, teaching, and leadership roles.
Assalamu alaikum. It's my pleasure to be with you, and I really want to thank all the organizing committee. I want to thank my family, my government. It was a long journey for me as a female surgeon from Saudi Arabia, but we are there, and we have a better future. Thank you.
And of course, all the best to you, Doctor. Keep going, keep going. We see you. Up next for the Health 2.0 Conference's Excellence in Healthcare Award, I'd like to welcome Amit Kumar Bajpai to the stage. Amit Kumar Bajpai drives digital transformation as the practice head of healthcare at Acro, specializing in AI and machine learning to revolutionize the healthcare systems. With over 18 years of experience, he has led large-scale health solution implementations across the USA, UK, and the MEA for both public and private healthcare sectors. He is currently pursuing a doctorate in business administration at Rennes School for Business, focusing on data science and AI, aligning with his commitment to advancing healthcare through innovative technologies. Mr. Amit, you're in the room? He was here earlier. I think he's gone for a coffee break. We'll bring him back. For the next award, Health 2.0 Conference's Outstanding Organization Award, Latent. I'd like to welcome someone representing Latent. Yes, I hope I'm saying that right. Latent is a leading organization dedicated to cloud solutions and innovative technologies in mobile and web development. The company focuses on delivering advanced digital solutions, enabling businesses to excel in a dynamic tech environment. Latent's commitment to innovation and excellence drives transformative results for its clients and their audiences. On behalf of this organization, we have Shimai Chanlut, designer partner, who is going to receive this award.
just deeply grateful to have got this recognition here, which to be honest is a testament to the incredible work our entire team of about 100 plus people have put in. And I just want to dedicate this award to a lot of people here from the entire healthcare fraternity, including some very talented folks from remote patient monitoring community. Dedicate this to them for the impactful work they're doing, and a huge thank you to our research partners and clients as well. Thank you.
Thank you, gentlemen. For our next Health 2.0 Conference Excellence in Healthcare Award, I'd like to welcome back to the stage Dr. Clint Steele. Dr. Steele is the principal at CG Steele and has worked across various industries and countries as a mechanical design engineer. This has included time in academia, allowing him to research and teach the core of universal engineering practice, and in turn has allowed him to apply his best practice in the industry to develop and establish deep and complete understanding of this best practice.
Hello again, everybody. First of all, I'd just like to say thank you to the organisers of Health 2.0. It's been a great conference. Even just today and leading up to this, the people I met have been absolutely amazing. I guess I'd just like to reiterate, anybody here who is developing a physical product in this space, I can't iterate enough the importance of really trying to get that design right for the sake of making something easy to produce. If you can get your costs down, it means more people can benefit from what you're doing. If you do want to talk to me about that, I'm more than happy to talk about it because it's very important to me. But once again, thank you everybody here. I've had a great time so far. I'm looking forward to having an even better time tomorrow. I hope everybody else does as well. Thank you.
Thank you so much, Doctor. Yes, we do have 3 days, and the networking is going to continue and continue. For our next award, Health 2.0 Conference Excellence in Healthcare, I'd like to invite Dr. Dipali Gupta to the stage. As Asia's Pilates ambassador for India and founder of iCar Pilates, Dipali has empowered over 2,000 individuals and trained more than 300 Pilates educators. Her mission is to democratize wellness, enabling individuals to achieve both personal transformation and professional success. Dr. Gupta's innovative approach continues to shape the future of Pilates and wellness education.
Thank you so much. Receiving this award is truly humbling and gratifying experience. It is a moment of reflection of the journey so far and lives I have had the privilege to touch. But more important is this is a reminder that there is so much more to do in this healthcare and wellness industry where we're going to integrate both of it so that we can redefine wellness and healthcare. I'm truly grateful for this recognition. Thank you so much.
Congratulations, dear.
Thank you.
Up next for our Health 2.0 Conference's Excellence in Healthcare Award, I would like to welcome back to the stage Jonathan Shetbun. Jonathan is the CEO of iGen. He was just talking about his incredible machine for the gloves, where he leads his company's vision to transform glove technology and elevate operational standards worldwide, bringing extensive expertise in international business development and strategic management.
Thank you. Like I said before, it's all about collaboration. I would like to thank our teams in Sweden, in Thailand, in Dubai, and in Israel. And I would like to thank our owner, Jack Shukron, and my colleagues. Thank you very much.
And up next for the Health 2.0 Conference's Excellence in Healthcare Award, please put your hands together for Dr. Kjeld Eij. And Dr. Kjeld Harold Eij, MBA, is both a nurse and business administrator and has over 25 years of experience in healthcare. Since 2020, he serves as one of the directors of Erasmus Medical Center in a decisive leadership role to transform the largest academic hospital in the Netherlands into a high-performing center of excellence. Dr. Eij plays a pivotal role in supporting the academic hospital and overall transformation of Erasmus MC and associated national as well as regional initiatives and projects. Dr. Eij, there you are.
So thank you so much for this honor. And to be honest, I cannot do what I do without the support of my fellow researchers and colleagues. So thank you so much. I will bring this back to the Netherlands and give it a nice spot in our department. Thank you.
He's so tall. You can laugh. Oh, that's good to know, huh? All right, don't worry. We're going to be breaking the ice. We're going to be really good friends by the end of these 3 days, I promise. Up for our next award, Health 2.0 Conferences for Outstanding Organization, I would like to welcome Little Wins. Little Wins is a pioneering online platform dedicated to empowering individuals with disabilities by connecting them to essential resources, adaptive equipment, and supportive community. With a mission to simplify access and promote independence, Little Wins creates opportunities for meaningful connections, enabling users to overcome challenges and celebrate victories in daily life. And on behalf of the organization, we have Lexis Noel Sereau, founder and CEO, to receive the award. Lexis, you're in the room? No? Another coffee break? All right, we're going to be hearing from Lexis a little bit later on today, so we're going to learn a lot more from Lexis. Up next for our Health 2.0 Conference's Excellence in Healthcare Award, I would like to welcome to the stage Dr. Manish Rajak. Manish Rajak is the CEO of InvoCept Global Solutions Limited, and InvoCept is a forward-thinking clinical research organization, which is a CRO and healthcare consulting firm that was founded in 2018. With a mission to drive innovation in a clinical development, InvoCept provides comprehensive solutions that span the entire clinical trial process. Dr. Manish, you're in the room? Again, everyone's on coffee break. I think everyone's a bit hungry. Up next for our Health 2.0 Conference Excellence in Healthcare, I'd like to invite Ritu Gandhi to the stage. Is Ritu here? Yes. Ritu is Chief Business Officer and Director at Ambrosian Wellbeing and Engagement Resources. She moved from the prestigious legal career to pursue further education in a Master of Science in Physiotherapy and Counseling. Founded Ambrosian and Mental Health Care Center Management Solution Company with her colleagues, Ms. Nilofa Saint.
Thanks. Very good morning. Good afternoon to everyone. Thank you so much, Health 2, for this award. And I'd just like to share, like was just said, I was into a legal profession, moved into a very different profession. Well, the reason being, we saw that India, because I represent my country, India definitely has done something very great, which is it has brought the best population to this world. And in this process, we realized that we definitely needed a lot of support when it came to well-being. And when I was doing my studies, and after completion of my studies, I joined a company called Taj Group of Hotels, also known as Indian Hotels Company Limited. Well, we joined Indian Hotels, and guess what? Happened was 26/11. That was the worst thing which could happen in India. This is when we realized the essence of mental health. That time, Taj as a group took over CST victims, and I think that was so challenging, the most challenging moment of our lives, to see so many people go through this torture and trauma, and so much we had to work with them. Some of them still face these challenges at night, and they get up with so much of difficulty and come back to work at the same place, which is remarkable. I think that's when my colleague Nilofer and me realized that we had to do something up here for society. Even saving one life is a very, very big thing. And that's how we started our journey, and that's where I am. But thank you so much for everything, and thank you so much once again, everybody, for this recognition. Thank you.
All right, so some people have come back from their coffee break, so I'd like to invite Dr. Manish Rajak to the stage. If you can make your way to the stage. Dr. Manish? Yes, there he is. Now, Dr. Manish Rajak is the CEO of InvoCept Global Solutions. InvoCept is a forward-thinking clinical research organization and healthcare consulting firm that was founded back in 2018.
Hi, good morning, everyone. So I'm Dr. Manish Rajak, and from India. So we have a clinical research organization and started 5 years back. This year we complete 5 years. It's mainly technology-based service organization which take care of clinical research in India and global. And we have our own systems which facilitate us to do that. And we are more prominent into the real-world evidence where we could get some data from the remote monitoring and remote data from that. Yeah, thank you very much.
Congratulations, Doctor. And another one back from their coffee break is I'd like to welcome back to the stage Amit Kumar Bajpai. Is he here? Yes, there he is. Now, Amit Kumar Bajpai drives a digital transformation as the practice head of healthcare at Acro, specializing in AI and machine learning to revolutionize our healthcare systems.
Thank you. I have been into healthcare for almost 2 decades now, but leading the technology is the first thing, but I always say patient as first. Technologies come later to help the patient. I'm here for the more and more collaboration. If you are looking forward to being the part of the GCC, I will be happy to collaborate. Thank you so much.
All right, up next for our Health 2.0 Conference Excellence in Healthcare Award, I'd like to also welcome back to the stage Sarunas Narbutas. Mr. Nabutas is the co-founder of the RE-System and is serial entrepreneur, globally recognized patient advocate, civil activist, and a strategic consultant for focusing on growing life science ecosystems. He has led policies change on cancer-related issues in various strategic consultant, focusing on growing life science ecosystem. He has been advertising government heads of state and international institutions for over a decade, Living with a rare type of blood cancer for 18 years, Sarunas has founded and chaired cancer patient organizations at national, European, and global level. He's also co-founded deep tech companies in health, hygiene, and climate change sectors. That is a mouthful.
Thank you. I feel sorry that you had to read that long. I actually want to thank you for entertaining us here and being a joy. And I don't know, I feel like a split personality because part of my career path is in another room. There will be another panel discussion later in the day, 4 p.m. Please go on ESG. But I think just to keep it short, I'm a cancer patient living all my adult life with a rare disease. And my life is about helping other people. And the patient advocate is probably the term many of you in the room have not encountered, but this is where the patients help other patients. And I've been doing this at national, European, and global level, and that's pretty much my life mission. And where I do that, I'm happy that I find a lot of great minds and spirited people and the genius in business world or social transformation that we can do business together as well. So I think that the business is not just about the profits, but making a social change. And I think, and I do believe in helping people all around. So if you feel like talking, approach me. I'm very glad to meet every and any one of you through these 3 days and to see if I can help you in any way, shape, or form in any region. Thank you, and thank you to our host as well.
A true inspiration, shows you that nothing can hold you back. And he still looks great. I was looking at his skin. He's got the most phenomenal skin. Yes, you got to share the secret with us. If you walk past him when you go talk to him, just look at his skin. It's like glowing. It's very, very beautiful. All right, up for our next Excellence in Healthcare Award, I would like to welcome to the stage Udit Satsangi. There he is, yes. Udit is the founder and CCO of Sat Health and Wellness. Hailing from the promising career in consulting world, he overcame his myriad mental, emotional, and physical ailments with the help of functional medicine. Having reversed metabolic syndrome through his holistic health solutions, Udit decided to get neck deep into functional medicine to take his magic to the world. He's now focusing on coaching menopausal and premenopausal women along with the host of Lifestyle Dexis.
A very good morning and a warm namaskar from Bharat, India. I think we're at the point in time, at the eve of 2025, where we need to get the convergence of the modern medical science of the West with the Eastern wisdom, ancient traditions of the East, including India, China, and other traditions. A lot of which, we had a panel discussion today, and a lot of people are talking about collaboration. They're talking about how, in the first panel discussion which we had, about how doctors do not have the time to collect data and connection at the same time. There's always a fight between creating the connection, which increases compliance for all the patients, and at the same time collecting data which is relevant. I think what's very important, and I'd like to connect with as many of you who feel that this is relevant, I think the thing that bridges the gap between this is the heart-centered coach approach, which is absolutely relevant and imperative in this regard. We need people to understand that coaches are not only trained in medical science, and not only very well versed with blood markers and other therapeutic endeavors, but also are imperative in connecting, which we talked about with the patients. We can give the best of prescriptions, we can give the best drugs, we can give the best treatments, But if you don't have compliance, to all of those changes, all of those drugs, all of those lifestyle effects, we're really compromising on the results of that in terms of patient outcomes. So I'd really, suggest and encourage all of you to explore in your practice the coach approach, and also look towards the convergence of ancient wisdom traditions such as TCM, traditional Chinese medicine, such as Ayurveda, which really have thousands of years of heritage to actually pass down towards us, and use it in conjunction with cutting-edge medical technologies, diagnostics of the West, and create a happier and healthier world for all of us. I thank you very, very much, and I look forward to connecting to all of you. Thank you to Health 2.0 for bestowing me with this honor. And yes, have a great conference, all of you. Thank you so much. Thank you.
Thank you. All right, our next award for excellence in healthcare, I'd like to welcome Dr. Cindy Yambo. Is she in the room? Dr. Cindy? No? All right, we're going to move on for Excellence in Healthcare Award, Health 2.0 Conferences, Dr. Vijay Ram Kumar Papineni. Are you in the room? There he is. A consultant MSK and sports medicine radiologist at Sheikh Shahbut Medical City. Dr. Vijay Papineni is a leading consultant radiologist specializing in musculoskeletal radiology, sports injuries, and AI medicine. He is the current president of the Emirates Club of MSK Radiology. Dr. Papineni is a pioneered MSK ultrasound services in the UAE and the UK over the past 16 years, enhancing patient care through innovative one-stop clinics and sports injury services.
Good morning, everybody. I would like to thank the organizers of the conference for this recognition. Good thing about my job is patients come to me with pain or disability, and it gives a great satisfaction of doing my job. So I would like to thank my team, the MSK team, my head of the department, all the people who have helped me, encouraged me to do better, and of course my family who has put up with my very busy schedule, as we all doctors have. Thank you so much for this recognition.
Yes, and like you said, sir, we are all in the healthcare profession and we need to take care of ourselves. Busy schedule or not, huh? Self-care. It is the time of day that everyone's waiting for. Yes, it is lunchtime. So don't just grab a plate and go sit in the corner. Make sure that you get a chance to network. Make sure that you connect. This is why we have these conferences. We bring people together from around the world. And here's a little challenge for you. Find someone that you haven't spoken to just yet and tell them and ask them what was their favorite session. How do you feel about the glove dispensing machine? How do they feel about mental health care? You know, things that we've already touched base on for today. You can also visit the exhibit booths while you're at it. They're packed with innovative solutions that you do not want to miss. Also, go past the 2.0 Conferences exhibit booth next to our registration desk to get the inside scoop on all the sessions that we have waiting for you at our upcoming editions. There's one coming up in Las Vegas and a whole bunch more. So if you want to learn more, just go to any of the booths and everyone will be happy to provide all that information. So we are a little bit early. Enjoy your meal and your conversations. We'll see you back here at 1:30 sharp.
Me? You.
All right, no one panic. We just have someone who needs to leave for an emergency. We're going to do the award that was meant for another session. So I'd like to welcome Dr. Farhim, who is an experienced special emergency medicine at Zulika Hospitals. He's also a physician with a decade of experience specializing in trauma, cardiac, medical, and surgical and pediatric emergencies. With experience of maritime and aviation medicine, he coordinates and directs air ambulance missions for airlift of critical patients. And now you can go to lunch.
Okay, check, check.
Hello, 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 everybody, and welcome back. I trust you all had a great lunch, and we're feeling a little bit maybe lazy, a little bit tired, yes? So I'm going to ask everyone to stand up for a second. Yes, everybody stand up, stand up, stand up. Yes, if you have some coffee in your hands, that's the right choice. It's definitely the right choice. All right, we're going to take a nice deep breath in, fill those lungs, and exhale. And now raise your hands up to the ceiling. Very good. And release. Very good. All right, now I know everyone's with me, so you can all take your seats. Thank you very much. Yes, we are there for health and wellness and everything that is good. Now we are going to be moving straight into our next presentation. It is a keynote, and we continue the series of thought-provoking discussions. And the next keynote is the future of digital health. And this is going to sound very strange, because why doing less delivers more? This is going to be presented by Jussi Mata, who's the CEO of Buddy Healthcare, exploring how stripping back complexities and focusing on essential facilities can lead to a more effective and accessible digital health solution. So please put your hands together for Mr. Jussi Mata.
All right. Hello, everyone. Nice to be here. My name is Jussi Määttä. I'm CEO of Buddy Healthcare, and as told, telling a little bit about why doing less delivers more in digital health. First, a little bit about me. I'm not ambulance, helicopter pilot, professional snowboarder, or ice hockey coach. And reason why I'm telling this is that my 10-year-old daughter told that in their class at school, a teacher has asked a couple of parents to tell about their professions and what they do on daily basis. And she asked me that, would you, well, and okay, I asked, okay, I can come, but what kind of people have you seen there? Yeah. Jenny's pilot, Jenny's father, he's a helicopter pilot, and Annie's father was a professional snowboarder. And then there was an ice hockey coach. And then they want me as a really boring CEO in digital health, tell what I'm doing. But you will hear that today. I have a master's degree in software engineering, been in digital health and telecoms for 20 years, based in Helsinki, Finland. I do lots of sports in addition to leading a software company. At Buddy Healthcare, we provide a care coordination platform to automate patient care processes from home to hospital and from hospital to back home. Majority of the pathways, or actually all the pathways, somehow relates to the secondary care. So when patient has got an indication, they will get our app, and in the app, patients will get all the information, actions, questionnaires, follow-ups they need to take when navigating throughout the care process, from home to hospital and from hospital to back home. And at the same time, when patients uses the app, we provide a dashboard for care personnel. And our task is to make it simple. To make it simple for nurses and doctors to care about patients. And what we provide is a dashboard where nurses can easily see which patients are compliant with the care pathways, which patients requires further attention. Like we show a green light if everything is okay. We raise a flag if there are any deviations that needs to be intervened. And finally, we provide lots of analytics for payers, healthcare systems regarding PROMs, PREMs, and quality of life. And our business is really provide a platform. What is actually protocol or process our customer hospitals follow, that's up to them. We, of course, configure the processes for them, but we don't force them to use any specific protocol. We are based in Finland, founded 8 years ago. We are market leader there, but in addition to that, we have paying customers in 8 European countries, UK, Ireland, France, Italy, Germany, Estonia. And our strategy is to provide a scalable platform to cover, as we actually I mentioned in the morning, providing one platform that can be good enough for the whole hospital so that they don't need necessary indication or specialty specific systems to digitalize their care processes. I will start with the number. 97% of the healthcare data goes unused every year in healthcare systems. And the amount of data healthcare systems collect each year is 50 petabytes. That is equivalent of 50 million gigabytes of data that hospitals and health systems collect on an annual basis. And 97% of that is unused. That is huge amount of data. Of course we can say that yes, this data is there and it can be used later on, but I claim that that data won't ever be used. And if we get this data automatically, there's nothing wrong in collecting lots of data. But in many times, and in majority of the times, when hospitals collect data from the patients, it requires additional work from someone. It requires work from nurses, doctors, or patients. And that's why I want to talk today about why less is more. I think we all know this, the promise of digital health. The digital health streamlines workflows and reduces administrative burden. Digital health should actually make healthcare scalable. Healthcare systems and hospitals should be able to reach more patients with less resources with their innovative solutions. And in the end of the day, digital health should lead to data-driven care, using insights and data collected to improve patient outcomes, care patients, improve the quality of the care, and improve the health of the population. But then comes the reality of digital health, and that is what I have overseen during the last 8 years. First of all, there's a provider overload. Nurses and doctors, they have way too many tools, they have way too complex workflows, and they want to do the minimum to treat the patient well enough. They want to avoid installing new softwares, new systems, or giving new apps or sensors to the patients. And even if they would do so, patients are fatigued and they feel stressed and tired to collect excessive amount of data with multiple touch points. So actually to keep patients motivated in digital care, you have to be able to motivate them, you have to be able to collect the data, but you cannot do too much. Like I've seen too many times, especially in the research projects that we have done, that researchers come up with the great ideas that we want to collect this data, and then after 1 minute we provide an additional questionnaire and gamify that and collect that data and that data. And that may work in the research settings when patients are motivated, usually by money, to participate in the study. But when you are really treating patients in their daily life, they feel very fatigued of too many interactions. And then, if we collect too much data, we will overwhelmed rather than actionable. And that's one of the keys. Data collected should be measurable and actionable. And that's why I want to say that in order to provide scalable and impactful digital healthcare, you need to minimize the complexity and focus on what truly matters. So why less is more? When deploying digital solutions, if you are able to really dig into the care processes, what nurses and doctors need to do in order to ensure best possible results for every single patient, you have to minimize their effort. That reduces burnout and inefficiency and frees the time to actually focus on the patient care. In addition to that, by streamlining the patient experience, you avoid overwhelming the patients and you improve patient satisfaction and adherence with the care plan. And this is one of my favorite statements, big data versus small data. There is a room in healthcare for the big data. Big data is for the population level care, where you want to find diseases, where you want to find on a population level correlations between disease or treatment methods. But when you are treating the patient, it's actually small data that matters. Small data drives actionable insights. It's easy to act on, and it's really focused and patient-specific. Small data is the data that you collect during the care from the patient in order to make the right decisions and provide the right care for the patient. So by focusing on simplicity, we empower both providers and patients to achieve better outcomes with less effort. And I'm going to talk about 2 examples that we have done to achieve better outcomes with less effort. First case, Tampere Heart Hospital is one of the leading heart hospitals in Europe. They deployed our care coordination software 2 years ago to automate follow-up with their coronary patients. And when they automated the care process, they implemented the app for patients, which provides care process to timely collect, not too often, every 3 months, blood pressure monitoring. Patient pressure measures the blood pressure at home with them existing devices, so it's not connected in the platform. They enter the values in our app. There is a risk factor assessment and quality of life questionnaires. And before they implemented our software, the process was that whenever a patient was discharged after coronary angiography, they went home, they measured the blood pressure. If the blood pressure went up, they called the primary care or healthcare station. They went to visit them, and that's what they do still. They have timely 3 months follow-ups, like laboratory follow-ups in the process. But previously, fewer than 50% of the patients adhere to prescribed LDL-lowering medications. And health system wasn't able to identify which patients may have a risk for a secondary event. And majority of the patients came back to hospital through ER, which was usually way too late, causing too many additional secondary events. And they were really costly because patients weren't in the right time at the right place. And after implementing this very streamlined care process, at the 3-year checkup, we've seen 55 to 70% of the patients adhering to prescribed LDL-lowering medications. So it's depending by about sex. 70% of women adhere with the medication, and 55% of the men adhere with the medication. Patients using the app were 3 times more likely to achieve target LDL levels, and with those in the target range being 4 times less likely to experience a secondary event. And this led healthcare system saving costs by receiving timely alerts for patients at risk of secondary events. And these timely alerts actually enabled them to provide more instructions for the patient, motivating them by sending them a message that it's your good to actually continue reporting and answering these questionnaires. So there was a manual intervention if patients became unmotivated. But that was way more less than they did before. So patient received digital education, no need for phone calls, no need for primary care appointments. Provider got recurring follow-up that they actually could invoice from the healthcare system, and value-based healthcare data collected from the patient automatically. And healthcare system got reduced secondary events, and each secondary events in the EU costs on average 41,000 euros. And they got less strain in the primary care because patients, coronary patients didn't interact with the primary care. They were in touch with the specialists of the heart hospital all the time. This was an example in cardiology. I have another different example from the UK. NHS Lanarkshire is the second biggest health board in Scotland. They implemented our software to digitize preoperative assessment. Previously, all the patients having a surgery had a face-to-face appointment with an anesthesiologist and nurse at hospital. During this appointment, they went through, patients returned 16 pages of questionnaires to this appointment. And during the appointment, patients went through, together with nurses and doctors, the whole list of the questionnaires. And the task of the anesthesiologist was to identify the risky patients who may have a risk for anesthesia, who may need additional attention before the anesthesia. That was very costly, of course. And when we implemented a digital process, that's a two-stage process. There's a pre-screening, during which patients answer a short question about their health status, going through, of course, weight, height, all the diseases that may have. Typically, people too much overweighted or having a cancer are identified as a risk patients in the beginning of the care. And during the pre-screening process, we flag the patients who may have like a primary risk for anesthesia, and those patients will be still sent to hospital to have a face-to-face appointment. But around 66% of the patients get green light from the first pre-screening, and then they have a secondary questionnaire also provided by the app that identifies the medium risk patients. So through RAC scoring, we prioritize patients for surgery based on the risk. And in early process, all these 16 sheets of paper, they were scanned and uploaded as a PDF into medical record system. That's a lot of data that no one can use. And now with the digital process, 22,000 patients that they operate annually, around 70% of them uses the app at the moment. Patients are fit and ready for the surgery. It saves lots of nursing time with mobile preoperative submissions, avoids lots of pre-surgery hospital visits, and also we are able to provide patients with a lower risk to fill gaps from the last-minute cancellations. And surgery cancellations are also a major challenge in the Western healthcare. Depending on the season and medical specialty, 5 to 15% of all the surgeries are cancelled for the reason or another, and there's a huge cost for that as well. So, doing less. There was a digital assessment no need for physical appointments, quicker and more convenient process completed remotely. From provider side, less resources were needed, and there was an automated red, amber, green process to score patients prior to surgery. And healthcare system are able to fill empty surgery slot with the low-risk patients, and they get better value for the value-based care. This is my favorite case, an example of doing less. Because what we started working with NHS Lanarkshire 3.5 years ago. And when we started, we, as we do always, wanted to bring our own expertise. How do you need to do less? And actually, hospital told us, you know, we have done this for ages. We have renewed our surgery, a preoperative process 20 years ago. That's all leaned. We don't need to do anything for that. And you need to adhere with our existing process. And we told, you are a customer, you are paying, of course. If you want to do so, let's do it. And what we actually did in the beginning was that we implemented those 16 sheets of questionnaires in the mobile app. Patients didn't like it. Nurses didn't find the right answers. They didn't like to use that, and in the end of the day, nurses didn't want to give the system to anyone. It was there, but they said that that doesn't work. We tried to challenge them. Probably we need to adjust the process or shorten the questionnaires, and the feedback was immediate. No, questionnaires are correct. They are perfect. We've been using them from 20 years. They work. They have worked always. But we insisted that you need to change. In order to be successful in digital, you need to change something and do less. And finally, we were able to convince them to do less and actually think about how to treat patients in a digital era. So, as an overall benefits of doing less, for providers, it's increased efficiency, it's revenue from automation, and it's better outcomes. For patients, it's higher engagement and improved access to the care. And for healthcare systems or payers, it's all about scalability, providing digital health solutions at scale. And it's, in the end of the day, cost savings. An important thing in digital health is, does it move the needle? Like we usually say when we see the customers that some ones are really implementing digital solutions, and some customers are just shaking their hands and they are acting like they are digital hospitals. And in that case, when you just act that you are digital, it doesn't move the needle. By moving the needle, you have to be able to scale digital solutions in order to save time, reduce burnout, and ensure sustainability. You have to be able to engage patients and scale it throughout the system, starting from indication, going to medical specialty level, and then to the whole hospital. If it's only point of care solution or for the one indication, I guarantee that doesn't scale in the end of the day. Thank you.
Any questions for the panel? There you go.
Clint.
Thanks, Aisha. You're talking about doing less with more, which I agree with. Did you think you needed something like that 16-page document to cull back so you knew what the key questions were? Like, do we need to go big before we can go small? Or do you think we can actually start off small and get to the sweet spot right from the beginning?
That's a good question. In that case, we needed that big first, because that's like you have to work that down and break it down what you really need and what you don't need. Like if you start from small, you don't necessarily get all the feedback, all the opinions from different nurses or from different doctors, what needs to be taken into account. So in that case, it was important that we started from top.
Mm-hmm. Excellent, thanks.
Hello. Thank you very much. With this a huge shift in the digital health and with data collection, how do you ensure the privacy of the medical records for the patients and minimize the cybersecurity risks in such cases?
Important question. Data security, that's one of the key topics and key processes of each of the companies here. I don't say if we have any magic bullets for that. It's all about taking the data security into account from early stages of the company. Like in our team, we have always demanded data security, following processes, following guidelines. We've been like ISO 27001 audited for 4 years now, so we have demanded that from ourselves. And I actually think that that's one of the most important reasons why we've been able to scale this, because providers trust us. And I actually think that in digital health, it's not about features or UI or having all the fancy gamification in the apps. If you are selling to hospitals, it all starts from being compliant with the regulations, being compliant with the data security rules and laws. And it's all about processes in that.
Thank you.
Hi. Thanks again for all your work. It's truly amazing to see where it can get you when you try to be as minimalistic as possible. One of the questions I had is actually concerning the big data that you're trying to avoid. Are there any situations or circumstances that you combine the two? It's a little bit in the same category as what was asked earlier, but are you using things like AI that has been under development since the time you started working over the last couple of years?
We use big data or AI in a couple of cases. I admit it has been challenging. One of the challenging reasons is that, of course, as a small company, we try to maximize. By doing less, we try to maximize our own revenues as well. And typically, we identify the budget from the customer. And customers may say that, okay, our budget is 10K per year. Okay, that is it. And we can get that budget without AI or having third parties involved in the project. If we would, and we've seen that if we would include a third party or additional data analytics, customer budget doesn't increase. So we are actually providing more value but getting less revenue because we have to pay the third parties. And that's, in my experience, actually one of the biggest challenges why we haven't been able to really include more AI, although it would be fancy and it can provide a value as well. But also to your question, our platform and what we do is all about automating secondary care processes. And there are companies that do triage in the primary care or like triage when you are going to the ER or meeting a general doctor. And in those cases, big data is really important and can be utilized much better in healthcare.
Yeah, I completely agree. Do you think like language models that have been the newer innovations now and can be more cost effective will change the future in your specific niche?
I think that they are more, because they can bring the value. The language models actually can provide instructions for the patients. Those can be used to actually further personalize the care. So I think that has a better value than really using big data for indication-specific pathways.
And especially in keeping it cost-effective.
Yes,
Thank
indeed.
you.
Thank
Have a
you.
good one.
I'm just curious on some of the cost savings that you had in that larger hospital system that you mentioned you have. What kind of cost savings did you have for that particular system? I have a couple more questions, though. Go ahead.
I don't have exact numbers regarding either heart hospital or NHS Laksai yet, but an example that I can give is we basically for a mid-size central hospital in Finland, we automated all their perioperative care processes. They have around 15,000 patients per year, and the cost savings that we've been able to prove is around 1.5 million euros per year, so around 100 euros per patient, which is a huge amount of money, and hospital has got a very good ROI for implementing digital.
Right. And as far as your data, the panel earlier, you guys talked about some issues with the data and how it can be transferred to different disciplines. For example, in that larger hospital system, because there's multiple doctors could be involved before surgery, how transferable was your data between the hospital systems? Because I know that was an issue with the data collection process.
The data would be transferable, but for example, in Finland, where majority of our customers are, data is owned by hospitals, or like hospitals are data processors, data owners, and they need a permission from the patient to transfer to another hospital. Patients would be quite open to transfer that data, but we haven't really seen yet use cases what other hospitals could do with the data collected, for example, from joint replacement operation or coronary pathway.
Okay. Thank you.
Hello. This would be the last question of the session. So thank you for your wonderful talk. I just wanted to ask that in this fast-paced digital world, how do you balance innovation with regulatory compliance? So is your app or whatever it is HIPAA compliant, and how do you just manage the compliance?
so the physios are better. So we give them something different. We're not going to burn them out. We're not going. When I was a kid, burnout meant you smoked a lot of pot. It's not like that anymore. But the issue that we're trying to is to watch them, and I think some of the surveys that he was talking about is something we do early on as well. But we're fighting a fight against corporate America, and I feel like we're winning because our retention rate is great because we check on them on a regular basis, and it's been very rewarding for me because this is the hardest job I've ever had to do in 35 years in this business.
When you say you check on them, is that an objective measure, like for surveys or something like that, or is it?
Well, we developed, I'm the CEO of the company, but I have a roundtable discussion, so I have all the leaders come to me. I let them tell me what I'm doing wrong. It's kind of hard to do, but I do. What are the things that they need to help them better? And we also we have a survey, we actually have a survey of 15 questions and ask them specific questions. I'll see stuff like somebody who's leaving work early has a high cancellation rate in their patients. Because they have high cancellation rates in their patient care, that means their affect is low. And the patients aren't feeling, they can go to a health club, they go somewhere else, right? So we look at those type of models and then come back to them and we're reporting. We talk to them on a weekly basis. So we're checking with them on a very regular basis. And I feel like my leaders in my team and my director of operations, who is an active therapist, is in the trenches every day making sure that they're okay.
Gotcha. With regards to measurement, and I'm going to put this to everybody here, if they would have some recommended approaches. If there is anybody in the audience here who's running a company and they want to measure burnout in their staff, what do you think some options are that people have that they could use? I'm going to start with you, Heinrich, because I know that you've got some expertise in inferring stress from other types of measurements and things like that.
I work as a coaching psychologist in a hospital, and my clients are employees, health professionals. And basically, I see two main measures. One is time scheduling, time management, and the other is relaxation. It's hard to get a surgeon to make a break during the day. Normally they have no breaks, and it's a big success if I attain this goal, that they have a break of half an hour in a 10-day day, 10-hour day.
Mm-hmm.
Yeah.
So from your perspective, it's more of if you measure the behaviour and their scheduling, gives you a better, from that you can infer the burnout that they might be likely to experience in the future.
We try to prevent, of course, burnout, and if somebody is in a burnout, then he or she goes to a clinic. He cannot work any longer. So this is
Yep. It's a very strict, a very strict definition of burnout there. I guess to Laurie and James, just to expand further, if you were to recommend a particular way of tracking the potential for burnout in somebody's organisation, what would you actually recommend people here consider?
Well, you can definitely use subjective assessments, but I find it interesting that we talk about wearables for the patients, but what about the healthcare staff? What about having them have wearables? So they're tracking things like their heart rate variability, right? Just their heart rate throughout the day. If they don't know what's going on with their nervous system as it's becoming damaged, then they're not really getting that real-time data. I think biofeedback could be really powerful. So where you get a mix of subjective and objective measurements of burnout. Those are a couple of ways that I would recommend.
I got my own.
You got your own.
We use a questionnaire, like I said before, and we do check on our therapists on a regular basis. We do offer, after a period of time, we do a lot of outing events and things like that to keep them out of the clinic. And we do have systems in place where if we have somebody who's not having a good day, we will have them have a personal day. We'll have them leave, and I'll cover actually for them, because we feel like we have to watch them. And they know we're doing that for them. So that's a big part of what we do for part of our profession.
Gotcha. Excellent. So I guess that's given everybody an idea of how they can measure burnout in their own company and prevent it from becoming an issue. I guess the next thing is, if you have measured burnout and you think it's a problem, well, what are you going to do about it? Where is it coming from? And so I guess that's a question I was going to put to people here about those the sources of burnout in the medical space. And I sometimes think, coming back to you, Heinrich, it could also be the attitude, and I'll come to you after this one as well, Laurie, because this is something that you were speaking about earlier, was the attitude of the actual person suffering the potential burnout. And you're saying that doctors are notoriously difficult to deal with in this respect.
That's correct. They know everything about the physiology.
They don't need to be told, do they?
They even know what to do, but they don't do it. They just don't do it. So.
And I guess to take it a bit further, they don't do it. Have you found any approaches that help people, particularly surgeons, say, to actually take action?
Yes, I think one possibility is to establish a ritual, a morning ritual or a high noon ritual where they calm down for half an hour or quarter of an hour and do some technique like autogenic training or meditation or the like, breathing method.
So effectively, we can't trust these surgeons to do it themselves. We need to take care of them.
That's right.
Good. Okay. Yeah, that's what they're like. Yeah, Laurie, I was going to say, any thoughts you've got on the sources and also what people do to themselves and their attitude that could contribute to that?
For interventions?
Even before the interventions, like what are the sources? Why are people feeling burned out?
You know, the literature really reveals that loss of agency and control. So, like with your schedule, for example, overworked. I mean, this is intense emotional labor. So it's a massive energy expenditure. And when you don't have autonomy and control, then that actually really activates the pain networks in the brain. We know from social neuroscience that not having autonomy and agency fires up regions in the brain just as if you're being hit over the head by a 2x4. So it's just massive pain, and that's activating that physiological stress response. So I think that's one of the biggest things, and that can simply look like people having some level of control over their schedule, or their patient load, or even how they work, what time of day they work. I think Heather was mentioning that this morning. I think it was her, that maybe you perform better in the morning, or you got a duty to your family or whatever, and you want to take care of it during that time. So that can be really helpful in preventing. Did you want me to talk about treatment as well, or intervention? Okay, we'll get there. I think the sense of agency and control is huge to prevent that cynicism. That's such a key ingredient in creating challenges with decision-making, particularly ethical decision-making. One more thing, I also think that training in compassion, and we really need to look at the nuances between compassion and empathy. There is no such thing as compassion fatigue. That has not been found to be a credible label from neurobiology. We know that the symptoms are real, but it's actually empathic distress fatigue. So compassion is the antidote there. So the more that healthcare providers can learn how to shift from a state of empathy to compassion is going to decrease that stress response, because they're not feeling with, they're feeling for the patient, and there's a healthy boundary there. So one of the tools that I use and recommend is I integrate ancient ancestral wisdom with modern neuroscience. And so I use loving kindness meditation, and I might pair that, for example, with some heart rate variability training, or even you talked about some mind-body medicine practices too, such as autogenic training.
Just before we do, I think that was a very significant point that you raised there, because I'm assuming that a lot of people in this room probably think empathy is effectively part of the job description. You think you're meant to be empathetic with every person who comes through the door. And a lot of if you're working in the medical space, you might have staff who think that way. And as we've established here, it literally could kill you. It just overwhelms you. But that doesn't mean you have to be cruel, you have to be compassionate. And I've always found that sometimes it's not getting the new idea in their head that's the difficult part, it's getting the old idea out. And to tell people, like, you're not meant to be empathetic, you're meant to be compassionate. And I think that is a definite take-home. If you're not familiar with that, there's a definite take-home that I think should be noted here, that people can be aware of that, because I think also something you were saying earlier, if I recall rightly, there are people who even believe that they shouldn't be feeling burnout either, like as part of their identity. I think Heinrich might have highlighted that a bit earlier as well. Do you believe there is a correlation between people who are empathetic but think that they should be able to maintain this level of empathy without actually suffering the effects? Is that something where some people effectively do this to themselves based on the way they think they should be?
Yeah, I give and give and give, And, you know, it could be, usually these things stem from childhood, that's where you found your meaning and your purpose. But compassion is a skill, and we know this, you know, these are physiological states. They use particular brain regions. Just to piggyback on what Heinrich said about purpose and meaning, compassion actually uses very similar networks as the purpose networks in the brain, whereas empathy doesn't. So some of it has to do with just you feeling like this is my purpose and my meaning, to give and not take care of myself. And then some of it has to do just have you been trained, and are you skilled at compassion? Just like, are you skilled at gratitude? Are you skilled at joy? Are you skilled at happiness? These are skills, these are habits that we cultivate. And I think when we start seeing them from that perspective, they're not personality traits so much, then we can just train. We can train for moving from empathy to compassion. And it's not that we don't need empathy. Empathy's the glue that holds the human family together, but you don't want to hang out there for long in the face of human suffering. It will take you down. You will burn out, you know, like an electric pump without water, basically. Yeah.
Thank you for that. Yeah, sorry to cut you off there, James. I guess some of your thoughts on the sources, but I guess also if you could expand more on some of this commercial side that you seem to have a bit more expertise in than other people on the panel.
That's the big giant we fight every day. But you know, for us to kind of be in a small mid-market community is important for us. So we'll do like we changed our EMR system, for example, to lower the scope, because the documentation is a big deal. We lowered our caseload to help our therapists to reduce the stress. I have found that the millennials and Z generations are the ones that actually, they can identify things faster than the older generations. You know, my work ethic was to work. We don't think we have burnout, but we're suffering from burnout. We just don't want to say it. But the younger ones identify it quicker, and so I do use a compass in our office to make sure that we're identifying people that are tired or fatigued, and we have we do a lot of data to look at that, not small data. To make sure that they're doing fine, and I measure by how the Google reviews are, what's the satisfaction surveys doing, are they late coming to work, are they having a lot of attendance issues, and we start seeing any kind of pattern like this, then we immediately move in on it as fast as possible to make sure that we're there, and they know we're empathetic. That's the first question they ask you in physical therapy school. What's the definition of empathy? So we didn't know compassion yet. We learned it later. But it's important to make sure that we identify that so that we can keep these guys going. And their productivity is good, so it's been very helpful so far on a small scale.
Now, you were talking about Jeff Bezos buying up a number of physio clinics, and you were saying that corresponded with burnout in some of the staff there. What is it, I know you mentioned some of the things you're doing, you think they're all the things that I guess aren't happening in those more corporate clinics where you said the physios are coming from who were burned out? Are they, nobody's really paying attention to them, they're just being worked hard and treated more like a factory line as opposed to being treated like a medico?
Well, exactly. What it is they're actually working actually on site at the Amazon site, so not actually a clinic. They have a clinic inside.
I misunderstood.
Yeah, but they're drawing really good personnel out into the systems for the almighty dollar, and sometimes they figure. I've had patient therapists come to me and say, "I'd rather work for you. I'm competitive, but we're not paying their dollars." And they're like, "Because you have a work ethic, you have a logical system of care. Patients come first. You're not burning your therapists out, and you have a high retention rate. And these are the key values." They look at the value a lot differently as opposed to just money, because that doesn't buy happiness, and it causes a lot more stress in their life because they're coming to me and they really are damaged, and we really have to make sure we teach them how to come back to us and realizing that when they see 7 or 8 patients in one day, they're almost like, this is before lunch for them before, and now they're getting it for the whole day because now the patients are better too. Patients recognize the fact that they're getting better, and the patient and the therapist responding because now they have more joy and they have more energy to treat their patients. So it's been a very effective way to treat patients.
So the reason why I wanted to ask that one is that it has been an experience I've had with a colleague. I might have mentioned this earlier. In a startup I'm working on, he's a GP or a family doctor operating in the UK at the moment. And he was the one who introduced me to a phrase called heart sync patients, where you have a patient come in and you know what it is that they have, and your heart just sinks at the thought of going through another one of these issues again, where you just have to go through the process because the system they work within, he's like an automaton. You know, the patient comes in, he tells them exactly the same thing that he told the patient earlier with the same condition. And I think it was Tim on an earlier panel who said, you know, they're basically collecting data, they're collecting instead of connecting, and that's what's making him feel not strictly burned out, but heading that way. And so it did seem to me that one of the sources of burnout is when we start treating our medical staff like widgets, like a machine, and we start treating patients like units that need to be moved through or something like that. And so we need to look at some way of helping people go through this process in a more humane way. Before we move on, Heinrich, was there anything, with what's been said so far, was there anything you wanted to add at this time, or are you okay to move on?
One point is there are different timescales of recovery that is needed. So recovery is needed on a weekly basis or year basis or a daily basis or even lower. Every year, every hour you need some recovery. And this is also hard to introduce in a system where this was not usual.
Now that you've said that, it reminded me, you've spoken about a thing called resilience, which is possibly something we could use to address burnout if people were more resilient. Can you tell us a bit more about resilience, how it relates to what you're just saying with regards to the timeline?
Yes, okay.
And if there is a way we can actually improve it.
Yeah, I think it's connected. Mm-hmm. The term resilience was from Aaron Antonovsky. He observed that on the very aversive conditions, like in a concentration camp, some people get traumatized and others not. And he wanted to find out what is the difference and how can resilience be improved or learned. Is it a trait? Is it a personal trait? Are you born with a certain amount of resilience or not? And there, I think you...
Well, I guess your opinion, is our resilience innate, or do you think we can improve it?
Partly. You bring
partly.
something with you and it can be changed, I think.
Yeah, a very diplomatic answer. I think you had something to say on that, Laurie.
Well, I just take everything to the physiology for the most part because we can measure it. And we know the definition of resilience is to not just to bounce back. We really want to prevent bouncing back, but to prepare for, adapt in, and be able to bounce back in the face of stress, challenge, and adversity. And because we're energy systems, literally at a cellular level, I mean, the mitochondrial damage that happens from burnout is decreasing the amount of adenosine triphosphate that we produce. That's our currency, right? Because of this emotional toll. And so if we look at resilience from a physiological perspective, it's really intelligent energy management. And how do we learn how to intelligently manage ourselves as an energy system? We know that baked into our DNA, we have the ability to regulate our neurotransmitters, our hormone levels on demand with practice. So this is going to take a much different level of awareness around being a battery system and being able to intelligently manage that. And that's not just on the individual, that's also on the organization and the system. This isn't just all on the person. So I steer away from the definition of resilience being something around character or personality. And it's really all about how much self-regulatory capacity do you have to deal with the stress at hand. I mean, a good example, there are some Monday mornings where you wake up and you had a great night's rest and a restorative weekend, and a couple of things come your way that are hard. You manage them. You're resilient. But you slept 3 hours on Sunday night and you had a rough weekend, you can't handle it. So it's really about energy management. And this is some of the work of HeartMath Institute as well. That's done a tremendous amount of research, a lot of literature on this.
There was a 2017 study in the U.S. on 1,000 physicians, and I think there was 43% of the physicians identified have at least one level of stress factors in their life, right? Because the system's broken and they're inundated with a lot of patients that they can't handle. So the resilience factor is way low because of that factor. So that's something we have to do. That's why they're seeking wellness. These patients are now, it's a $6 trillion business. Over $450 million were spent, $1 billion were spent last year in wellness products and services in the U.S. because they're seeking services outside the system to help them cope with their own issues from burnout at their office. So we're burnt out, and so are the patients we're seeing.
Was there anything there that you wanted to just make sure? Yeah. Speaking of the resilience in your experience, James, have you found some people who've come to you have displayed more resilience than others, or have you found any insights into how some people have been able to develop more resilience just within themselves?
With our staff, you mean?
Yeah.
I have seen, like I said, I think if I can identify that, I see patients that have worked in bigger healthcare systems are the ones that I think are the least resilient because they've already been down that road, and so they just won't go into a heavy caseload. We don't push them that way. The ones that maybe worked in mid-tier positions, a little bit older therapists, have been down that road. They know how it works. But the younger therapists, I think it's ingrained in our healthcare system of the education system of making sure that you identify these things early. So I feel like there's an age gap there, and what type of system you worked on before you came to work with us.
So I guess to clarify that, one of the things, if you could develop it in somebody, would be that ability to sense when you're starting to get low on energy, and then I guess have that willingness to say, no, I need to correct for this. My energy is getting low, I need to take action to prevent that, which I guess might have the look of resilience, but to be pedantic, you might actually call that robustness, where you realize something's happening, you take corrective action and you stay on track. Would that be reasonable, given what you've seen?
I agree. I mean, we try to identify it as much as we can. I think I think we've done a pretty good job, but I'm a small-scale operation with about 75 employees. But larger scale, I don't know if we could do it that much, but I feel at this point we've been managing pretty well.
Go ahead.
That's also a really nice example of mindfulness, is to be able to pause and track yourself. Can I self-assess and know when I am out of sync, out of alignment, and I'm really heavy in my sympathetic nervous system activation right now. You know, I'm in fight or flight. I need some active recovery. And even if that active recovery is 60 seconds long of breath work, right, to balance that autonomic nervous system back out, and pull on the activation of the frontal lobe, which is required for, you know, the cognitive work and the emotional labor that's involved in healthcare.
I want to add something now. We're at the startup that I'm involved with. One of the things that we're looking at doing is try to automate those parts of work which might be the more taxing ones. So for example, my GP colleague who said he feels like he's disconnected from reality when he just goes on autopilot and starts telling somebody with high cholesterol that you're meant to eat less fat, and then he gives them all the rundown on things they should be eating. He said in reality what he would rather would be if he could give them a very quality piece of information. It could be an online video, it could be a pamphlet, he's not entirely sure, but then he could spend that time actually connecting with his patient, understanding why they might have these challenges, actually working with them. And so I do think that we do have an opportunity to look at the way staff in healthcare work, understand those tasks that might be the more taxing or the soul draining, the things that can cause burnout, make you feel as though you're not a part of a community or something like that, and then automate that to make it done sort of very quickly so they can focus on connecting. That's something that I guess I'm sort of pursuing individually, but I wanted to put that idea to the other people on the panel, and you're more than welcome to criticise it if you wish, but also if you had any other insights or thoughts on what you've come across in the past to help prevent burnout in the first place from an organisational perspective, because I think up until now we've been talking about the individual and how the individual can take breaks. There was that comment there about making sure people do take a break, and that's once again managing the individual, but anything organisational from anybody here that they can think of?
Well, we've you know, the holidays, for example, sometimes it's when they fall in the week, we've kind of made a pact with our therapists now that if we're able to meet certain metrics, the day after Thanksgiving, you're home. We're going to have our patients come in the 4 days of the week, and so they are motivated to get a 3-day weekend. So we kind of and so we've seen the statistics on our numbers over the last 3 years that once we threw out that Christmas or New Year's, and those days we're able to still be efficient. It's still a business. We have to run as a business, and we're as efficient as if we were open that day, and it's not a grind to them any longer, so they feel like that's a motivation to them. We also have a wellness program. We provide wellness to our patients. We let our therapists do the same thing. Sometimes I'll take a couple therapists. Sometimes if I feel like they're tired, they'll go through a wellness program for half a day and let them check out because they're important to us. I'm invested in them and they know it.
I think offering a coaching coachings in a firm is very helpful, because how we recover is very different from person to person. So it's worthwhile to have one-to-one coachings to discuss this. And
I like the word coaching because I think it shows that you've reached a higher level. And if anybody, and maybe this is why surgeons and doctors are notoriously difficult to deal with, they don't want to feel they're being spoken down to. But if you've got a coach, that coach relationship is more that you are at a high level and they're providing a different perspective. And it's also a more Socratic sort of approach, which I think might go down well with people. Laurie, you look as though you're itching to say something. Or? Oh, no, just looking very engaged. Excellent. Okay.
I really think that prevention and intervention strategies are pretty similar, really. So expanding that self-regulatory capacity, and with things like mind-body medicine practices, mindfulness, meditation, exercise to help manage the cortisol levels, yoga, breath work. A lot of the biohacking tools can be really helpful, depending on what's going, how far they are. Depending really on whether they're more in that fight or flight or shutdown mode. The strategies can look a little bit different. But even some psychoeducation. I think that the understanding of burnout, there's not enough nuance in it. It's again this idea that I should be able to handle it and take care of and be able to manage this load. But it's really, it's just how our nervous systems are designed. And when you take it down to the physiology, it brings in more compassion and understanding that this isn't a character flaw of me. This is my technology doing its job. We have this inner technology, right? And I think when you come from that perspective, it's not about something's wrong with you. It's about the battery broke down, right? And so social support too, good old basic social support, because we're activating that mammalian caregiving system, that parasympathetic branch of the autonomic nervous system, which is incredibly buffering and anti-inflammatory and toning the vagal nerve, because we know with burnout that there's a loss of vagal tone because of that, it's toxic traumatic stress basically. And so there's that overactivation of that sympathetic branch of the autonomic nervous system, and then oftentimes shut down. So social support and not feeling isolated can be really helpful. Something else, just biofeedback. I think I mentioned that earlier, wearables, but biofeedback so that people can see the objective data of what's going on in their nervous system, because they might not be self-assessing accurately. We lose that ability to self-assess. A good example is in those high-threat, high-stress environments, we lose a key skill called interoception. Interoception is just knowing what's going on with inside your body. And I don't know how many social workers I've worked with, nurses I've worked with, that said, I don't even know when I need to go to the restroom or eat or drink. That's a serious loss of interoception. And of course, decreased interoception correlates with decreased ability to be empathy and kind as well. So just doing body scans, for example, can be really helpful. A lot of the tools and strategies that Heather talked about this morning in her self-care, but really integrating in active recovery throughout the day. You don't charge your cell phone once a year on vacation. We cannot do that to this technology either. It doesn't work that way. Yeah.
Yeah, I think that's creating an organisation where people are essentially maintained. At this stage here, as you can see, it's a small panel, but we've got a lot of expertise out here on the floor. So I'd be very interested to hear, not only if you've got questions, but if you've got any insights, if anybody's come across any methods they've used to prevent burnout, manage staff, or any questions you want to ask, by all means, jump up and ask away.
She's ready to go.
She is indeed.
Okay.
You got it.
Hello? Yes, good afternoon. Thank you for the beautiful topic. Actually, burnout is a quite challenging situation. It cannot be prevented because, of course, we have different interpersonal variation in the character and the limitations and the culture, social background, so many factors. And I do believe maybe if all the staff in the health sector, they should be screened initially by the clinical psychologist or by the psychiatrician, so they will know what are the limitations, how, like for example, will understand what is the background when it comes to any situation. While this staff might be in a state of burnout, will understand what was the baseline for that staff. So I want to say, what about having a regular screening for all the staff? You know, we should not wait for the burnout to occur. We have to do something about, even if we can do that privately, like to have a private connection between the staff and the clinical psychologists, for example. And another one, another point I want to discuss also, implementing regular education, because some people, they don't understand when they will be having, they don't understand this is a burnout. Like, they have the lack of insight. They don't understand what is the psychological background or the mental background of the thing that they're having. Like earlier you said, like for example, we can monitor tachycardia, for example. But tachycardia, it doesn't mean it's a stress. It can happen if you're happy, if you're sad. Any situation can bring up tachycardia. But for me as a staff, for example, if I'm a staff, I have to know which level of tachycardia, which level of what symptoms might be reflecting a burnout or when I will be under stress.
So before you run away, I guess you spoke about screening, and to my mind that seemed like having regular surveys, following the stuff. Or are you thinking of something a bit more comprehensive where it's almost like a one-on-one?
Yeah, it should be like mandatory.
Yep.
I believe. Like
Yep.
for example, I'm gonna walk in that hospital as a baseline records. They have to screen my abilities, my limitations, my beliefs, how do I think about stress. Because, you know, in the health sector, we always use the term, we are instructed to understand that always the patient is right. We have to put ourselves in the patient's shoes. And of course we have to do it because this is all linked to empathy. If we will not show empathy, we will not be able to manage our patient, right? But this will bring so many stress on the staff himself.
Gotcha. So I think it's a bit there, but would anybody like to respond to that first?
Well, I think she was talking about even a clinical psychologist to be involved. Is that correct?
No, I mean, not a must should be a clinical psychologist, like maybe a coach or a person who knows how to manage mental health. Can be, for example, a nurse who can be educated about the mental health. Any person can do it, whoever is available, based on the availability, you know, but it should be done.
Yeah.
We should not wait for the staff, you know, to burn out. Another thing, just want to add. For example, I am a staff and I have a manager. My manager should know how to distribute the task, how to give me the task according to my abilities. He should know what is my limits. So if there is any problem, for example, even me as a doctor, if I find that my nurse is having a problem, I can help with like switching rules, do something, do that. So we have to understand our community, we have to understand our staff, we have to be connected together.
Yeah, it's hard to argue with that, but were there any?
I think, I mean, just basically clarity, like part of the onboarding process should be, she's describing an onboarding process, and part of that would be like the clarity. I mean, having clarity of your position, what your expectations are, and here are expectations as well, and going through the list of things that potential, I mean, burnout should be discussed from day one, because it's real. It should be talked right during the onboarding process. They know that we are empathetic towards them, we recognize it, and we will be there for you, and here's what our expectations are.
So, any other? No?
Well, I just really appreciate the focus on self-awareness too. So like third-party awareness, being able to track, and I see some signs here. But also I think what's really important, and that's why really understanding what's going on inside of you is so critical to be able to stop.
The lack of insight is very important.
Yeah.
You have to understand what's happening to you, because if you cannot express, someone else cannot help you, right?
Right.
Nobody can help you if you cannot understand what's going on.
Right, right. Yeah, thank you for that, yeah.
Hi, thank you for your discussion. I'm wondering, we live in a digital age, a lot of tooling, a lot of wearables, we can work from home. I'm wondering, is burnout just the price we have to pay for all our introduction with all kind of digital solutions? Because then we are always on culture, constant connectivity, loss of human interaction. What are your opinions on that? Is there a connection? Because on the one hand, I think, okay, digital is okay, we have to introduce it, it's here, we cannot ignore it. But on the other hand, I see a lot of nurses on our polyclinic, they got burned out because we introduced a kind of kiosk where the patient check in. There's no interaction with the nurse anymore. We have buildings, very efficient, but the nurse doesn't see the doctor anymore because there are two ways into the room. So I'm wondering, can we turn the tide?
I think it's the use of this technology, and probably we should change some rules. Yeah. Not to forget about technology.
Yeah, I think there's a few parts of it. In Australia, they've recently introduced regulation of the right to switch off, which is your right to disconnect from any sort of social media or anything from your employer, so you can connect with your family, things like that. This is a bit of a tangent, but it was something we were talking about earlier. I read this in a book called Come As You Are, which is actually about female sexuality. But it had a section where it said what we often need is a break that we were talking about earlier, and a physical exertion to actually be able to remove the stress we have, and then also come back to our tribe or come back to our herd and connect with people. And I think what you've described there is a situation where a person is continually being worked. They're not getting a chance to take a break and recharge, and they're not getting any social interaction either. And I think that would definitely push you towards burnout. And I think from an organisational perspective, if you can set the system up so you can still use the technology because it's there, it's useful, but be able to maintain you've got that social connection, that chance to take a break from what you're doing, a bit of physical exertion to get the body working the way it's meant to be working, I think that will help. But I understand completely that situation you're talking about where people are just kept at this sort of chronic low level of stress until it just slowly builds up and they burn out. Yes, I understand.
Yeah, just a couple more thoughts. I don't think that technology is our issue. I think it's the level of consciousness. So until we consciously evolve, we're not going to be able to handle this technology, right? And then how we label it. Is the technology something that we can use to make things more efficient, to do some of this like menial task work so that we can do the healing work, right? Which comes through co-regulation, even more than the treatment interventions. You know, we hold a healing space for somebody. We know that from the literature that that's a big part of the healing role. And so when it gets used for healing, I don't think it can't be used for healing, but I think if it's primary use for that, then it's mislabeled. But I think also this we're not using, I'm going to say the word again, I know it sounds weird, but we're not using this inner technology the way that we could because we have really heightened perceptual and self-regulation capacities that we're not tapping into, we're not using those. So if we're getting all of this incoming stimuli, what is self-regulation? It's a space between stimulus and response, right? But if there's no space between stimulus and response, we're in reactive primal mode all the time, and we're just using those circuits instead of our higher capacities. So it's a paradigm shift into seeing, I think, technology differently and evolving consciously so we can use it in a more advanced way. I mean, we created it. We created something that if we're not careful, it can control us, right?
Yeah, thank you.
So we're at the 1 minute mark. Do you need us to wrap up now, or? Okay, so yes, go ahead, please.
Oh, thank you so much for bringing up this topic. I believe burnout is extremely important. As a mental health provider, I have a question for you all. So you mentioned that empathy would lead us to burnout, but compassion wouldn't. So I want to ask, how can we shift us from empathy to compassion? Any practical skills or method that to help healthcare provider shift from empathy to go to compassion? Thank you.
So I'd certainly say I'm aware that there is compassion training available that can help with that. But when it comes to the specifics, I'm thinking somebody else on the panel might know more than I would. Yeah, I was thinking that as well.
Really, training. You can literally train compassion as a skill, and also self-compassion as well. So like Kristen Neff's work, she's really a pioneer in the self-compassion movement, and she's got some beautiful self-compassion skills, and she's taking that into healthcare organizations as well. So people need to understand that there's a difference, there's nuance between empathy and compassion, and they need to understand what that feels like when they shift. It's a physiological state, and so when they shift into that state, things change. Heart rate variability goes up with compassion, for example. The vagal activity is increased. And so even doing practices that increase the parasympathetic nervous system can be useful. But the most widely used compassion skills training is LKM, Loving Kindness Meditation. It's the oldest and most widely used, and it's researched back. We got more literature coming out on that. Doesn't mean there's not other compassion practices, but you literally have to practice it. And honestly, 10 minutes a day of throughout the day, even just, it doesn't have to be concentrated, is a really, really big game changer in learning how to switch from empathy to compassion, just knowing the difference. Yeah.
Okay, thank you so much.
So that'd be LKM. If anybody wants to get into it, look up LKM. Thank you. Thank you for those great questions and insights. That was much appreciated. Presentations are always better when the audience gets involved. Thank you to the panel. I enjoyed that. And thank you, everybody. Once again, enjoy the rest of your day. Take care.
Thank you very much, everybody. If you can all just take a step forward on the edge here so we can all get a picture. You too, Dr. Yes. We have to document everything. Another round of applause for our moderator and panelists. How is everyone feeling? Everyone okay? Yes? All right, now is my time to stall just a little bit because we need to get chairs off the stage and all sorts of things. So I'm hoping everyone is having a good first day of the 2.0 Health Conferences. Now we're going to talk about our next keynote speaker, which is professional and personal on a level for this next lady. It speaks of the heart of inclusion and advocacy, titled Disabilities, Rhythm, Resilience, and Representation. This session will shine a light on the ways that we can enhance visibility and support for individuals with disabilities. We are honored to have Lexis Noel Sereau, founder and CEO of Little Wins, with us today. Drawing from her journey as a mother with a child with cerebral palsy, Lexis brings a deeply personal and professional perspective to this conversation. She'll guide us through the understanding and unique rhythms of life for those with disabilities, the resilience needed to overcome barriers, and the importance for advocating for true representation. So let's show Lexis a strong round of applause as we welcome her to the stage.
Yourself up, right? Pick yourself up when everything fell apart, broke your heart into smash. We have the answers to each other's problems. You have to be vulnerable enough to, one, pick yourself up, right? Pick yourself up when everything fell apart, broke your heart into, smashed it into smithereens. And you find that strength in what you said was, I could help other people.
But I just never let me get down because, I mean, I was a kid and I wanted to enjoy life.
I was induced because Stella had kind of run out of room in my stomach, became a crash C-section. Ava suffered a skull fracture, what they called a mystery skull fracture. and a significant brain bleed in effort to get Stella out. She ultimately has cerebral palsy. Little Wins is a platform, a marketplace to facilitate the trade or to buy or sell used medical equipment and also supplies.
There's people that drive down the road every day that drive with a joystick. You just don't know.
I want to know what your physical therapist is working on, wants to work on, and what the next goal is. The same thing with the occupational therapist. I want to know what the physician is thinking. If we can come to this collaborative decision, man, everybody wins.
And that could be you, could be me. It doesn't have to be, you don't have to be a grandma, and it doesn't have to be the situation either. You know, like there are options, there are many different ways to get that equipment, and the first step is to know what's out there, and the second one is to accept that help.
So as a result, this very positive situation turned into a very traumatic one for her because she wasn't prepared.
What I was feeling in that moment is that there wasn't a lot of support and almost no direction. I had her enrolled in therapy, in physical therapy, and all of that through a state-run program. Each week it was a different person. So I spent 30 minutes explaining what my knowledge of the birthing event was to them. And the next 30 minutes, they would kind of do an assessment. I realized quickly that we weren't going to get anywhere. I was super frustrated, but in that moment, I just was like, we need to pivot. I started thinking, well, what does this scenario look like for everybody without health insurance?
I think people get very, very scared or frightened by the fact of big term, medical term words, or like you can't really follow the surgeon, so you're just going to trust what he says because he's smart and he's giving you all the answers. But it is okay to ask the questions. You're supposed to ask the questions because you're going to walk out of there either super confident in that meeting, or you're going to walk out like, I guess I'm getting something done to me, but I don't know what.
When you put the story behind it, and it's like this person and this person, you realize that when it says that this could affect anyone, that's something that typically shuts people's brains down, right? They instantly are like, we don't want to think about it.
Yeah.
But guys, we have to, and that's why we talk about these things. We must talk about them. Truly, the number one reason I started this company was holding Ava when she first got home. All I could think was, I hope everybody sees you for exactly who you should be. I think people want to talk to each other and they want to connect with each other. I will not stop until I feel my daughter can go to college where she belongs. I want her to get an equal opportunity for her capabilities.
I want you to know that if I can't feed myself, or if I can't get up and move, you know the kind of person that I am.
Explore the many options and know that they are out there, and there is no such thing as a dumb question.
Like if I didn't have that kind of support system and that many people rooting for me, there's not a chance in hell I would be sitting here talking to you today.
They will come out of the woodwork and they want to know that they did something today that made a difference in somebody's life. And
You want to be able to find someone that's going to take good care, has good bedside manners, that is going to, kind of craft a good surgery towards your needs and benefits.
Specific to yours.
Exactly.
The biggest problem that people were overdosing and relapsing was because they couldn't get to their doctor's appointment. I said, that's a fixable problem, right? So I made this RV so that we could take it to the community centers, to the homeless shelters, to the transitional houses. We work a lot with parole officers and Michigan Department of Corrections to keep people from recidivism back into the prison system for relapsing because they didn't have support. You know, some people just really aren't comfortable with discussing the inevitability of, yes, I'm a doctor and I can't do anything else.
We still feel these feelings and it's tough.
But what I want to empower families to do is it is not just because your doctor hasn't brought it up, doesn't mean that's not something that you need to talk about.
I learned that the hard way with my daughter And, you know, the whole birthing situation, I put all of my trust into my doctor's hands, thinking, like, what do I know? But I knew inherently, I felt, you know, I felt like I should have said other things, and I should have done my own research more than I had done at the time. I won't let anybody make that mistake again.
I expect to pass this way, but only once. Any good, therefore, that I can do, or any kindness that I can show to any fellow creature, let me do it now. Let me not defer or neglect it, for I shall not pass this way again.
Good afternoon, everybody. Do we need both of these? Mic check 1, check 2. How does this work? Just one. Can you guys hear me okay? Awesome, okay. Good afternoon. I'm Lexis Surratt. Thanks for being here, and thank you for listening to my somewhat long, oh, okay. Oh, I have to take this stage? No, I gotta read this, because it's kind of a poem. So now I do this too. Now I have 3. Remember when I had 2 and I didn't know what to do? Now I have 3. So just hold it. Skip this. Okay, give it back then. All right, sorry. We are just new here. It's our first day. I'm a proud mom of 4 kids. That's what I am first. I have one with cerebral palsy. I am not a medical professional by trade or by education. I found myself here almost a decade later, trying to make a difference in an arena where, when my daughter was born, there just really wasn't a lot of help or information, and it was terrifying, you know? So in addition to that, I'm also a podcast host, and part of why I wanted you to see all those clips is it ties into my poem I made for you. Because believe it or not, folks, we are gonna talk about rap music and the history of it in conjunction to disabilities, and I will tie that all together. But it's about sharing information, sharing stories, their vulnerability, and the strength they found in overcoming so many things, and how many people, hundreds of thousands of people, listen to my podcast because they share their stories. And you can't find that information anywhere. So I'm also a blogger, who knew, and the founder and CEO of littlewins.com. It's a platform originally made to facilitate the trade of used medical equipment and supplies for those who couldn't get what they needed, couldn't get out of bed, couldn't go to the bathroom, couldn't move off of a floor, couldn't see their grandchildren one more time, couldn't make it to a wedding, all of those things. Or the slip and falls, right? Can't get a knee brace. And I just thought it was kind of ridiculous knowing that so many people have that in their homes, and the loneliness that they felt. So in tying them with the equipment or supplies that they need, they met somebody who might know a little bit about something they're going through. It also has become, you know, this information sharing thing, and I'm really humbled to be in these rooms and humbled to be in that position, and I take every single step that I take as a CEO and the creator very, very seriously. So, in an effort to maintain seriousness, when these beautiful people first asked me to speak here today, they said I could talk about anything, and I was being kind of snarky, and I said, so can I talk about the history of rap music? Who was it? And they said, yeah, sure. Well, it turns out, actually, on a quick research, that really there's a lot of parallels there, and really important ones. And I heard your panel, guys. I really liked it. And you'll find that actually a lot of my research led me to words like compassion and resilience. And I think that hopefully they go hand in hand with yours. I wanted to amplify the stories of resilience. That's why I showed you the clips of the podcast. I think that there's so much creativity and triumph in every single one of your stories. I think everybody has one. But the vulnerability it takes to share it, can you do that? So I'm gonna make you do something right now, okay? Because it's the afternoon stretch time, guys. Right? Breathing exercises, everybody needs to stand up. Come on, you're gonna love it, you're gonna love it. I wasn't even planning on doing this, but y'all look like you need a stretch, okay? So I coach a soccer team of U10 boys, and I call it the balloon breath. So what we're gonna do is we're gonna breathe in for 3. Slowly, we're gonna hold it, then we're gonna pop the balloon, and then we're gonna exhale, okay? Oh, you guys look so happy now. Look at the color in your face. Okay, let's go. Shake it up. Ready? Exhale. Shoulders up, shoulders back. You need another one, don't you? I'm seeing it. You do? You want one more? Okay, fine. Ready? Exhale. Afternoon stretch. Okay. All right, you can be seated. Is that what they say in church? you can all be seated. Thank you for participating in that. I think it just sometimes helps. Okay, so back to rap music and the community of disabilities. I believe that while we often divide ourselves into groups, do we not? That's something that's been killing me for so long. We just have to mentally, we don't even mean to, it's just something that people do, divide everyone into groups and different communities defined by their culture, ability, interest, their struggles, socioeconomic breakdown, all the things. And I think that we're ignoring the things that bind us. By doing that, we're looking at the things that make us different, when really we have so many more commonalities. And I just have been kind of on this thing all year of trying to flip everyone's mind. Flip your perspective to what is it that we have in common? So, take rap music, for instance. It's an art form rooted in resilience from the need to speak truth against adversity. And that's something that connects to the disability community hugely, right? I feel like being seen with respect, these communities being seen at all as a whole, it's really, we are too good for this. We have too much information. We're too smart. We're too capable to continue moving forward without seeing each other as just other people and accepting that. And yeah, okay, maybe it makes you vulnerable. But there's honestly so much strength in vulnerability. I think they kind of go hand in hand. So for you as professionals, if I could ask you one big favor, if just one time today, if you feel yourself thinking maybe that person's like this or maybe that person's like that, or just throwing them even nonchalantly in a mental bucket of wherever it fits, take a minute in that and change it. Maybe try to see what it is that we have in common. And if we do it, all the people in this room, just like if you hold the door for the next person, they're 10 times more likely to hold the door for the next person. And I just really want to see that. I know that we can do it, and I think that it starts in rooms like this. I could sit here and talk to you about all the numbers, all the stats, all the things I have written down here. But I think you're going to get that in other conversations. And I just, as I walked up here after listening to you guys and this conversation I had this morning about a school with zero accessibility, you know, for this little kiddo, and fighting for that too. I'm just like, you know what, maybe we all need to take a pause. And we need to have a little bit more humanity involved in every decision that we make, even if it is with burnout, or if you're a doctor, or if you're a janitor. It's all important, isn't it? And so I think that instead of all of this, that's my message today. As a mom and also a founder and somebody who works too hard, right? Doesn't sleep enough, definitely needs more yoga. Let's just do that. Can you do that for me? Just a thumbs up. Just today, maybe tomorrow, then maybe the next day. Thanks, guys. I saw the ones that didn't do it. I'll find you later. Does anybody have any questions about Little Wins or for me in general? I'm sorry, how do I what? That's a great question. Yeah, so the podcast is just another part of Little Wins. The functionality of it is more of a bridge. That's why it didn't exist before. You can't take other people's used equipment. It's a huge liability, but also it's illegal. So when it's traded between people, that's more of an agreement. I have a gated website. It's a custom build. I made it myself, so it's not being hosted or given away information-wise. If you have a walker that I need, I'll find it through your listing. And then we have a connect and chat component, so if, I have questions about it or anything, we can be friends. Anybody else? No? Okay. Well, let's just do that. Thank you for listening. Thank you for your stretching. I hope you feel that. Next time you're like, wait, I need to stand up. You're going to think of me and you're going to think of the balloon breath and you're welcome. Thank you, guys. Thanks for your time.
Thank you so much, Lexis. And thank you for reminding us how much stronger we can be when we just work together. Now, I don't know about you, but I've always believed that a determined woman can do anything. And in healthcare, we see this, and we are reminded of this every single day. Now, for our next fireside chat, we are going to have a talk about celebrating the inspiring stories of women leaders reshaping healthcare all over the world. And this is going to celebrate, obviously, women in the healthcare section, from breaking barriers to creating groundbreaking solutions. These women are reshaping the future of healthcare. So get ready to hear their stories, their challenges, and their vision for a more inclusive and innovative industry. Please join me in welcoming our speakers, Dr. Marika Kroons, who's the CEO of Impactful Innovations Management Consultants, Dr. Dipali Gupta, CEO and founder of iCore Pilates, and Macarena Diane Jalandoni, head nurse and head aesthetic and at the Sundari Polyclinic. Please put your hands together for these lovely ladies.
I'll change. Hello, everybody. Good afternoon. And first of all, I would like to thank the organizers for giving us the opportunity to express our views, visions, stories, and the future perspectives, what we have for women in healthcare, modifying the future globally. And actually, the title has been changed a bit because we're not all from the MENA region. So we are talking about worldwide. What is the impact of women leaders in healthcare worldwide? Why are we here? What is our mission? And what are we to accomplish? What have been the struggle that we have faced? What struggle may be facing today, and how do we overcome this? And what could also be the advice to the future generation, the young females looking for a career in STEM field? So these are some of the topics we would like to cover. And let me look at the watch. So we are on time. I hope not to exceed the time, because Dr. Deepali has another, yeah, I guess it's 4:30, another engagement, 4:25. So we need to cut, let's say, a bit earlier. So if I may introduce myself shortly, my name is Dr. Marika Krons. I was born in Europe, lived in 8 different countries, 3 different continents throughout my career. Originally raised as a medical doctor. I do have a specialist degree in oncology, radiotherapy, pharmaceutical industry. I do also have a commercial training from the UK. So I'm a sort of mixture of both commercial and medical. Prior to moving to Dubai 1 year ago, I was living in Paris, having global responsibilities at a large international pharmaceutical company. So I do have a pleasure of having 2 extraordinary, visionary, remarkable women besides me. And I would like to give the mic to them for them to introduce themselves.
Thank you. I thank you for this warm welcome. I'm Dr. Dipali Gupta from India. I am Pilates Ambassador Asia. I am basically MD homeopath by training, but Pilates educator, international Pilates educator by passion. And over the last 2 decades, I have transitioned from practicing medicine to empowering health and fitness professionals globally, training them into wellness and healthcare in terms of Pilates to transform lives. So here I am, and I'm honored to be here, sitting with these 2 lovely ladies, inspiring me. I've heard their stories, and I'm really honored to be here to speak in front of you. Thank you so much.
Thank you, Dr. Deepali.
Thank you. Yeah, let me go ahead and introduce first myself. My name is Maria. It's not Ma, so sometimes they mess up with my name. So it's Maria Karina Dayan Halandoni. I'm from the Philippines. I'm a nurse. I've been working as a nurse or practicing the profession for more than 16 years now. Currently, I'm a head nurse and head of aesthetic in one of the clinics in Dubai. And I'm very passionate when it comes to anything to do with aesthetic. It could be laser, it could be assisting doctors, doing some protocols. And yeah, one funny fact maybe I would say, I love black. I'm wearing it right now. I'm very confident. If you could notice, I'm wearing black to hide my shaking knees in front of you. So yes, thank you.
Well, thank you, Nurse Diane. So that is how I will call you. So first of all, I would like this panel discussion to be interactive. I know that we do have a session for questions and answers at the end, but if we are saying something that you disagree or you want to comment, so please do interfere. So I don't want you to fall asleep. It's going to be a coffee time soon. But please interfere, ask questions, challenge us. And there are a lot of men in this room. So now we are going to concentrate on women in this talk. The first questions actually that I would have for these beautiful ladies besides me is like, what inspired you to take a leadership role, international leadership role in the healthcare industry? How did you end up here, Dr. Deepali?
So practicing medicine for almost 2 decades now. While I was healing patients, I could see them return back because medicine was able to solve, symptoms only superficially. And we could see that patients came back with their chronic problems. There were lifestyle diseases that could have been prevented if movement was prescribed along with medicine. And I saw a huge gap. And I saw an opportunity because not many people were dealing with this in India and around. So I took upon this and I traveled across the globe to study Pilates and did my research coming from a medical background. I have a unique combination of medical expertise with movement education, and that's where I build iCore Pilates and iCore Pilates education, because I believe that it's very important that you build your tribe to have an effect overall. So I have almost 300 plus educators across the globe who are spreading this knowledge of Pilates-based rehabilitation, where we are literally shattering beliefs across, where movement as medicine is what we believe in. And at iCore Pilates, we have an intersection of where healthcare and wellness meets. We are trying to redefine how healthcare and wellness is looked upon. So that is what drives me, because I myself had a very close, I just came across Pilates in a way, not just as a fitness routine, but then as exercise science, which is backed up by research and science, wherein the rehabilitative powers of Pilates is harnessed within the sphere of exercises. So that's where I belong, and I believe that we can change the landscapes of rehabilitation across the nations. Thank you.
Well, Dr. Deepali, I'm impressed to hear that you have 350 people around the world following your advice. I think that's a place for an applause. What do you think?
Thank you.
So if I continue with my journey, as I told you, I started as an oncologist and radiotherapist. Did treat patients for 10 years in 3 different countries in Europe, enjoyed it, but wanted to see also the other side of the coin. Joined a pharmaceutical industry based in Paris, had global roles for 12, 15 years, and both medical and commercial roles. This area was part of my responsibility also at that time. Well, after 20 years, which is a long time, maybe a bit too long time, I wanted to renew myself. So I wanted to re-engineer. So I moved here to Dubai, established a company. Now I'm running a healthcare company here. I still have one healthcare focused company in Europe. And I believe that all of us do have a mission. And my mission is to work for the benefit of the patients. So my work, whether it is in business or whether it's in medicine, healthcare, it's really patient focused. And do you know what? I want to tell you one statistics. When a patient enters the doctor's room, excuse me, so usually it takes, have a guess, how many seconds before the doctor interferes the patient's story with a question? So how long does the patient get to tell his or her story without interruption? Any guesses from the audience? Nobody knows? Okay, let me tell you. 7 seconds. So after 7 seconds, what can you even say in 7 seconds? Like I have a vein in the elbow or whatever. After that, the physician interferes. Like how long has it been there? What kind of pain? Tell me more. Do you have pain elsewhere? Blah, blah, blah. Is that respective attitude towards the patient? I don't want to comment on that, because what I believe is listening, whether as a leader, healthcare leader, whether as a physician, getting the proper anamnesis from the patient, understanding the holistic view, as you said, because the Western medicine doesn't always cure the patient. We need more holistic approach for the patients and really listening to the patients, giving them time, giving them your full attention, and of course giving them the remedies, whatever they are. That is what is, let's say, hopefully successful in that patient's journey. So my mission is to cure, or if you want to say broadly, cure the world. But I mean, that's a broad mission, but I mean, there are a lot of projects that I'm working with and involved in different parts of the world, Latin America, Africa, Asia. So it's really global, my work, and I enjoy it very much. Enjoy it not because of myself, but what I can give to the others. So giving is something that makes myself happy. That is my passion. That is my mission. That is my calling in this life. So head nurse Diane.
Okay, so being a leader, it's not an easy task. You inspire, you empower, and at the same time you lead the people. I was inspired, empowered, and trusted. So that's why I took the managerial and the leadership role. My journey was, you can say, it's a roller coaster ride. I have also setbacks. I even got hurt along the way because there's a lot of things happening behind and things that happening that's not, you can say, planned. But being a leader, I believe, being a leader is to produce more leaders, not only followers. So I believe that, yeah, I got inspired, empowered by these people, by this person. They trusted me, and now I'm talking in front of you. I feel like I'm too old, sorry. I feel like whenever someone stands or sits or talks in front of the audience, I feel like they have, you know, a lot of things that need, a lot of life stories to share. I think I'm not that I didn't reach that yet, but yeah, but I can say there's a lot of things that in my journey that mold me as a person, as a leader, as a head. And yeah, it was quite a journey, and I enjoyed it. Along the way, I've learned a lot of things. You might think, how old am I? So let's talk about age. But yes, it helps me to become me. Actually, one of that person, I would say, she's sitting here. She was pushing me to the best of my abilities and my capabilities. So I'm just saying this because in the bottom of my heart, I'm thankful for her, for the support. So yeah, maybe a clap for her.
Well, thank you, head nurse Diane. And then to be sure, I'm sure that you already reached some of your goals. We are never ready, as you know. Life is an ongoing journey. It changes you, it changes another. So the only moment we have is this moment. So let's make the best out of this moment. But now going back to the female leaders, actually, so Dr. Deepali, I would like to ask you, for sure you have faced some challenges or obstacles being a female. How have you overcome these, and what have been these obstacles?
Thank you for this question. being a female leader in India means you have to face questions like, Pilates is is a growing trend. Do you think this will work? Will you be able to scale this? What are you doing? You're a doctor and you want to become a Pilates instructor? What are you going to do with your life? You worked all these years to become MD in homeopathy, you did counseling, psychology, you're always studying. What are you up to? So, all these questions have always been there, standing right in front of my face. But then, there were moments of doubt where I was like, oh yeah, does this will this really work? But then I had my dreams, which was standing right in front of me, and I knew I am going to be having that good night's sleep. I'm going to be feeling fulfilled after, following what I really love, what I do. And that's where I thought this is my calling and I need to work for it. So Pilates basically is looked upon as a celebrity workout. And more than that, it is also a workout wherein it is a workout to amp up athletes' level skills. So having this as a background from my family as well, it was like, you are a doctor and you want to get into a celebrity workout. Little did that they knew that this has powers, hidden powers, which are not yet discovered. Because Pilates was discovered as a rehabilitative, it has a history of rehabilitation. It was discovered by Joseph Pilates, who's the founder of Pilates in World War I in Germany, right? He was touring in England, and that's where he was, along with these injured soldiers, and he taught Pilates to them, these injured soldiers who were lying in bed. And to his surprise and everybody's surprise, by the time these injured soldiers were upright, they were much more stronger than what they were before they got injured. And this got all the attention to Joseph Pilates, and people were behind him, specifically the brown shirt people were behind him to train their troops, and he had nothing to do with them. So he fled to US, and that's how Pilates was still under the wrap and known as a celebrity workout. It was known as a secret celebrity workout for a long period of time, until now that it's known and it has penetrated the rehabilitative landscapes and is seen as an alternative to surgery, to places where chronic conditions, where medicine can do very little, where alternate therapies can do very little. Pilates, as an exercise science, is very foundation to rehabilitation. It's where it has its rooting in science, where we make the bodies more aware, so that with the aware body, with more of corrective movement patterns, you don't enter into that repetitive abuse of your body so that you suddenly get injured. It's not that suddenly you get injured, it's happening repetitive. Maybe you're sitting, with a tucked pelvis for years together, and suddenly one day you are picking something up and you have a sprain on your back. And you're like, oh, what did I do? I just picked something up which is so light, and how did I get this injury? But then that was not that day. It happened over the period of time. So that's what we do. We make bodies aware about their correct way. We get them more aware about how they should sit, stand, walk. And that's where, I am really passionate about. And I would definitely want more people to collaborate with me on this vision, visionaries like you, who can make this vision a reality. And yes, I had a lot of doubts, and cases like, I very well remember, to name few, just one of them, I had this national swimmer who came to me and who had literally given up his swimming, definitely. And he was under a lot of medication, nerve blocks for his shoulder pain. But then it did not give any relief. And he was not only, he had given up his career, but then also his activities of daily living. A young chap coming to me and still being very skeptical about Pilates. And within few weeks, he not only returned back to his sport, but then also he was very happy with the way his quality of life drastically improved. He went better at his sport. So all of these really, are testament that, I do what I love to do, and that is justified to my heart, to my soul. It speaks to my soul. And, no amount of resistance could stand with the kind of things that feed my soul. So here I am, standing in front of you and sharing my story. Thank you so much.
Well, thank you, Dr. Deepali. Are we going to have Pilates right now?
I would love to, We have the stage ready. How many of you would love to have a Pilates session? We can right away go in for that.
Okay, I think you will.
Yes, go ahead.
I think you will have it later.
Sure. Please connect with me if you would love to have a Pilates session. I'm available these 3 days, and I would love to teach any one of you who wants to learn Pilates. Thank you.
Thank you, Dr. Deepali. So, head nurse Diane, you already mentioned about somebody who has been supporting you, but is there other special challenges that you have faced as a woman leader? Is there anything you could come up with?
Thank you for the question. As a woman leader, there's a lot of challenges actually. There could be work-life balances. It could be lack of mentorship. Sometimes also there's no room for improvement. Like we don't have the space to grow. So for me, I would say I'm blessed that I'm in the right path, and I've tapped or connect with the right people. They guide me to be me, to reach whatever goal that I need to reach. And also, by the way, just to let you know, where I'm working right now, it's not only about aesthetics. It's not about Botox fillers. It's actually functional medicine meet aesthetic. So as my boss would always say, before Botox, let's detox. I like this because, to get the maximum benefit of whatever procedure you have, you should have a body ready for the procedure. You should have a body, for example, if you're going to go for surgery, if you're going to go for anything, let's say laser for your melasma or whatever, you need to know the core problem of what's inside your body. You need to understand. And then by that, of course, you're going to diagnose correctly, and by that, you'll have, the exact procedure or intervention that you need to provide. So it's my vision, to be honest. It's not because I'm from the aesthetic, it's like Botox fillers, okay, that's it. No, it's more on functional and aesthetic. It's more on understanding deeply our body. It's more understanding deeply what's inside us. So, yeah, and going back to the question, yeah, there's a lot of things that hinders me to be a leader. Maybe I would say here, language barrier, that would be. But because we're in Arab country, but women can endure pain. Women can endure anything. So I think, yeah, with the right people, with the right tools, with the right direction, goals, we're good to go. Thank you.
Well, thank you very much for a very nice answer. So what do you think, ladies? Is there a difference between a female leader and a male leader? Is there or is there not? Because, according to the statistics, just 3 years ago, in 2021, 65% of the STEM, let's say, profession holders were male. 35% were female. This did improve in 2022, so only one year later. So 45% were already female. But there are still several, especially subspecialties like IT and so on, where it's dominated by male. And do you have any idea why is that, and what makes the difference? Is it our natural capabilities, or what do you think, Dr. Deepali?
Lovely question. Actually, I believe it doesn't matter basically whether male or female, but in the characteristics that define that this would really go up would be, creativity, innovation, free flow, of course not to forget empathy. Yeah. And you would see that more than males, females are known to be more empathetic. I'm sorry, my dear males over here, but then yes, that is how it works. And emotional quotient also plays a very important role. When we have a great combination of these characteristics, I think it sets the stage up for any person, be it male or female, for success. Talking about specifically this, it is also important that the person needs to see beyond the patient. You need to see the person. I hope I'm making sense.
Yeah.
So it's not just
You are.
not just the symptoms, you know. You can't just treat the symptoms. You need to see the person, because that's where the answers are. And that's when you're not going to just fix a problem. You're going to give them lasting solutions. And that's what people are looking for. And that's what is the future of healthcare industry. I believe that is the winning edge for anything that you want to set yourself apart, is you need to have lasting solutions and not just fix it up temporarily. Definitely. I believe this. What do you think, Dr. Marika?
Well, thank you for the question, and I think your answer was very nice. I mean, it's sort of a stereotypic to say that, let's say, male are not empathetic. What I think is important is listening, taking the client or the patient as a holistic person, seeing beyond the symptoms, seeing beyond the disease. And especially me, as an originally oncologist, it's treating the whole community. It's treating the family. It's treating the bigger picture. It's also providing whatever social, spiritual, religious care. And let's say most of all, it's always giving the hope for a better future. So that's how I see it from my side. I don't know, head nurse Diane, do you have anything to add?
Thank you. I think there's no difference, to be honest. Men or women can be successful leaders, and it actually depends on how they use their leadership style, depending on the need of the organization or the team. So everyone can be a leader, but we need to inspire more leaders to be. So that's it. Thank you.
Thank you very much. So I would like to shift gears a bit now. So I would like to ask you, ladies, what do you think could be the 3 topics or current issues worldwide that we should tackle, especially as female leaders? What is your opinion?
Thank you for this question. This is a burning topic, I'm sure, and the future of healthcare. So being on this stage, I feel it's my responsibility to share this message that worldwide we need to take care of few things which are the future of healthcare. Number 1 is holistic approach. We cannot go wrong if you're holistically treating somebody. We need to cross the boundary of just seeing the patient, as I told you, right? And then the second one is mind-body connection. We all know how important mental health is. Apart from that, the interconnectedness of mind and body. We are living in a disconnected body. We are not aware about our bodies, and that's where the diseases, dis-ease, is also not recognized in our body because we're so disconnected with our own bodies. We need to come back to our bodies so that we live in our bodies with our mind. That is the second thing that I feel is very important. The third thing is movement as medicine. We all know that it's very important in today's world to move. And we all know the benefits of moving, because moving can directly influence your mind, your body, your physiology. Everything changes. And that should be prescribed alongside medicine. These are the top three things that I think should have the focus if we talk about the burning things and topics in healthcare. And that's where I think future will also be leading towards. Thank you.
Well, thank you, Dr. Deepali. Very nice. Nice answer. Head nurse Diane, do you have anything to add?
I believe Dr. Deepali already raised a really good points. I would say maybe for leaders, or let's say for human being, we just need to know our limitations. I would like to share a story about the water bottle. If you're gonna go to, let's say, Bakala, they say it in Arabic, or how do you say that, in mini mart or stores, water bottles, I think the price starts at, let's say, 2 dirhams. But if you're gonna go to the airport, water bottles starts at, let's say, double, 10, maybe, or triple, yeah. But if you go inside the airplane, the water bottles become more. It might go 35. It depends on the airplane or the airlines. So basically, that's why I'm saying about limitations. So you need to know your limitations. Maybe you're not in the right position. Maybe you're not in the right place right now. So you need to know your limitation. At the same time, be humble. So I think that's it.
Thank you very much. Very nice answer. I like it a lot. So what about, if we think about the future, would you ladies have any advice for the future young female leaders or young ladies wishing to become global leaders? What would be your advice to them?
Lovely. I really feel all you ladies, if you are looking and are into healthcare, I would want you to believe in yourself. Don't give up just because you think that this will not work, and specifically you want to see that you are happy doing what you do. You should know the reason why you're doing this. If you have the why very strong in front of you, then you don't have to see anything else. You need to just go ahead and take it right there, because people always believe that success comes and then you will be happy. But then people really forget that when you are happy and loving what you do, success will follow. So it's the other way around. And people throughout their life keep thinking that when I'll be successful, I'll be happy. So you need to find what you really love to do that makes you happy and go behind that so that you are successful. And I would want you ladies to lean into your strengths. Don't give up and redefine the wellness and healthcare industry. It is about to change the landscapes. You need to believe in yourself. And surround yourself with people who really inspire you, because I have seen it myself. It's not the will. It's not the will. It's the environment which is so important. If you have people who motivate you and inspire you, for who you are and where you want to be, you will be successful. So more than will, it is the environment. So change your environment if you need to be at a place. Have people who really lift you up. And you will not see back, definitely. Thank you.
Well, thank you, Dr. Deepali. Personally, I really agree what you said. So first of all, believe in yourself. You can do it. There is nothing wrong with you. You are as good as all the others. And then thirdly, get a good mentor. So learning from the people who are maybe more experienced in the field is very beneficial. Have a supporting mentor, have a supporting boss, or have somebody supporting you. Of course, you would need to have your close ones, your family members, supporting you, but in addition to that. So Diane, anything to add?
Thank you. I would say own your expertise. Be confident. Continue learning. Don't stop yourself from learning, relearning, and to know more. This is one way of, making yourself confident on your craft, on the things that you're doing. And also, like what Dr. Marika said, mentorship. And also what Dr. Deepali said, go to people or places that inspires you. And of course, it will bring you and give you more inspiration, and it will help you reach your goals.
Thank you very much. Nicely said. So ladies, do you have any questions or comments in mind you would still like to raise before we open it up for any questions? Do you have anything you would like to say to the audience?
We're good. We would love to hear from the audience now.
Yeah. So if I may read, I had to write it down because this is too long. So this is one of my life philosophies. It also applies to all the males, not only females. This is from Ralph Waldo Emerson. I guess you would know him. So the title is, What is Success? To laugh often and to win the respect of intelligent people and the affection of children. To earn the appreciation of honest critics and endure the betrayal of false friends. To appreciate the beauty, to find the best in others, to leave the world a bit better, whether by a healthy child, a garden path, or a redeemed social condition. To know that even one life has breathed it easier because you have lived. That is to have succeeded. So with these words, I would like to thank you, dear audience, dear panelists, and I would like to open the floor for any questions, comments, or any other, let's say, whatever you have. Thank you very much.
Good afternoon. Hi, I'm Baldi from Lumina Health, and thank you for an insightful panel discussion. I was wondering if you could give any advice to women in leadership in healthcare, especially in the region of the Middle East, in how best to overcome or tackle gender bias in conversations maybe with payers or with investors within healthcare.
Well, I mean, as I have been based in this region only for 1 year, I guess you have been here for a longer time, but I'll start let's say the answer. So what I need to repeat, believe in yourself. Of course, I mean, here you need to be respectful for the culture. You need to be respectful for the other party. But also, as you know, even the government of Dubai, for example, they do have specific quotes for women and men. So it's very much empowerment of women in this city and also in the whole UAE. So do not be afraid. Just go as yourself, be respectful, and be brave, be bold.
Thank you. I would like to share a story because I started after I finished my nursing, after I graduated nursing, I started working in the Philippines, and then after in the Philippines, after a few years, I went to Saudi Arabia. So in Saudi Arabia before, women are, you can say, restricted in a way. We need to wear abaya, at the same time we need to wear the hijab. So, and also we cannot go out anytime if we want. It's totally the opposite here in UAE. Women here are empowered, women here are given chances to lead, women here are, I'm not comparing that Saudi Arabia is bad or UAE is good, but it's a way of saying that we're fortunate that we're here because we can be leaders, we can be women leaders, and we can inspire people. So I think that's it. Thank you.
Thank you very much.
Thank you.
Good afternoon.
Hello.
Hi. First of all, thank you for the discussion, for the nice topic. When it comes to creativity and achievements, this has nothing to do with being a male or a female. It's about just you keep on believing yourself and move forward. And you should not think about, okay, I'm a female, this should be done or not. Just go ahead and do it. And don't speak, just show the people your work. Show the people your abilities. And you should not use the word limitations at all. Because whenever you think about something, if you think about it, you prepare yourself for that, it will come in front of you. So don't implement such words like limitations, I cannot do. So the only thing here, like in Arab countries or Middle East or overall, some limitations can come when the ladies, for example, have the time when she would become pregnant, raising kids. So she would be detached from her, achievements for a while. But however, she still can do a lot while she's having the baby. She can go ahead and just involve herself with education. So she can still continue with her improvement, with her achievement, and she can still do more about it. And now, like, the last sentence I hear was like, we can be leaders. We are already leaders. And I just want to comment on the point of, how we dress. This has nothing to do with our achievements. We can dress, a abaya or a jacket, but this has nothing to do with achievement and progression. And now in the Middle East, ladies now, they become already leaders. And it's not like the past when they were not given the chance to go forward, Another thing, you should not wait from the support from everyone around you. You have to support yourself. You have to encourage yourself. Thank you very much.
Thank you very much for the comment. Fully agree.
I really appreciate your comment from Saudi Arabia. I guess, yes, maybe you are speaking about 20 years ago, but in truth, this is me. I'm a surgical oncology. And I'm Saudi, I born in Saudi Arabia. There are a lot of restrictions, as you said, but if you believe in yourself, you can do whatever you want. So I was one of the few leaders in surgery. I finished my residency, I went to Harvard, I went to Oxford. I fight for myself. By the end, I let the people trust me, and I put my footprint. So I'm the director now for the training. I have a lot of female, and I'm supporting them. I guess initially, because we are females, we don't have mentors, as she said. Mentors and coaches are really very important. And this is what I'm trying to do now. So I'm mentoring them, I'm coaching them, and I try to do all the best for them. It's really, the leadership is nothing with what you wear or what is your religion, what do you look like. But there are some restriction everywhere. So I take my PhD from United States. To tell you the truth, my thesis was about female surgeon leadership. And when initially I went to United States, I thought that I will find something different. I was under the same impression that Saudi Arabia maybe have a restricted culture, but I figure out that there are barriers everywhere. You cannot really think about fair environment everywhere. So at least in Saudi Arabia, we have the same salary, male and female. We have the same leaves. We have everything similar to each other. We need to work in the stereotype, yes, because we want them to believe in us as a female. But there are barriers everywhere. I'm glad that I don't have the same issue in my salary, and which a lot of females, they are suffering from it in different countries. I don't think that, it's a matter of a restriction of what I wear, but I think I work a little bit on how the people think, because I want to prove myself as a female. We usually have men leaders, but we don't have a female. So it was my job. It was harder than maybe the next generation, because if I make it correct, the others will believe in female and they will give them more. I'm glad that my country now, there are a huge, huge transformation. There are a lot for female, and they can wear whatever they wear. So I'm wearing it because I want to wear it, not because my government or my culture want me to wear it. So really, restriction is everywhere. Have nothing with the religion or what I wear. Thank you.
Well, thank you very much for your comments. Thank you. Any other questions, comments?
Thank you so much, ladies. That was very inspiring, and we all have to remember that each of our journeys all began with a single step, some more challenging than others, and I have the utmost respect for every single one of you in this room, because we all took that decision to start studying and open our practices and start to help people and save lives. So let's give everyone in the room a round of applause. Thank you so much, ladies. You're very, very welcome. Thank you for joining us on the panel. And now we're about to switch gears and do a little bit of a 180, as we are going to be discussing cyber security. Now, this is something that I have hosted in the past, and cybersecurity is a big, big, big deal right now. And it is so easy for any one of us to fall victim to handing out an OTP or accidentally leaking data. And I think being in the healthcare, protecting patients' data and your own data is very, very important. So as we switch to this topic, the next panel discussion is cybersecurity in digital health, safeguarding the patient's data and privacy. As healthcare goes more and more digital, the importance of safeguarding the data has never been more important. After all, trust is the foundation of healthcare, and breaches can undermine the trust in seconds. This panel discussion will explore how we can stay ahead of cyber threats, protect sensitive information, and build systems that patients and providers can rely on. It is a must-attend for anyone passionate about the intersection of technology and healthcare. So, part of this panel discussion, we are going to be welcoming back to the stage UC Mata and our panelists Aditya Talapragada, Professor Dr. Tobias Winkler, as well as Dr. Amal Afhadi. Please put your hands together as we welcome our moderators and panelists.
Okay, good afternoon everyone. Last panel discussion for the first day of the Health 2.0 conference, and we are going to talk about cybersecurity in digital health and safeguarding patient data and privacy. And I think that would be good to start from the introductions. And so I'm going to ask from the panelists to introduce yourselves and tell why you are interested about cybersecurity.
Good afternoon, everyone. I'm Aditya Tallapragada from AKT Health. We are a life science and data analytics firm, and then we have been working on a lot of digital platforms focused on patient experience, improving patient care. And then obviously every aspect that we design an application or generate the data or generate evidence, every aspect has been focused on how we give that extra layer of security in the entire designing of the app. We have been working a lot on clinical research applications, medical applications as well. Slowly I'll discuss a bit more detail on how we can actually, how we have been working on this area. Thank you.
So my name is Amal Hafni, and I'm a breast and surgical oncologist. Actually, I'm a physician, so I'm a health provider. And I'm also the chair of the research of surgical department committee. And in the same time, I'm associate professor in Al Faisal University. The extra thing that you don't know about me, I'm a board member in IT Solution for Cybersecurity.
My name is Tobias Winkler. I'm a professor for regenerative orthopedics and trauma surgery at the Charité in Berlin, at the Berlin Institute of Health, in which board of directors I'm also in. I am running a lot of clinical studies with patients in the musculoskeletal sector. Of course, we are confronted with the Charité is a big hospital. It has 24,000 employees with cybersecurity, and also for our patients in the research part and also in the clinical part.
Okay, thank you for the introductions. The first question might empty the whole table, but is cybersecurity slowing down the innovation and adoption of the digital health solutions?
I think to take it, because I think people haven't been taking cybersecurity very seriously. Of course, every time you design a new application, the cybersecurity aspect of it, the security aspect of it comes extreme last thing. So I think the innovation is not stopping, but at the same time, the threats are increasing. So I think once again, if you actually have to create some kind of an application with multi-factor authentication and then things where you make it easier for the patient, then obviously you are actually making it complex to use the application. So that's where sometimes we are not able to launch applications which are not very patient friendly, considering the fact that you have to take care into different kinds of security layers that come into the application. So to some extent, yes, some kind of innovative applications are being layered because of cybersecurity, but then still I see that the aspect of cybersecurity is not being taken seriously when designing these applications.
Again, yes, my answer is to the little extension, yes, there will be some delay. And the reason behind that, not only what he said, but we will forget about the other hand. So we are innovating in our technology, but other people who want to attack us also, they have their innovation, so they keep upgrade themselves. The risk here is not because of us or because of the people who innovate the application or the technology, but we forget about the general population. So there are two parts who are familiar maybe with the technology, but the majority of us as in the middle or maybe below the average. So it takes time to let them be aware and to train them. So it's not only the application, but also you have to train the people. This takes a lot of time. By that time, a lot of attack will happen.
I think the answer is clearly yes. The question is, is it a problem, or do we have an alternative? And I think we do not have an alternative. The alternative will be only to make it better, to make it faster, and to make it easier. And I think this is the most important thing around that. If you look into regional discrepancies between data protection laws, for example, this is, for example, an issue that we as a community could solve or could help solve. Because I'm Austrian, but I work in Germany since 20 years. Germany has one of the most restrictive data protection laws and also implementations, which is slowing down a lot, but which is also protecting a lot, of course. And looking at the research part, because this was the question, we do see that a lot of companies and also a lot of spin-offs of academia are struggling with these very, I would say, dedicated and very penal and very strict laws and the regulatory system of the GDPR there. But nevertheless, if we then have a product, it's super safe on the market. If I look at other markets, overseas, for example, where it's a bit easier to get over these hurdles, then you have a lot of products, but they still have to fix a lot of issues. So the question is, what is the better way? I have no answer to that, but I think we have to work on easing the processes for developing our products in order to protect them from over-regulation, but on the other side, not to be too low level.
Yes, I agree. What I've seen actually in the market, and not only talking about data security, but the regulation and compliance overall. For example, I've seen like Switzerland is not part of the EU, and EU legislation doesn't really bother the Swiss companies. So actually, Switzerland has changed the legislation like earlier. Before in the EU, there's a new medical device regulation that sets a lot of compliance needs for the software developers as well. And previously, Swiss law only accepted solutions that are regulated or certified in EU. But after EU introduced the new MDR, they changed the regulation that you can introduce a solution in the Swiss market also if it's certified in the US, and that is to ease actually market entry for the local companies, as Switzerland is known to be a medical device hub. So that's a clear example of how regulation can slow down innovation. What do you think is at the moment the biggest threat in a cybersecurity side?
See, if you look at most of the threats that we have seen in the market, especially if you look at the HIPAA journals and everywhere, we see still the ransomware, phishing attacks are the highest. The access control has been biggest challenges. That's what we see. I think one of the other challenges we see is that most of the systems are still not having a zero trust feature, which is also a biggest challenge, where having a continuous verification even with zero trust systems will actually improve that. But that's what I think ransomware has been the biggest, followed by phishing and then the access. These are the biggest threats that we see in general. Of course, I actually am based in Japan, where the technology, there is no cybersecurity team in any of the hospitals. Even if you look at the biggest of hospitals, you don't see a cybersecurity team. And most of these people, they don't really understand the value of the data that's sitting on their on the back end. And then usually if you go into their network, just like hospital network, you can actually access to the entire electronic health records. So obviously these get analyzed and then sold into the dark net. So I think one of the biggest challenges is still the access. The local access is the biggest challenges. When we look at the Europe, and then we see zero trust, and then the phishing, ransomware are the biggest threats that we see in the market right now.
I totally agree with you, but I will add also the training of the staff. We are missing that. I'm glad that we can see now there are a bachelor degree in cybersecurity. There are a lot of courses, which is really important, but I think it should be something mandatory for organization like healthcare. Maybe being a healthcare institution attract more actually attacks comparing with other companies or institution. The other part of it, actually, I will think about the prices. Still, the prices is high. If we want to really have a good cybersecurity to prevent those attacks, the prices is really high. And I'm glad that you speak about the healthcare data. It's really huge data. So we want to store it. You want privacy. It will cost more and more and more. So the cost is really something you have to think about it. The other thing, actually, I think the legal part of it is very important. Even if we think that we know a lot about it, but still until now we cannot really know all the thing about it. And this is another issue which we need to orient ourselves about it. This is the major thing, but because of that, this limits the healthcare provider and leaders from using a lot of stuff. And this also will prevent us from using the technology on time.
Yeah, the biggest threat, to my mind, is actually, again, working in a large clinics, the dependency of our systems on IT systems. If you would have asked me 15 years ago, maybe already 10 years ago, we would still have, if the system went down, we would still have possibilities to get a patient funneled through the system with admission, with anesthesiologist examination, and with surgery, and with discharge. If now the system is down, nothing happens anymore. So we were confronted with one attack that shut down the system for only, only a little time, but the whole clinic stopped. And this is, I think, how we, or what we have to build in the healthcare system at least, alternative systems that immediately kick in and that allow us also, if it's on a lower level, to really run everything. Because we have, of course, you know, but we have patients on ventilation, we have patients on full life support, more or less, and we have, of course, patients who lie in bed and don't need any IT. But in this spectrum, of course, we have super vulnerable patients, and we have super on processes, and we have super non-vulnerable. And for these vulnerable processes, I think, and for the whole system, we need robust systems that help us in case there is an attack to also treat these patients without any problems at all. And this is, to my mind, the biggest threat.
Interesting, different aspects. Thank you for the comments. I actually have to add to your comments. So I remember first time when we deployed our solution in one of the university hospitals in Helsinki and in Finland, and their data privacy officers were reviewing our papers and documents, and and we were really doing the first pilot with around 10 patients, so really small scale. And at the same time, there were newspapers that someone in the hospital had drawn out like hundreds of papers full of medical records to the trash bin, and someone had found them outside of hospital. So talking about the data security. But what is, in your experience, the biggest incident that has happened? Biggest like a data security incident or that has happened in your career?
Actually, the thing is, we were working on implementing a new system for a hospital, but we haven't been attacked directly, but the hospital, it was already been attacked because most of the data was already stolen, and then they didn't even realize unless we went into the hospital, and then we were easily able to get in, and then we saw the access log that they have been continuously being taken away the data. That was one of the things, but obviously, just understanding, you had these legacy systems which were offline, and then these are these could be few challenges where, legacy systems, they could be easily accessible with the wireless network. The security is less, but the access is good. But then hospitals, how we protect the legacy systems, security is also one of the things that we always usually look into. But you are right, sometimes the system goes down, the entire infrastructure goes down these days. But in the past, you had this, offline storage inside because even now, most of the clients that we work, especially in Japan, they don't prefer any online systems. They want most of the data to be stored offline and then inside the hospital to make sure that they have the right access in the right time. But at the same time, when you are not automating the processes, it's very difficult to analyze the threats that are coming in, especially when there is multiple networks in the same hospital and the hospital is too big to manage that infrastructure. Obviously, if the automation processes are not in place, the third parties are not connected, and we see these kind of attacks happening on the hospitals all the time. But then it's a very complicated scenario these days because obviously everyone wants to be online. We want real-time access to the patient data, especially in most of the cases these days. You have continuous monitoring devices, continuous wearables, so everything is becoming continuous data transfer. When it's a continuum that's happening, it becomes more complicated for us to actually predict this data. And then with more and more wearables coming into the hospitals, more and more devices coming in, you can't really put that legacy systems all inside the hospital. Of course, you have to have automated threat alert systems and everything's in place. So yeah, in short, that's where we still have these incidents that are happening from small hospital perspective. But if you look at big software as a solution providers, SaaS companies, I think the threats are completely different. Usually, your entire systems get hacked, and then the loss is a huge, a lot more compared to a single hospital.
I cannot recall something really huge recently, but I can recall one incident of, a strange email in which they have some worm on it a few years ago. And actually, to tell you the truth, since that time, we are not accessing the email easily, so they don't accept any foreigner from outside, so we use it internally more. And they have to trust any email coming from outside, otherwise they will not deliver it or they will not send it from our emails. Regarding the backup system, I'm glad that we have a backup system. So when the thing really shut down, we have a backup system. So in each floor or each unit, there will be at least 1 to 2 backup system and software. I guess maybe there will be some issue later on with synchronizing the data, but they still can do it. And still until now, we are still having paperwork just in case, and we have to make sure that everything has been scanned and put back in the system. But to tell you the truth, yes, because we are afraid from attacks, so they are becoming very restricted, so we are not using even the flash. We can use any CDs. We can do anything, really, except through the IT or the people who are really know how to use it, and they can scan it before they use it. And I cannot transform any information from my own laptop or computer to the hospital or the university or the research center institution. So they become very restricted, I will say, but the number of attacks is much, much less.
Yeah, same here. We can't do anything anymore with our computers there except for working within the system, which brought, of course, a lot of problems. But as I said, it's all about easing these processes. I think the biggest one I already told you, this was when the system went down for, I think it was 2 or 3 hours, and this was a big problem. And the attack was a very central attack, not on our servers, but on worldwide servers. You surely know that. The biggest one that I've ever experienced in my life is an old one. My parents are also doctors, and they had the first computer system. And my father had a crash, lost 25 years of data of all their patients, 10,000 patients, and the backup system was corrupted. So this was a story from the 90s, early 90s, and this thank God or whomever is something that we can omit nowadays. But on the other side, to make it super secure, it's also, of course, super complicated. And we also try to scan all the documents that we have, but they're also digitally then stored, and they are not physically stored. And this also poses a problem if somebody really gets into the system, if the layers are not super protected. But I think this will be the future, to just make this processes easier, and it will be your task probably.
I have to share one example, luckily not from my life, but in Finland, and only 2 years ago. Like hospitals and clinics, of course, they require all the possible regulations and evidences and audits from their providers, but there was a, not even small, but like a smaller mental health clinic chain with 30,000 patient records, and they had their house-made EMR system, and the hacker had found that the username and password to this system was root, and hacker downloaded information, all the possible information from 30,000 patients, asked for the ransom and money, or he would publish them publicly in the internet, and that was of course a big incident. That clinic went into bankrupt. The CEO of Avu was also the founder of the company, and the developer of the internal systems is in jail. But also the hacker, he made a mistake. Or at least he says that he didn't have a purpose to actually publish the information. He only said that he will do that, but he accidentally actually published all the information as well. So it was for a couple of hours, the information was all available in the internet. And especially as it was a mental clinic, there were some celebrities, so it was a very, very, very big thing in Finland. But balancing the security and usability, how can we design secure systems without, or we cannot design secure systems without compromising the usability, but what would you take into account when designing the new systems?
Yeah, I think this is not just happening with the looking into the cybersecurity aspect as well, because when we are now designing clinical trials, we are actually taking patient consent and how better the system would be. So when we design the protocols, like bringing in patient voices for everything we do, I think everything has becoming a bit more patient-centric these days. So I think without most of the applications that we design are first being taking how the patients want to see this. Of course, we are not compromising on the security part. Because if you see, Dubai has most of its data on blockchain. We also are using enterprise level blockchains. That's one way that we could easily transfer the data. At the same time, we are also very much concerned about not giving too much information on the architecture to the patients and the providers. We are just focusing on the security part completely separately, so that we keep the application as simple as possible. But at the same time, we still have to include multi-layer security features, and then zero trust features and all. Now the usability part, I think people are getting used to it now compared in the past. They also understand the value of having those kind of systems in place. So there's always kind of the voices being taken from the providers, from the patients, on how better that how user friendly we could design, at the same time not compromising on the security part of it.
I would say I will not compromise it, except it's a life-threatening, really. I'm a surgeon, I have an emergency cases, but otherwise I will take it seriously, because any simple mistake, it can really cost you a lot. So I will take it very serious. I will not compromise it at all, but take it short and ask an expert if you don't know, or try to build your experience and know all the policy and the procedure. But any compromisation, they mean you may do something, or you may harm yourself or somebody else.
Yeah, Same here, basically. Yeah, nothing more to add except for maybe that our mental health data within our clinics has an extra protection layer. So not even me can access the data from inside. You really have to. This has to go a direct and official channel. Whereas, of course, I'm also a trauma surgeon, so I do have or can access data from other patients because I need them in a lot of cases. But for the psychiatric diagnosis and also treatments, I can't.
We have an interesting panel, like we have people from 3 different continents, so, or like 2 different continents, but still you are in Japan, so it's almost its own continent there in Asia.
Scandinavia, Europe.
Yes. But what kind of authentication methods you have in use in the systems? What kind of authentication methods, like a
single sign-on,
yes,
like multi-factor
and
authentication,
what kind of identities you benchmark?
I think it mostly depends on the systems that you have. Usually, most of the hospitals have legacy systems where the authentications are very, very basic. But when you are implementing new systems, obviously you have multi-factor authentication, you have 2-factor authentication, you also have single sign-ons at the same time for multiple applications. But I think it's completely varied from provider to provider for our side. It's a very wide authentication system because we are basically a technology company. So we usually sometimes work with whatever we have got on the provider side. On top of it, we have to implement security policies. But most of the time, it also depends on their security policies that the companies have, and then we have to stick to their authentication methods and build something which is into their policies. So yeah, it's pretty wide in terms of what kind of authentications we use. It differs from provider to provider for us.
Yeah, I agree with you. It's almost the same. We have a restricted policy in our institution, so the password should be changed every while. And you have, I think, 3 trials to enter it correctly. If you didn't, then you have to call the IT, and you have to prove that you are the same person or not. You should use a special feature for the password, and then actually it should be complicated. You cannot use the same password if you use it before for the last 5 years. And when you enter the system, actually, there are more questions to be answered, as he said. So my patient, maybe it's under my name, so I will go there and I should identify what I am. I am a treating physician, I'm a consulting physician, I'm a reviewer, I'm a researcher, I'm an investigator. So you should go through that, and that will be automatically in the system. So any abnormal move, you will be contacted immediately.
Yeah. Same here. We switched to 2-factor authentication recently only, but I have to say that the medical systems and the SaaS systems, or the KISS systems, or the informatics systems of the hospitals, are not yet, at least in Germany, really well in authentication. We still are typing in passwords. I mean, this is really the past. And if the passwords are secure, you all know we have 11 digits. We have mixed passwords. We have small caps, large caps. It takes time, even if you have an easy one, And if you then end up, when I want to enter the hospital from my secure laptop outside, when I'm on call, for example, look at the X-ray, I have to first go into the system of the computer with a password. I then have to go into the VPN. I then have to establish the virtual platform, and then I have to go into the official system. So I type in 4 times the password, and then this 2-factor authentication kicks in. So and then if I use my phone, I just look at my phone, and then I would see the X-rays, This is the reason why a lot of our young guys always use WhatsApp, for example, which is crazy, of course, from a data protection or security. But if you have a patient that is critically injured, I mean, then you ask yourself, what is security, and what is safety? And so these problems still have to be solved, and they are not yet solved. So again, I'm putting the circle to what I said in the beginning. and easing the processes, that's the most important thing. I think we need these protection layers, and they even have to be better because also the attackers get better, but we have to make them easier at a high security level. I think this would be the task.
Very, very good comments. I can comment from Finland perspective. So in government hospitals in Finland, we actually have also like a physical ID cards for all the doctors and nurses, and only way to access the system is to put a card to a card reader. So it's one additional layer, but on the other hand, I have understood at least that there's only one password to be typed after that, and you are logged into the system. That was the provider side. How about patients? How can they access their data in Germany?
In Germany, they have the right to demand all the data that has been collected on themselves. So, but they have to go to the radiology department and get it, or they have to go to the orthopedic department, trauma department, and get it. We have already an electronic patient card, but it's not yet on a Scandinavian level, I would say. Yeah, if I look at Denmark, for example, it's much better. I don't know how the situation in Finland is, but it's the dream of a doctor, of course, to have everything on one card, and also the dream of a lot of patients. If I consider the patients that come with 100 CDs that I then have to put into the system.
Is there, by the way, a national ID which how you could identify the same patient in hospital X and hospital Y?
We do have this, but it's not yet fully implemented in terms of functionality. So what I would wish for is I put in the card, have all the data. This is not yet there due to data protection laws, and we have not overcome yet. I don't know, how is it in your systems?
We have actually in Finland we have a banking ID which is tied to your social security number, and people actually use that bank ID to access all the health records and such, so you can basically access your data in every single hospital with the same user account, or not user account, it's your bank ID that you use, and you can fetch your data. And similarly, if someone from the government level would need to access to your data, they would use the same social security number, and they could get the data from multiple hospitals.
We are working in something similar to that, but still, some patients, they don't want you to know all the data for them. So we are using the national ID nowadays. If we go maybe 10, 15 years ago, there are a lot of private hospitals when they treat the patient, they don't even take all the information. But for the last maybe 10 years, no, it is obligatory that they use the ID. For my hospital, actually, they can print all the information, all the documents from the application, so they have everything. Only those confidential reports, which we mentioned clearly, this is confidential, it will be locked, and they will not be able to see it. But they will be able to print all the documentation, even the progress note. If they want really a CD or copy from the images, no. They need to go to the radiology and take it, but they will be able to print the radiology report from the same application.
Can I ask you a question? I mean, if you said a certain governmental layer can have access, what if you don't have a very favorable government anymore in Finland? I mean, we're discussing this in Europe a lot, and it's not only governments, it's also insurers, for example, that might want to have this data. So how do you prevent that, for example, your personal data as a patient, now I'm asking you, is protected from non-medical approach?
Of course, you need audit logs, and we see that every now and then in the news that there are, for example, cases against doctors who have seen to watch the data of the patients to which they should access to. So it actually works. Of course, if you don't have a favorable government, everything can happen, and that's very unfortunate in the world where we do live.
This we can't solve.
Do you want to comment?
No, actually, basically, still, as I said, most of our data is still not integrated properly well, especially I'm talking from Japan's perspective. Right now, but they are trying to do something where they'll attach everything to something called My Number, even the insurance card and everything. But right now, because most of the hospitals are still offline. The access from hospital to hospital is still not 100% there. So usually you get a doctor's consent to actually approach another doctor, and then he sends all the information to the other doctor. I don't know how they share it, but usually through reports and things like that. But still, we see a lot of challenges in terms of integrating the data, especially in Japan. Government, like Ministry of Health and Labor Welfare, is pushing to have something like America, which has, FHIR HL7 standards, to have everything, like there's a proper interoperability between the healthcare systems. But of course, there are a lot of challenges in actually protecting and implementing those standards across the country. That's what.
We have 5 minutes time, and we have actually one important topic that we haven't covered at all when it comes to data security, and which is actually cloud services. So how have you seen the approach towards cloud services? We have some cases, I've seen some cases in Germany, and in the past, Germany has been quite strict towards cloud services compared to, for example, in Finland. So what's the situation now, and how do you see the development in the future?
Actually, we are like 100% cloud-based company. We don't work anything offline nowadays, but I think we are trying to implement new architectures, especially, I was discussing about blockchain as one of the solutions, putting entirely where the data is encrypted, and then only the stakeholders will have access to the private key where they can access the data. And that's one of the things as a cloud-based company, we are trying to implement those architectures, especially with a lot of IoT devices, like IoT devices. The data coming on needs more security. But then the biggest challenge what we see is implementing these new technologies has a huge impact on the budgets of the products. So we still don't see that level of advanced technologies coming into the picture, mainly because of the ROI that built. But at the same time, we are still not compromising on the very basic features of the applications, like having multi-factor authentication, single sign-ons, and then zero trust features. So yeah, being a cloud company, we have a very strong checklist, even though the client wants some time to be more user-friendly, but we say that as a policy, we have to follow these as a standard operating procedure in developing something on a cloud.
Yeah, we cannot work without a cloud, actually. Maybe, as I said, the data is really increasing, so maybe what we are doing now, or they are thinking to do, to start deleting some of them, especially if they are really old. Still, when you implement a new application, you need to think about it and how to adapt it. In the same time, actually, the price is an issue. So I agree totally that we need innovation in the clouds and the storing system.
Yeah, actually, my clinics doesn't really allow cloud. So even if you have a recheck on radiologic images, which is fully normally cloud-based, with an AI system, it has to be on the campus, physically. Otherwise, they are very cautious with this. So as long as all the systems are not convinced about the super safety of cloud solutions that has been corrupted a lot of times, then I think, at least in Germany, it will be really hard, which is a pity, because all AI solutions are, of course, will be cloud-based.
Yes, and that's the development. I seen an interesting fact from the Germany. So I can say we are hosting in AWS with no plans to do anything in-house. So probably we have to wait a couple of years with Charité before we enter. But my experience in Germany is that one CIO told me that they are totally fine with IBM Cloud, but they cannot use AWS because it's US based. And
no, it's also in the European Union. Yeah. If you look at data protection, you have to put in if you send it to insecure countries. Yeah. And the US is an insecure country for Europe.
IBM and AWS, they are both, in the end, US companies, and same laws apply to them.
There's also HIPAA.
So sales guys have done their work well. 1 minute of time. What would be your last comments, or is there something you'd like to ask from your fellow panelists? Or
I think we know it's very well discussed. I think what I understand is obviously training needs to happen. More and more education needs to happen. That's what we believe in terms of cybersecurity. How we use the systems, how we protect. What are the kind of passwords? How we store the data. I think it needs to develop from an individual perspective rather than and then it has to come from as an organization.
I totally agree. We need to stick with whatever policy in each institution, because I'm really thinking that each institution, they are familiar with the attacks and they are familiar with the mistakes. And train yourself, educate yourself, and be aware of all the legal and security aspect. Speaking about not only patient, even the clinical trials, the research, it's really important for all the researchers to know the ethical part and whatever they need to do to secure their data.
Personalization of authentication, security and safety, but make it easy.
Thank you. Now, we would still have some time for questions if there are any. 7 seconds. I think actually we have a couple of minutes after this 40 minutes, as far as I have it understood correctly.
Perfect, thank you. I have a question to Professor Winkler especially. So you told us you're using WhatsApp as like the short message service to see documents. What do you think if there was an application available in Germany especially? How much time would Germany need to implement it in all hospitals or just even in Charité?
You mean hypothetically, if this would exist?
I know there is a system that exists, but nobody's using it. So we are working on hundreds of sites all over Europe, and we know WhatsApp is the go-to tool to have a connection between nurses, patients, and doctors and patients.
I have to say 2 things. First, I never said that we're using WhatsApp. Second, I think this is the blueprint of easy communication that has to be reached. And it's easily adopted and easily implemented. So if there would be something like this that would be safe and you can have it on your phone and not on a second phone that you have to carry around with you, then it would be the perfect solution to my mind.
But it will take at least 10 years to adopt.
It's Germany.
Thank you.
It takes a bit, but then it's good.
My name is Niels. Oh, sorry. I'm a healthcare consultant in the Netherlands, so EU as well. And my biggest problem with the EU is that we have all these standards like GDPR, but even in the Netherlands, the AVG, which is on top of the GDPR. And it makes it really difficult for companies to become international and to share that knowledge that they've built up, for example, in Finland, to spread it out to the Netherlands. What is your guys' experience with that? Might be a big question.
It's a big question, and it's unfortunate reality, and we are not talking about like GDPR, as I mentioned before. It's all about regulation, although we are in EU, and in theory there should be one framework of regulations or data security needs. Each of the not each, but almost every country has their own regulations and rules on top of the EU regulations. So I would say that if, and this is very unfortunate, that if a company providing software, for example, to hospitals would like to enter to a new market into Europe, you cannot just go and say that, okay, we are live in EU, but you have to also invest time to comply with the local regulations and at least clarify that you comply with all the regulations. And of course, it's slowing down the commercialization of the software, it's slowing down the innovation in Europe, it's also slowing down the economic growth of the Europe.
Yeah, okay, thank you.
And
I think that wraps up our panel discussion. Please give them all a round of applause. Everyone just take a step to the front so we can take a picture together. And I want to thank you again for tackling such vital topics and offering such actionable solutions. Let's give them a round of applause, ladies and gentlemen. All right, so now as we wind down and come to almost the closing of day one of the Health 2.0 conferences, it is time for our recognition session. It's all about honoring the trailblazers who are driving innovation and making a difference in healthcare and wellness. Their contributions remind us that change starts with individuals and teams who dare to think differently. Now, to help me present these awards, I would like to invite Harold Bautista, the CEO of Callhound Global BPO Corporation, to the stage. Harold? There he is. Hi. All right, so you're going to stand in the middle of the stage for me. These lovely ladies are going to hand the awards to you, and you'll hand them over to our award winners. Up first for the Health 2.0 Conference Visionaries Award, I'd like to welcome Alan L. Krishnan to the stage. Alan is the president of Team Up Corp. He's been involved in the K-12 education and served on university advisory boards. His expertise spans operations, HR, finance, sales, and expansion. Alan developed major medical insurance plans, enhancing benefits and cutting costs for the U.S. companies. Currently, he's developing multi-generational communities, combining luxury living and support services.
Thank you very much. It's a privilege to be here. It's an honor, and it's certainly wonderful to see such amazing participants, and I look forward to further opportunities to interact with everyone. Thank you very much.
Thank you so much, Alan. Up next for the Health 2.0 Conference Excellence in Healthcare Award, I'd like to invite Dr. Verena Paneni. Dr. Verena Paneni is the CEO and chairman of the Sparsha Pharma International Private Limited, Hyderabad. Previously, Dr. worked with Himatsu Pharmaceuticals of Japan at the US for 17 years on the TDDS in various capacities. During his tenure in the US, he established R&D facilities in Lawrence, Kansas, and San Diego, California for drug discovery and formulations.
First of all, would like to thank you from my heart for the organizers Health 2 conference for giving me a nice award. And basically, I would like to thanks to my family and my supporters and collaborators, and also my team of Sparsha Pharma in India. They're working very hard and to support the patients with suffering with the pain management mainly. So Sparsha Pharma making one dedicated to transdermal company. We make only patches, and the reason to start the company in India, because it's the first transdermal company, as well as we wanted to support the cancer patients. At the end of their life, they're suffering a lot with the pain, and we wanted to improve their quality of life before end of their life. So that's main reason which we started. And of course, I started with the fentanyl patch. It's a very difficult one. Then later we introduced so many patches in the pain management, as well as CNS and nicotine patch also for the smoking cessations. And thank you very much for giving me the award.
Thank you so much, Doctor. Up next for the Health 2.0 Conference Excellence in Healthcare Award, I'd like to invite Dr. Hamza Hassan. He is a public health consultant with over 13 years experience in emergency health response and management. He has actively contributed to the control and mitigation of several epidemics and pandemics, including COVID-19, cholera, hepatitis A, and measles. Additionally, he has provided expertise in the response to national disasters, as well as complex settings like cross-border health interventions, and he was assigned to establish the first public health emergency operations center in Syria.
Thank you very much. Sorry, I lost my voice yesterday, so I cannot speak louder. Thank you very much for this award. I'm very glad to be here with such great leaders from different aspects within the healthcare sector. For me, this is like this is a reflection of 13 years of achievements within the public health industry. For me, public health is not only a career, but it's a commitment to a healthy lifestyle, commitment to have access to all people to quality health services, and also a commitment to establish a resilient healthcare system that can survive any type of health crisis. Coming from Syria to Dubai is like a huge step. It's like moving from working in a healthcare system that is fragile, has been suffered through the years from different crises, to a very high-tech, well-established, well-structured healthcare system in Dubai. But like, no matter where we are, we can always contribute, have a great impact on the global public health, and we can also make a better future to the new generation from different aspects. Thank you very much.
Thank you so much. And up next for the Excellence in Healthcare Award, I'd like to invite Jayan K to the stage. Jayan is a visionary, enterprising, transformational, and hands-on healthcare leader with strong business acumen. Over the past 20 years, his experience has spanned across multicultural and multi-geographies over the GCC, UAE, KSA, Oman, Qatar, Kuwait, and Bahrain, as well as the India region. He's currently leading the Cutis International as its vice chairman and CEO.
Good evening, everyone. Thank you so much for the organizers for honoring me with this. Since last 20 years, I've been establishing hospitals, clinics, and medical centers across GCC and India. Certainly, this recognition is a very incredible privilege to me, and I have witnessed many discussions today, insights today. When you look into the management perspective, whether it is burnout, whether it is digital strengthening of the healthcare system, wonderful panel discussions I witnessed. Thank you so much for the insight.
Thank you. Up next for the Health 2.0 Conference Excellence in Healthcare Award, I would like to welcome Julie Toma to the stage. Julie, are you here? We'll just skip over that one for now. And again, for Excellence in Healthcare Award, I would like to welcome back to the stage Yussi Mata. Mr. Mata is the seasoned CEO with extensive experience in the B2B, SaaS, and healthcare sectors. As the founder and CEO of Buddy Healthcare, he has successfully led the company to significant achievements across multiple European markets, securing high-profile clients and driving innovation in hospitals. His passion for improving hospital efficiency and patient outcomes drives his commitment to advancing the healthcare journey.
Thank you for this award. I've been building the company for 9 years, and it's many times very lonely work to be a CEO and entrepreneur. In the early days of the company, when the company is like a pure startup, there are a lot of competitions and we get multiple awards. But now, during the last couple of years, there haven't been too many awards, so this means a lot. And although I said that being an entrepreneur is a lonely job, I have to say thank you to our team at Buddy Healthcare, because it's all about having a great team when you are building a company and building a global company. So without a team, this award wouldn't be in our meeting room next week. So thank you.
Thank you, Yussi. All right, for our next award for excellence in healthcare, I'd like to welcome Dr. Mohammed Al-Jahani. Dr. Jahani is the CEO and founder of Taibah Medical Care Company, is a visionary leader in the fields of home healthcare and medical tourism in Saudi Arabia. With an impressive portfolio of qualifications including an MBA, MHA, PMP, KPIs, RM, Dr. Al-Jahani combines academic knowledge and extensive practical experience. He's a strong advocate for patient-centric care. Dr. Al-Jahani aims to position Saudi Arabia as a premier destination for medical tourism, in line with the goals of Saudi Vision 2030 to enhance the quality of life and public health.
Thank you, everyone. Thank you, ladies and gentlemen. Receiving this award, it's such an honor. Thank you very much for the organizer. Thank you very much for the attendees. Thank you very much for the trust. I am Mohammed Al-Jahani, the CEO for Taibah Medical Care Company. We are working with home healthcare and wellness and medical tourism in Saudi Arabia. You can find my information in the LinkedIn, and anyone can contact me. And I appreciate your attendance today, and thank you very much. Thank you.
Thank you, sir. Congratulations. Up next for the Health 2.0 Conference Visionaries Award, I'd like to welcome Dr. Mariam Maza to the stage. Dr. Maza, are you in the room? No, we'll skip over that one. For the next award, Excellence in Healthcare Award, I'd like to welcome Nada Abdullah Al-Wabel. Nada Al-Wabel is the Director of Materials Project at the Ministry of National Guard Health Affairs. Is she in the room? Nada? No? All right, we'll skip over that one. For our next award, the Health 2.0 Conference Visionaries Award, I'd like to welcome Nate Zelensnik. Are you in the room, Nate? Yes, you are. Very nice. Nate is the founder and CEO of Integrated Ascension Method. He's uniquely recognized as one of 2 American master trainers in the ancient Indonesian energy, fitness, and martial arts system, blending his cutting edge practice with the contemporary biohacking and technology through his groundbreaking Integrated Ascension Method and White Dove Method. Celebrated on Netflix, Gaia, and Amazon Prime, Nate's work positions himself as a transformative leader in harnessing extraordinary human potential and guiding global holistic wellness.
Thank you very much, and thank you very much to the Health 2.0 conference. For the past 25 years, I've been so blessed to steward an ancient royal system of breathwork, meditation, energy development, fitness, and human potential that was passed down for 500 years in Indonesia, and I became the very first non-Indonesian allowed to learn this. I did this in order to bring a new form of wellness to people, no matter what their budget was, because believe it or not, every single person who has ever lived breathes, and it's free. But it's also the most important biological function that we do. Just try going for 3 minutes without doing it. But just like exercise, if you say exercise, exercise is not just exercise. You can walk around your block, but you could also train for a triathlon. They are very different forms of exercise, and the same thing goes with our breath. So when we're able to harness our energy in a very certain way, we're able to do things that a lot of people consider to be impossible. But we make them I'm possible. And so after 25 years of helping people all around the world, leaders, visionaries, professionals of every single walk of life, I'm so honored and pleased to be here right now. Thank you very much. I look forward to continuing my work, much larger scale. I appreciate everything that you're doing, and it's an honor and a blessing to be here. Thank you.
Thank you so much. Sounds fascinating. I'll find you later and we'll have a chat. All right, up for our next award, the Health 2.0 Conference for Outstanding Organization Award. Polly Amira specializes in developing cutting-edge antimicrobial technologies to address the challenges posed by multi-drug resistance, extensive drug resistant and pan-drug resistant pathogenic microorganisms. Focused on the innovative solutions, the organization aims to combat these critical threats, advancing healthcare and safeguarding global health through its expertise in antimicrobial advancements. On behalf of the organization, we have Mr. Saurav, that's you, sir, to receive the award.
First of all, I like to thank everybody for the wonderful energy and inspiration of the thoughts here in the conference today. As an organization, I'm representing the organization for the South Asian markets. Polymina Nanotech, proudly to be mentioned as world's first organization to have a residual 7-day claim. We develop sustainable solutions, which is a transparent coating technology which can sustain onto the surfaces for close to 3 months, and you don't have to use any regular harsh disinfectants to clean the surfaces, and your surfaces are protected. So that's how we believe into save lives by making people safe altogether into advancing of the healthcare altogether. Thank you for your time.
Prevention is better than cure, right? Up next for the Health 2.0 Conference Outstanding Organization Award, Rapid Healthcare Supplies LLC is a premier UAE-based group purchasing organization specializing in healthcare procurements and supply chain solution. Committed to excellence, Rapid provides innovative services to optimize operations, reduce costs, and ensure quality. With a focus on strategic partnership, it empowers healthcare providers to deliver exceptional patient care and operational efficiency. On behalf of the organization, we have AJ Punjabi, the Associate Director of Procurement, to receive the award.
On behalf of RAFED, I'm pretty much very proud for obtaining this award. We are as strong as our teams, and we have wonderful people working for RAFED. Thank you again for awarding us, and hopefully to many more. Thank you.
Up next for our Excellence in Healthcare Award, I would like to welcome Dr. Robert Andoska. Dr. Andoska is the CEO, CTO, co-founder, and president of Invisa Health. His work supports healthcare, fitness, and safety across sectors like military and assisted living through advanced sensors and AI. Holding a PhD in material sciences, he's published researcher with over 214 citations. Is Dr. Robert in the room? We've lost him. He was here. Moving on to our Excellence in Healthcare Award, Dr. Sahar Abbas Jadala. Are you in the room? Yes, there she is. Dr. Sahar Mohammed is an emergency register, holds an MBBS for the University of Medical Science and Technology, Sudan, and an MRCEM from the UK. With additional diplomas and certifications of infectious diseases and advanced life support, Dr. Mohammed has led emergency teams across Sudan, Saudi Arabia, and the UAE, specializing in intensive care and surgical departments. She's actively chairs the conferences for the UCG group in the US and Dubai, emphasizing innovation and medical practices.
Hi, this is Dr. Sahar. I'm really honored being identified for my leadership skills. Thank you very much for Health too. I just have to say so many thank you today, and also I want to share with you why I am passionate about education, about emergency, how I become a public speaker and sharing conferences. Actually, the first thank you, I'll give it to my parents. I'll give it to my father. Because for my early childhood, he taught me how to speak loudly and how to express myself. While I was a child, he used to make meeting in the house, inside our house, like every week. We should sit together, we should discuss together. Every single person in the house should come and express his thoughts and discuss his problems. So he created this, being proud to speak and discuss since I was a child. So please, can we clap our hands for my father first? And also for my lovely mother, who was always supportive for me during my journey, of course. Can you clap our hands for her as well? Thank you very much. Now, I do believe I am a person who never believes in limitation, who never believes that there is no time to do something. He never used the word no. I can't. You always should believe in yourself. You always should believe in your abilities. You always should believe that whenever you think about something, you have to do it. Now, another thank you for so many people who supported me during my journey. One day I was working in Al Ain Hospital. Then I was working at the GP at that time. So my consultant, Dr. Sabir, in Al Ain Hospital, thank you very much, Dr. Sabir. He came to me and he told me, Dr. Sahar, I have presentation tomorrow in Abu Dhabi University. It's about H1N1. Please, can you go and present tomorrow? So I told him, Dr. Sabir, are you talking to me? So you believe I can go and present? He said, yes, I believe in you. So I went there, I presented, and it was a great presentation at that time. That's what the feedback. This is the first thank you for Dr. Sabir. Then, how I become a public speaker? Of course, it started from home, as what I told you, by the support of my parents. Then one day I received a call from the ECG conference. Dr. Sahar, please can you go to USA and give a speech? Should I go there? I never been there before. So okay, then I went there, I presented the speech. Then the next conference, they told me, please, Dr. Sahar, can you share our conferences? So far, I shared more than 5 conferences. I gave more than 6 speeches. So why I decided, and apart from what they mentioned about my background, I'm also doing master's degree in education for Warwick University. Why I decided to be a teacher as well? Because whenever I see people who don't believe in their abilities, who cannot achieve, who they believe that they cannot do this, they cannot do that, I felt very bad for that. So I decided to lead, I decided to teach, I decided to support. Because the thing is, if you will wait for the time while you will be ready to do something, it will never come. You know, our achievements always comes under stress. You have to force your brain to do things. You have to let your brain adapt to the situation, not the opposite. I'll tell you something. You know, how I did arrange to come here. You know, the team, they know how they had a hard time because of me, because I was trying to arrange myself. I was trying to arrange my time to be able to come here and stand here in this stage. So one of the things that was challenging for me, that I'm not ready, I don't have, you know, I didn't prepare myself. So I went to the souk or the market, then I told my tailor, please, in one day, I need a jacket and I need a shirt. And this is a material. So he was telling me like, are you serious? Yes, I'm serious. Then he told me, okay, I can arrange for you only the blouse or the shirt, but nothing else in one day. Then I went to the next tailor. So I gave the materials to 3 different tailors. I told them I need 2 jackets and 2 trousers and a shirt. And it was, and this is, you know, this is what I have. Woo! I consider this was an achievement. When one lady here, she told me, oh, I like how you're dressed today. So it was done, right? So the point is, you will never be ready to achieve. So you have to keep on moving. Don't limit yourself. Don't limit your thoughts. You have to always overcome challenges. So again and again, thank you very much for this. I'm very honored, and this will make me do more and proceed further. Can I request my family to come here? I'm really interested to have them here for a picture. Is it possible? Yes, please. Thank you very much.
If we're gonna have Mama and Papa come to the stage, please. Tal.
Really, this is my first Excellence Award in this field, and I really was honored to have it, and I want to share it with my parents. And I want to achieve more and have more Excellence Awards.
Congratulations, Dr. Saha.
husband, who was very supportive, because I have been involved in different conferences, traveling along distances, keeping my kids with my husband
who was very, very supportive and are really motivative. Thank you very much. She's over there.
You don't want your award?
Thank you.
So excited, so excited. Congratulations once again. All right, ladies and gentlemen, moving on for our Excellence in Healthcare Award, I'd like to welcome back to the stage University Professor and Dr. Tobias Rinkler. Professor Rinkler, MD and PhD, is a senior orthopedic surgeon and professor in the regenerative orthopedics and traumatology at Charité, Berlin, and Berlin Institute of Health. He's the founder and the executive board member of the Advanced Therapies in Orthopedics and Foundation. As coordinator of multiple EU consortia, he researches cell therapies and muscle injuries for chronic inflammation in osteoarthritis.
Thanks a lot. I want to dedicate this to my team from the clinics, of course, and from the Advanced Therapies in Orthopedics Foundation, the ATIO, which we built up over the last now 5 years, and where we try to get advanced therapies, which are cell, gene therapies, smart biomaterials, smart implants, into the market as soon as possible and to patients as soon as possible. This is a large international endeavor that has a great impact with a lot of partnerships that we already established, and the team is working like hell for that, so I want to thank them with this award. Thank you.
Thank you, Doctor. Up next for Outstanding Organization Award, Yokohama Counseling Office is dedicated to improving mental health in Japan through counseling. Committed to helping clients reduce concerns and achieve their goals, Yokohama Counseling believes in the transformative power of counseling. And on behalf of this organization, we have Dr. Abby Robin Durkin, Vice President, to receive this award. Dr. Abby Robin, are you in the room? No? All right, we'll move on. Up next for the Health 2.0 Conference Visionaries Award, I'd like to welcome Yusuf Hutblut. Are you in the room? Yes, he is. Yusuf is the CEO of Kilimanjaro Management and Consulting BV. He's a visionary leader in lifestyle medicine and preventative healthcare. Also the founder of Leefsted Hub, he is redefining how we approach health and well-being. With a deep commitment to evidence-based lifestyle interventions, Yusuf inspires both individuals and healthcare professionals to embrace sustainable, impactful change.
I would like to say a big thank you to the Health 2 conference, and a big thank you to our team back home who's working day in, day out to develop preventive programs for people with obesity and heavyweight loss programs. So I would like to say a big thank you to them for all the years that we've been busy doing this, and this award is a great achievement for our teams back home. Thank you once again.
Thank you. All right, I'd also like to welcome back to the stage for this next award, the Health 2.0 Conference Outstanding Organization Award for Little Wins. Little Wins is a pioneering online platform dedicated to empowering individuals with disabilities by connecting them to essential resources, adaptive equipment, and a supportive community. With a mission to simplify access and promote independence, Little Wins creates opportunities for meaningful connections, enabling users to overcome challenges and celebrate victories in daily life. And of course, on behalf of the organization, we have Lexis Noel Sereau, founder and CEO, to receive this award.
fourth grade teacher could see me right now. She told me that I'd never amount to anything, so shout out to that lady. Unbelievable. This is crazy. I'm not going to cry. I might a little, but Outstanding Organization Award. This started as just a thing that everybody told me was a ridiculous or crazy idea. And I heard you, Buddy Health, on the whole like startup life, right? You gotta love it more than anybody else and really believe in it. And I have an excellent, very small team of people who believe. And we stay up way too late and get up way too early, and we do it for nothing because we believe that someday we're gonna fill these shoes. Someday. And I will never stop trying until I feel like I am that outstanding organization. Thank you so much for your time, and thank you for being so inspiring to me. I didn't cry. Thank you, guys.
Thank you for sharing your inspiring story with all of us. And finally, ladies and gentlemen, our last award for the day for excellence in healthcare, I'd like to welcome Dr. Cindy Yambo. Dr. Cindy Yambo is the medical director and functional and integrative medicine doctor at Sundari Polyclinic. With over 20 years of experience, she is not just a healthcare provider, but also a visionary leader committed to transforming wellness in Dubai. An experienced healthcare consultant who successfully established 3 wellness clinics right here in the UAE. She is dedicated to creating a movement that promotes wellness for the entire population, aiming to positively transform lives.
Been invited to Health Point 2.0 to receive this award. It means a lot for me because I've been working really hard since I moved to the UAE 13 years ago. So originally I'm from Belgium. I've been working there for 10 years, and then I reached the UAE 13 years ago. And then I learned everything on the spot. I'm very grateful for the opportunities we have here. I was able to become a clinic leader and then later on establish successfully 3 clinics. And I'm very grateful for this opportunity. So through the challenges I went through, I was able to develop more confidence and develop more skills. And right now I'm very happy for where I am, and I wish to learn even more, become even better, because at the end of the day, as a doctor, the goal of each doctor, I believe, is to be able to spread health throughout the world, and this is what I'm trying to do. Thank you so much.
Thank you. Dr. Cindy, I'm going to ask you to stay here, and I would like to invite all of the award winners onto the stage so we can take a group photo. So everyone who has awards, please make your way to the stage as we make a lovely group photo. A very big congratulations to all our awardees. Your work inspires all of us to continue striving for excellence in healthcare. Let's give everyone and each other a massive round of applause. All right, ladies and gentlemen, now as we wrap up today's session, this is the end of day one, but don't worry, there's another 2 days of all the healthcare conference that you can get. Now, looking on to our next conference, which is going to be happening in Las Vegas, which is scheduled for March 4 to 6th, 2025. You can make your way over to the 2.0 conferences exhibit booths next to the registration desk to get all the relevant information and make sure that you get your spots booked and to ensure that you don't miss out on any future offerings. Now, before we close the day, I'd like to say a big thanks to our gold sponsor, Invisa Health, and our bronze sponsor, Team Up Core. So let's keep the energy alive this evening. Let's keep sharing ideas, exchanging stories, and make the most of this beautiful, vibrant city. I cannot wait to see you all tomorrow. Have a fantastic evening, and we'll be back here tomorrow, same time.